You are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce born top-notchers and thousands of born passers across professions.
Today, let's discuss region.
In dynamic, innovative, and interactive review delivery, ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review, and celebrating victories together as one family. What you choose today determines your success. So make that powerful decision.
Welcome to the top.
Choose to be the top with top rank.
So one thing na na-help sa'kin ng top rank talaga is that confidence. Nung pumasok ko, yun talaga yung hinahanap ko sa top rank, eh. Kasi I always question myself and yun yung nagiging breaking point ko lagi. Imagine all those exams na every time na sobrang hirap, you try even harder. Tapos next exam, mas mahirap ulit. So you try harder again. So by the time na mag-PNLE na, parang, okay, give it to me, I can do it.
Very holistic po sila approach. Hindi lang po mentally, ano rin po sila sa physically, spiritually, and emotionally po. Tulad po sa stress management na po.
Sa top rank kasi na-realize ko, there's so much more to learn. Every single day na nakaupo ko sa harap ng lecturer sa top rank, they've given me knowledge na nakuha nila from their experiences as nurse. Iba kasi yung top rank, parang pag naririnig ko siya, very, very welcoming. Tapos, yung lecturer is very engaging sa students. And then, ayun, parang everybody really cared na kailangan makapasa tayo. Nagmo-motivate kami sa isa't isa. And then, ayun, basta pag top rank, iba talaga siya. As in, ibang level. So, never ako nag-regret na nag-top rank.
Naniniwala po ako na lahat ng student may potential. Top rank was there to harness me to the fullest extent of my abilities. From giving me top-notch lecturers, top-notch materials, environment, it never came short of providing me what is the best there is for me to improve myself and to help me achieve this goal.
Top rank po kasi mag-e-enjoy ka talaga. Ang naging review ko po sa top rank is fun, enjoyable, habang natututo ka ng maraming learnings. So, minsan gigising ako in the morning, parang tinatamad ako, bad trip ako, ganyan. Then, ma-realize ko, ay teka, funny yung prof ko ah. Parang gusto ko ma-enjoy tong araw na to. So, ang gagawin ko, papasok po ako ng top rank. Then, uuwi ako, good vibes na ako. Ang dami ko pang natutunan.
Out of everyone na nag-take nung board exam, ako po yung top 1. Hindi pa rin po nagsi-sink in totally. Bale yung mom ko po yung pinaka-inspiration ko po. Kasi, siya po yung reason kung bakit gusto ko po maging successful.
Sobrang proud ako na hindi ko ma-express yung feelings ko kung ano yun. Na hindi nga, that night hindi ako nakatulog. Pero ngayon, the same pa rin, para pa rin akong naka-float. Akala ko sa TV ko lang mapapanood. Naranasan ko pala ngayon na kahit sa kabila ng mga experience mo ng mga hardships, meron din pala talagang hope na pwede kang mag-top top of all.
Thank you po.
Ha?
Thank you. Hindi ko po din akalain na magto-top 1 ako, pero sa tulong po ng top rank, nakamit ko po.
Dear Lord, we thank you for the gift of life today. You allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now and the victory is near. Excellence is our only standard to outshine the rest. With a great mind and compassionate heart. Our home that trained us to be the best we can be. All that we learned at Top Rank Review Academy. We shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learned that if you want to top rank, if you got it, soar to the sky.
Hi, top rankers. Andyan kayo? Andyan. Magandang umaga sa inyo lahat. Ayan. Sa mga stable ang internet connection, pa-open naman po ako ng inyong mga video. Ayan. Yan, no? Yun, no? Thank you for opening your video, Valila. Ayan, si Justin, no? O, wala na bang susunod kay Justin? O, ayan, simulan na rin si Narciso. Nag-aayos pa ng buhok. O, si ano din, si Gumilan. Mukhang parang nagulat. Kailan ko mabang bukas ng video talaga? Totoo ba? O, ayan, o. Ito rin si Anastasia. O, ayan. Sa mga nag-open ng video, ito yung top 4 natin sa board exam. Ayan. Kasi yan yung mga nagbukas ng video. O, yung iba dyan, habol pa. Habol na. Dali. Ayan. Okay? Kamusta kayo? Kamusta naman? Kamusta top rankers? Good morning po sa mga kapapasok lang. Magandang umaga sa inyong lahat. Ayan. O, kamusta kayo? Kamusta ang review? Sino to si iPhone? iPhone? Palit. Yan na ba ang pangalan mo ngayon? Rename tayo ha. Ayan. Good morning. Ayan na. Ulitin ko sa mga stable lang internet connection. Buksan nyo naman ang inyong mga video. Bahala kayo. Ang magsinungaling na mahina ang internet connection, bahala ka. Tandaan mo, digital ang karma. Hindi, joke lang. Okay? Ayan. Kamusta? O, ang reply dito, puro ok. Good morning po. Ang tanong ko, kamusta kayo? Gamitin ang chat box. Kamusta kayo? Kamusta ang review? Kamusta ang total? Kasi almost matatapos na kayo for refresher. Kamusta naman? Okay naman po, sir. O sige, okay. At tanong, natuto ba? May natutunan ba? Ayos na ayos, sir. Yes po. Learning po. Sige. Okay? Okay po sa learning po. Okay? O, kamusta naman tayo sa mga naging lecturers ninyo? May concern ba tayo? Learning po, sir. Okay po, sir. Hindi po ako makapag-open ng cam, sir. Nasa biyahe. O, sige, walang problema. Kung nasa biyahe, mag-iingat ka, ha? Okay? Sige. Wala tayong concern sa mga lecturer? Sure tayo, ha? Any concern? Meron ba? Sige, kung wag mo sabi kahit i-PM ako personal. Sir, ayan na, may nagtanong na. Sir, pwede po ba? Wait lang ha. Magagaling po ang lecturers. Wait lang ha. Sir, pwede pa po ba habulin yung mga exams hanggang bago mag-intensive? Opo, pwede po. Naka-open lang po ang lahat ng exams natin kasi naiintindihan ko naman yung iba ay working. Kailangan bago matapos ang intensive, bago dumating ang pre-boards or yung tinatawag na pre-intensive exam, kailangan natapos mo lahat ito. Yun yung deal. Okay? Walang problema. Sir, marami yun. Kung nakakatapos siya everyday, kung everyday mo siyang ginagawa at sinisingita mo siya ng oras, dahil basic anong mga nakaraan, naiintindihan ko kasi nung nakaraan, dahil holiday season. Hindi kami naging masyadong mahigpit doon kasi nauunawaan namin kayo. Gusto niyo rin mag-enjoy during holiday season. Pero tandaan nyo, tapos na ang holiday, tapos na ang Pasko, tapos na ang New Year, tapos na ang Nazareno. Okay? Sir, may paparating pa yung Feb 14. Huwag ka mag-alala. Wala rin namang mangyayari sa Feb 14. Magre-review ka. Okay? Mahalin mo ang lisensya mo. Yun ang unahin mo. Okay? Hindi. Joke lang. Okay? Ganito. Lahat ng materials nandyan pa. Habang nandyan pa, sagutan mo na siya. Dahil once na nilak na namin yan, wala na. Malinaw po? Malinaw? Sige. Sa mga nagtatanong regarding sa tuition fee, di ba meron na kaming sinesend na link? Doon kayo magtatanong sa Wela. Okay? Kasi ano po siya, hindi namin alam ang rate ng bawat isa sa inyo. Kasi syempre baka mamaya yung iba naka-avail lang promo or discount. So hindi namin mabanggit ano yung fixed rate ninyo. Para malaman nyo yung rate ninyo for the tuition fee. Yung sa Wela, Ma'am Bel, may isa-send ako sa'yo. Paki-forward to rito siya. Paki-post sa top rankers, wait lang isa-send niya. Pag may concern kayo regarding balance tuition, ito yung isa-send talaga. Wait lang top rankers. Ayan. Ma'am Bel, paki-post ito. Ayan. Ipopost ni Ma'am Bel. Pag may mga concerns regarding dyan, tuition fee, magkano yung, sir, hindi nag-a-appear sa akin yung matriculation, dyan nyo isa-send talaga. Okay? Kasi kami nila Ma'am Bel talaga, regarding accounting department, hindi namin siya masasagot. Pero pwede namin kayong tulungan, kumonect sa kanila. Halimbawa, nag-send ka na dun sa Wela, sabi mo, sir, 3 days na. Usually kasi 3 days yan para reply. Hihintayin yung 3 days para mag-reply sa inyo. Yun talaga kasi meron kami tinatawag na 24 to 48 hours sa process niyan. Pag ika-third day wala pa, that's the time na pwede niyong balikan si Ma'am Bel, ganito pa rin concern ko. Pwede po ba? Tulungan mo ako? Yun, i-connect din kayo ni Ma'am Bel dun sa accounting department. Okay po? Kasi si Ma'am Bel ang teaching assistant na makakasama nyo rito for the review. Okay?
Sir, may common concern po sila halos lahat. Na karamihan, sir, invalid po yung wela nila.
Kung invalid ang Wela, ano yan? Ang invalid sa inyo, email tsaka password. Tama? Kung email at password, message kayo kay Ma'am Bel or Ma'am Bel, mag-post ka dun sa G-Classroom natin nang may mga concern na hindi maka-open ng Wela. Then kukunin natin, dadalhin natin yung mga names nila dun sa tech support para i-update yung mga accounts nila.
Yes, sir.
Ayan. Ayan. Sige. Huwag kayong mag-alala. Tutulungan namin kayo nila Ma'am Bel dyan. Connect lang kayo kay Ma'am Bel, ha? Tapos tutulungan namin kayo para yung iba nyong concern ay masagot. Okay? Chinese New Year pa, sir. O, kita mo, may humabol pa. Gusto mo mag-celebrate? Sige. Sige. Okay lang po ba ulitin yung exam, sir? Ganito siya. Makinig, regarding the exam. Walang problemang ulitin mo yung exam. Ang concern lang namin, ganito siya. Para maintindihan mo. Di ba ang exam ay naka-G form? Tama? Sa mga nakabukas ng video, ganun lang kayo. Para na alam ko nakikinig kayo. Okay, gagano na kasi nakikita ko lang yun sa taxi. Okay? Joke lang. Okay? Ganito siya. Ang concern ko sa exam, sa G form kasi siya. Hindi siya, pag in-exam mo kasi siya, kung ano yung unang exam mo ng number 1, hanggang pag-exam ulit, yung pa rin yung number 1. Hindi siya nagja-jumble. Correct? Ang concern ko lang, baka mamaya, imbes na maintindihan mo siya by heart, ang maging mangyari, mamemorya mo lang siya. Magkaiba kasi yun eh. Magkaiba yung namemorya mo lang dahil parati mong sinasagutan at naintindihan mo siya by heart. Kung ganito siya, kung may mga post-test exam kayo, printable naman yon. Mag-print kayo ng student copy. Tapos sagutan nyo siya. Paano? Kung ang pag-exam mo noon ay 1 to 10, pag binalikan mo ulit yung exam, sagutan mo siya from number 10 papuntang number 1. Baligtarin mo. Okay? Or, simulan mo kay number 5, 10, tapos 4 to 1. Kailangan ma-jumble mo siya para maintindihan mo, para malaman mo kung naintindihan mo talaga siya. May tendency kasi na pag naulit yung number 1, yung 1, 2, 3, ganun ka magsagot, ang pagkakataon, yung pag numbers 1 to 5, memoryado mo lang siya. Hindi mo siya naintindihan. May ganung concern. Not all, pero may pwedeng maging ganun yung mangyari. Nakuha ako regarding doon. Yan ha. May nagbukas ng camera, si Rochelle. Pero nagpatay din saglit. Nagpatay din agad. Kita mo kumakaway siya ngayon. No? Ayan. Kuha tayo dun ha. Ika nga ni Donalyn, bahala kayo dyan. Ayoko lang ganyang issue, bahala kayo dyan. Okay? Yan. Sir, ito na po ba yung Google Classroom for pre-intensive? Lahat, yung Google Classroom nyo, yun pa rin pagdating ng intensive phase natin, same Google Classroom, hanggang final coaching, same Google Classroom lang tayo. For the pure online. Okay? Hindi kayo malilipat. Diyan lang kayo. Mawawala lang kayo sa Google Classroom kapag hindi kayo nagbayad. Okay? Okay? Biro lang. Ito na naman. Grabe ka naman, sir. Minsan na nga lang tayo magkita. Nagbanggit ka pa ng tuition fee. Hindi. Biro lang naman yun. Basta regarding tuition fee, hindi naman kasi sa amin yun eh. Okay? Justin, siguraduhin mong tubig yung iniinom mo ha. Baka mamaya lakas tama ka dyan. Okay, joke lang. Okay? Ayan. Sir, may pre-intensive phase pa po ba? Hindi. Mukhang kapapasok lang nito. Makinig. Ganito siya. Ang pre-intensive, ay yun yung exam. 500, di ba may tinatawag kaming pre-board exam? Ang tawag kasi namin, sa 500 items nyo, after ng refresher phase, ay pre-intensive exam. Yun yung 500 items. Nasasagutan nyo sa loob ng 2 araw. O, ayan ha. Ginawa muna naming 2 araw. Pero sa mga darating na mga araw, yung 500 items no, sasagutan mo lang ng 1 day. Be ready. Kaya nga intensive eh. Intense. Ngayon, ang fresh nyo pa rin, oh. Tingnan mo, patapos na yung refresher. Ang fresh nyo tignan. Tignan ko lang pagdating ng intensive. Magkakaalaman na talaga tayo. Okay? Okay? Ayan. Natatawa sila. Okay? Ayan. Wait lang ha. Magbabasa lang ako ng mga chat ninyo. Sir, yung hindi na po nagre-respond yung sa Wela po. Sige. Ino-note ko to ha. Hindi na po nagre-respond. Baka naman sige. Noted ito. Papacheck ko ito. Okay? O, ayan ha. Noted ito. Noted. Sir, hindi naman po maapektuhan yung promo kasi late na. Regarding dyan, hindi ko rin to masasagot. Pero ang alam ko, dapat before matapos yung promo, nakapag-payment ka. Yun yung, yun yung, may binigay sa inyong, tawag ito, di ba, parang time frame kung kailan nyo kailangan nyo siyang masettle or ganyan. Ayun, ipakitanong na lang po iyon. Meron, regarding Wela, itong concern na ito, i-raise ko to. Yung regarding sa Wela. Sige. Ayan. Noted ito. Sir, until now, wala pa update sa matriculation ko last December. Make sure, ganito lang siya. Basta, alam mong fully paid ka, tapos hindi pa nag-update sa Wela at nakapag-message ka na doon sa general instructions, go lang yon. Basta alam mong fully paid ka. Kasi pag naman, magme-message ulit sa inyo ang accounting department para naman mag-update eh. Kapag hindi, ganito, magme-message yan sa Google Classroom ninyo, yung accounting department, magre-remind sila ng tuition fee payment. Or ipip-PM ka by email. I-message ka by email sa email mo. Kapag hindi ka naman naka-receive ng email na nakita mo, nag-post na doon na kailangan magbayad na kayo, tapos hindi ka naman naka-receive, or di ka naman pinarsenal, ibig sabihin nun, good ka. Magno-notice naman yata, ang alam ko magno-notice naman sila through Wela or through your email. Kuha tayo. Kuha. Sir, kailangan po. Kailan po start ng intensive review? Ang start ng intensive review niyo ngayon, wait lang, check ko lang ha. Hello. Tentative date, be ready kasi patapos na pala talaga kayo. Tentative nyo will be on January 30. Start na kayo ng intensive. Tentative date na yan ha. Tentative. Pero magre-reconfirm naman kami kasi nagpo-post naman kami ng schedule ninyo. Okay? Okay po. Sir, during lecture po, di po ako nakakasabay sa pacing ng pag walang handout. Kasi sometimes po kasi PowerPoint type siya. Kaya di ko po ma-print. Ganito, regarding sa concern na yan, gaya nga po ng sabi namin regarding sa materials talaga, may mga lecturers talagang hindi talaga sila nagbibigay agad ng handouts. Di ba nabanggit naman ito ng orientation? Minsan talaga, magbibigay sila ng handouts after ng lecture nila. Sir, paano yung naka-PowerPoint? Di ba? Pag binigay naman sa inyong naka-PowerPoint, pwede naman siyang i-convert into parang slides. Then, pa-print mo na lang. Ganun siya, ha? Okay? Okay po tayo? Top rankers, paalala ko lang, malapit na matapos ang ating refresher phase. Paghandaan ang pre-intensive exam. Okay? Yun yung pinaka makikita natin kung anong feedback nito or kung anong result ng inyong refresher phase. Doon natin makikita. Okay po? Sir, good morning po. Saan po ako pwede manghingi ng follow-up about sa requested certificate of enrollment po? Paki-message po paki-check yung email mo. Kung nabigay mo na tong request na ito, paki-check ang iyong email. Check mo baka mamaya hindi pumasok sa spam sa inbox, baka nasa spam or junk. Kung wala pa din hanggang tomorrow, follow up ka kay Ma'am Bell para ma-follow up yung certificate of enrollment mo. Okay? Sige. Yung exam, naka-open lang hanggang bago kayo mag-pre-intensive exam. All exams, okay? Evaluative at post-test ninyo, naka-open lang siya hanggang matapos, hanggang bago kayo mag-pre-intensive exam. Okay po? Yan. Okay tayo? Okay na po? Feeling ko yung iba dito nakapasok lang pero wala pa. Nag-aalmusal pa. Okay? Itong tatlo lang talaga to na nandito. Okay? Ade, marami naman reply. Ayan. Top rankers, paalala lang po. Pag may lecture, make sure na nagbubukas kayo ng video. Malaking bagay sa lecture na nakikita kayo. Kasi pag nakikita, minsan kasi tinitignan nila kung ano yung mga, kung nakikita nila kasi sa mga mukha ninyo kung naiintindihan nyo o nalilito kayo. At pag may tanong kayo sa lecturer, huwag kayo mahihiyang magtanong. Mag-message. Personal PM nyo siya. Okay? Maliwanag? Kasi uulitin ko, malaking bagay sa lecture na nakikita niya kayo. Ang hirap kasi naman talagang mag-lecture or magsalita sa Zoom nang wala kang nakikita. Yung nakikita mo puro lapida. Okay? Ang hirap talaga nun, sa totoo lang. Okay? Okay? Ayan ha. Tsaka pag walang magagalit. Alam kong online kayo. Sure, kaya nga ako nag-online, mag-invest ka sa internet connection mo. Okay? Ang laki naman na natipid mo eh. Okay? Kasi hindi ka nagtatranspo. Di ba? Yung baon mo, doon siya pinamili lang ng nanay mo. Joke lang. Okay? Ganun siya. Malaki ang natipid mo ngayon kasi talagang sa totoo lang, matipid tong pure online. Kaya kahit paano, para maganda maging connection mo, mag-invest ka through your connection. Kuha? Sige. Okay? Okay tayo? Wala nang concern? Wala na? Okay na? Okay? Sige. Maraming salamat, top rankers. Mag-iingat kayo. Salamat po. To top the board exam.
Morning, everyone. Good morning po. Hello? Hello? Naririnig po ba ako, guys? Ayan. Okay. Sige. So, can you see my video? Malinaw po ba yung video ko? Okay. Can you hear me at this level of voice? Volume of voice? Or kailangan ko pang lakasan? Baka kasi pumiyok tayo dito pag nilakasan ko agad. Ayan, sige. Good morning everyone. Before we start, I am seeing new faces. Okay, so parang feeling ko ngayon lang ulit tayo or ngayon lang tayo talaga magkita-kita. So can you introduce yourself? Can you show me from which schools are you po? From which schools are you? Sino yung mga schools na kasama natin today? From BPSU. Anong school po ang BPSU? Yan. Medyo mahina po ako sa acronyms. Anong school po yung BPSU? Wow, andito yung mga taga UP Manila. Okay. From different campuses. Meron taga Palo, tapos meron ding taga yung main campus na UPM. Hello po. Palawan State U. Bataan Peninsula. Okay. From Samar. From PLM. Hello, good morning po sa mga taga PLM. From St. Alexius College. Yeah. From University of Pangasinan. UPA. Okay, good morning everyone and Happy New Year po and Happy Friday the 13th. Yan. Sino nagsasabing malas ang Friday the 13th? Swerte tayo today, okay? Because we get to learn new information and knowledge and apply it to our upcoming board exams. Okay, so let me share my screen. Happy payday! Ay, sa iba, payday na. Sige, congrats. Let me share my screen now. Wait lang. Yun. Yan. Kita niyo po yung screen? Kita niyo yung screen, guys? Anya, I know! Yan, sige. Yung meron pong stable na Wi-Fi, may I request those students, people, baka naman kailangan or gusto nyo kong sabayan sa pag-open ng cam para magkakakitaan naman po tayo. And if yung mga students na unstable yung Wi-Fi, okay lang yan. Pasok na lang ulit kayo in case of disconnect. And maging active na lang po sa chat. Kasi since parang walang naka-open cam, yung portal natin, yung chat box, okay? Pag nawala yung chat box, wala na. Hindi ko na kayo makagive up, guys, okay? Sige. Ayan, thank you po sa mga nag-open cam. Para naman ma-feel ko na magkakasama tayo dito. Okay? Sige, so let me introduce myself now. My name is JD Rojas. I am a graduate of University of the Philippines, Manila. I am a graduate of UP Manila last September 2020. And I took my board exams last July 3 and 4, 2021. Okay, so oh my God, tuwatanda na tayo, guys. Ako lang pala. Ayan, and fortunately, we passed and topped the board exams. I placed 7th on the boards. And this is a high time for me na ipasa na ang corona sa inyo, guys. Kasi marami pong wonders, marami pong magic ang corona sa pagiging top-notcher, okay? Etong corona na ipapasa ko, guys, okay? Customizable to, guys, okay? Nati-tailor fit to, guys, okay? Pag natanggap nyo yung corona, kayong bahala kung anong top yung gusto nyo, okay? Kasi yung akin, 7, okay? Pero kayo, kung gusto nyo top 1 right away, why not? Go lang, okay? Yun yung goal natin, right? Top 1 agad-agad, okay? Sige. Wait, ano nangyari? Ayan. I worked at, first work ko was, I was at an NGO. We were part of the active case finding ng tuberculosis sa different workplaces, sa private sector, sa public sector even. And then I worked at the hospital, one of the public tertiary hospitals here in Manila, and now I'm here in Top Rank. Okay, so guys, to formally start this lecture for this morning, few reminders lang. Okay, ang first morning break natin would be at 10:30. So that's a 15 minutes break. So that's 10:30 to 10:45. Okay, then I'll give you your 1 full hour of lunch break. So that's from 12 to 1. Tapos yung afternoon break natin, mamaya na, mga 2:30 na yun. Okay, or kapag oversaturate na yung brain cells natin. Okay, if you have any questions, please feel free to interrupt me, guys, and sasagutin natin right away. Okay, if sakaling hindi ko alam yung sagot or hindi ako masyadong sure because I wanted to give you the best answers, ipapark natin yung question natin tapos babalikan ko kayo. Okay, ayan. Ano pa ba? Yun lang naman. Yun lang naman. Sige guys, pa-type naman na ready na. So alam ko na ready na tayo guys. Pa-type naman na ready na. Yeah. Uy, narinig ko patapos na daw yung refresher. Kamusta naman kayo so far? Intensive, going intensive na pala tayo. Ayan. Sige, papunta na kayo sa exciting part. Ayan. Syempre dapat carry pa. Wala pa to guys. Refresher pa lang to. Oo. Pagdating nyo sa intensive, yan. Tatagan natin ang loob natin. Okay? Sige. Today, I am tasked to discuss with you all about IMCI and communicable diseases in the afternoon. Okay? So, one whole separate lecture yung communicable diseases. Okay? Show of hands. Kung sino dito yung natackle yung IMCI no college? Napag-usapan naman yung IMCI sa inyo no college? I think around second year ata. Second year. Yun, no? Okay. Pero yung IMCI kasi is in passing lang, pahapyaw lang. Parang 2 to 3 days lecture lang sa buong college life natin tapos goodbye na. 'Di ba? Kaya yung iba medyo nahihirapan mag-review, okay, mag-aral ng IMCI kasi medyo kalat-kalat pa yung knowledge nila about this concept, okay? I am here now. Charot. Okay? No, ako po yung nagre-review nito before. Okay, ako yung nagre-review nito before. Okay, I classified this concept under pedia concept. Okay, bakit po? Kasi ang population natin sa IMCI is basically pedia population. Okay, pero kayo po ang bahala if you're comfortable in studying this lecture under the pedia concept or under your CHN concept. So what do I mean by CHN? Kasi pwede rin naman siyang i-classify sa CHN because basically, ina-apply natin po ito sa community setting. Okay? And what do I mean by? Pwede mo siyang i-classify under pedia or CHN. Kasi guys, first tip or first advice, since refresher pa lang naman tayo, minsan kasi nami-meet ko yung students patapos na, pero I'm very, very honored, okay, na medyo sa simula ko kayo na-meet, okay? Kasi I would like to share with you this tip or advice in a board exam kasi effective siya for me, okay? That is to strategize a very, very stable, a very, very sturdy, okay, study plan. Kailangan mo ng stable na study plan for yourself, okay? Yung study plan ng iba, wag mong gayahin kasi it might not be effective for you. Okay? Ako, ang style ko, no, ako yung nagre-review before, okay, isang subject, isang araw. So, for example, OB-Pedia Monday, okay, CHN Tuesday, Psych Wednesday, and so on and so forth. Okay? Since kami rin po yung batch na laging napopostpone ang board exams, parang twice or thrice napostpone yung board exams because of the pandemic, I was able to try different study plans and I was able to discern what worked for me the best. Okay? Yung ibang study plan that I tried was 1 full week, 1 full subject. For example, first week of this month, puro CHN lang. Second week of this month, puro psych lang. Okay? Baka yung iba sa inyo mag-work yung ganong setup. Okay? Along, of course, with the top rank lectures. Okay? So, yun, binibigyan ko lang kayo ng tip or advice kung paano nyo ba mas ma-handle yung way of studying for the board exams. Okay? Ganon. Also, for me, guys, IMCI is the concept. Okay? Pag naririnig natin yung IMCI, it's very textbook. Okay? It's very either you know it or you don't. Okay, so in short, we are really going to be forced to memorize this one. So wala tayong choice. Okay, but then again, kasi when we hear the word, i-memorize mo yan. Okay, pag sinabihan kayo ng mga teachers, lectures na you have to memorize this one. Okay, basically nakaka-overwhelm siya. Right? Nakakaubos siya ng brain cells, nakakatamad, and it would take so much of our time. Tas eventually, may inis ka na lang sa sarili mo, sasabihin mo, oh my God, JD, ang slow mo. Alam mo yung ganong feeling, yung kanina pa tayo sa topic na to, hindi mo ma-comprehend, hindi tayo maka-move on. Alam mo yun, parang anong problema? Okay? So, ayun, I'm sure some of you nakaka-experience at some point in the review phase yung ganong klaseng na experience, okay? But then again, guys, I am your lecturer and take it from me. I'll give it to you freely, guys, and I'm telling you, okay, repetition is the key. Okay? Again, repetition is the key. Paulit-ulitin mo lang pong basahin yung concept, okay? I said basahin and not memorize. And eventually, when you want to try to retrieve that information, nandyan yan. Okay? Maaalala mo siya. And also, we don't really have to punish ourselves for the things na kaya namang gawa ng paraan. Yung kunwari, parang na-stuck ka na sa isang lecture, sa isang concept, tapos wala-wala na, tinamad ka na the whole day, nasayang yung oras. Okay? So, yun guys, familiarization, repetition, yun yung strategy natin for this morning. Okay? Next thing that I want to tell you guys is that, okay, ang daming gustong sabihin. Ma'am, magsimula ka na lang. Hindi, I have to tell you this, okay? When you are being faced with a difficult concept, okay, for me, kunwari, okay, nahihirapan po ako sa pedia concept, kunwari lang, okay? Mas naintindihan ko po siya if I try to associate it with the memory close to me. Okay, ano ibig sabihin ng memory close to me? Like this one. Okay, nilagay ko po si Anya as an example. Okay, for example, si Anya guys, sa Spy Family, Anya Forger, okay? Nasa Netflix po yan guys, okay? Imaginein mo lang, okay? Isang cute na bata. At tulad ni Anya, okay? Mamamatay lang dahil sa sobrang pagtatae. Okay? Sobrang nagja-Jorya galore lang siya, namatay na. 'Di ba? Para nakakainis 'yon. Okay? Nakakainsulto even. Okay? That's why basically, okay, IMCI was born and made to serve as a protection and to nurture our pedia patients ages 5 years old and below. Okay? Ayan. So let's start for real. Dami sinabi. Ayan. Next slide. Nabigyan naman kayo ng handout, no? Ayan. May handout naman po tayo. Okay, so IMCI guys, yung general overview lang, it's developed by the WHO or World Health Organization and United Nations Children's Fund or UNICEF. Okay, it is based on the combined delivery of essential interventions at the community, health facility, and health systems levels. Okay, and in the Philippines, IMCI was started on a pilot basis in 1996. We have to know these things, guys, that I'm about to tell you kasi bago tayo pumunta sa actual IMCI that we know, yung algorithm, kailangan alam mo muna kung saan nagsimula yung IMCI para mas ma-appreciate mo yung concept. Okay? Sabi daw, sa first bullet, guys, ang konsepto daw po ng IMCI ay itinaguyod ng WHO at ng UNICEF. Okay? Dahil napansin daw po nila, based on the information they have at hand, okay, that over millions of children are dying worldwide just because of obviously simple and could have been preventable, okay, could have been low-cost treatment, okay, set of diseases and illnesses. Okay? So, ano ba yung mga illnesses na sakop nitong IMCI nito? Can you give me one? Can you give me one? Ano yung mga naaalala niyo? Aside sa Jorya. Aside sa Jorya. Malaria, yes. Pneumonia, yes. Measles. Meron naman kayong background about IMCI. Okay? Dagdagan natin. Okay? Tama kayong lahat. Okay? So we have your Jorya, pneumonia, measles, malaria, mga ganyan. Okay? For example, yun nga, balikan natin. Okay, si Anya, na cute, mamamatay lang po dahil sa sobrang pagtatae. Diba, nakakainis, nakakainsulto to the world of healthcare that lives are being lost just because there are no adequate management for this condition. Okay? Above all, guys, nakakainis para sa isang nanay na 9 months mong inalagaan sa loob ng tiyan mo. Okay? Tapos nung nilabas mo, mamamatay lang siya dahil sobrang pagtatae, tapos na-dehydrate, tapos eventually death na. Diba? Yun yung mga nakakainis talaga. Okay? So, ito yung mga sakit na preventable in the first place and losing children's lives over this, okay, would be so frustrating to some extent. Okay? Ano pa? Next bullet. Gamitin ko nga yung pointer. Yung. Okay? Sabi daw, essential interventions, okay, at the community. So, ibig sabihin, IMCI uses set or clusters of interventions for specific health conditions. Okay, it uses an algorithm. Yun yung table na alam natin for the IMCI. So, Okay? That or those are the tables that we are going to dissect later on depending on the severity of the symptoms being presented by the child. Okay? Also, IMCI is basically applied in the community setting and we know that. Okay? Pero paano natin siya iisipin? For example, meron pong isang nanay, okay, na merong may sakit na anak. Lalapit po siya sa health center, tapos ipapatingin niya ang bata. So this is where it all starts. Okay? Of course, bilang ikaw po yung bubungad sa kanya na healthcare professional, it is necessary for you na dapat alam mo po yung konsepto ng IMCI. Okay? Dapat alam mo yung nilalaman ng IMCI. Kasi basically, ikaw po yung gagamit nito sa community. Okay? Third bullet, sabi daw Philippines, okay, IMCI was started back in 1996. So as we know guys, Philippines was among the first countries in WHO Asia Pacific region, okay, to implement IMCI back in 1996. Okay, tagal na, tanda na, okay? Fast forward to over 2 decades later, so I think that's 26 years later, okay? Gumawa po yung RITM ng research team. Yung RITM, that's a hospital in Alabang, Muntinlupa. Okay? So gumawa po yung RITM ng isang research team to find out about the IMCI implementation here in the Philippines. And they found out that while yes, okay, sige, na-implement siya sa mga probinsya, it also crosses a lot of challenges in implementation such as, unahin na natin guys, lack of budget allocation, okay, for this program. Ano pa? Lack of supervision, evaluation for the trainers. Okay, mga ganon. Lack of uniform policy guidelines. Okay? Most especially guys, okay, para lang po sa kaalaman ng lahat, wala pong standard policy guidelines ang DOH when it comes sa implementation nito. Okay? Although yes, acknowledge na may ganitong program. Alam mo yun? So again, maganda yung konsepto na IMCI, pero just like any other concepts or programs available, kapag hindi siya na-implement ng maayos, okay, it becomes a problem. Okay? But then again guys, again, general overview lang to ng IMCI. Magandang pag-aralin yung magandang klaseng community programs kasi especially sa mga gustong tahakin ng landas ng community after they pass the board exams. Okay? Mas ma-appreciate natin yung mga ganitong program. Okay? Meron na pong mga updates ang IMCI since it started back in 2005. Parang yun ata yung first release nila ng IMCI manual. Okay, they released again in 2008, tapos continuous yung updates, okay? Ang pinaka-latest IMCI update is actually yung 2019 update, okay? Pero hindi yun yung masyadong magiging reference natin kasi yung changes or yung revision sa 2019 update is more on the sick young infant, okay? Hindi natin siya mahagip today, okay? Mag-focus tayo sa sick young children, okay? So ang magiging main reference natin would be the IMCI Booklet 2040. Okay, so these updates basically are significant because as we know guys, over the years, okay, there have been a lot of emerging and latest researches or journals or articles. So nag-expand na yung mga information natin regarding these diseases such as yung epidemiology, okay, yung efficacy ng mga antibiotics, ganyan, especially sa pneumonia, sa diarrhea, mga ganyan. Okay, may mga updates na tayo regarding those things. Okay, next. Uy guys, sabihan niyo ako if masyadong mabagal yung pacing or if masyadong mabilis na kayo na hinihingal for me. Okay ha? Para i-adjust natin. Okay? So in this slide, I am showing you the objectives of IMCI. Dalawa lang naman po yan. It's very, very easy to understand. Okay? First is to reduce the death and frequency and severity of illness and disability. Okay? In the first place, yun talaga yung goal ng IMCI. Okay? Ano pa? To contribute to improved growth and development. Of course, if naalagaan natin na maayos yung pedia patients natin, we would assume, we would expect even, okay, that they would lead healthier lives eventually. Okay? Next are your components of IMCI. Magkaiba po yung objectives. Magkaiba rin po ang components ng IMCI. Pag sinabi mong components, yun yung nilalaman. okay, no IMCI program. First and foremost is to improve the case management skills of health workers. Okay, so nakafocus tayo sa skills ng health workers. Basically, this involves the trainings and the seminars. Okay, pwede rin yung self-trainings through the modules para mas makapacitate natin yung IMCI users in the community. Okay, again guys, the success of IMCI will depend on the implementation of the manual itself. Okay, kaya dapat po well-equipped with knowledge and skills ang ating human resources sa community. Okay, kapag ginawa natin to guys, pag nag-effort tayo, okay, nabigyan ng knowledge and skills ang health workers sa community, may benefits po ba? Definitely yes. Okay, firstly, may improve yung counseling skills nila sa mothers. Okay, and in turn, yung mothers who will visit the health center will leave that center more satisfied, okay, more confident with their care towards their children. Okay, ano pa, mas better yung documentation system nila. Okay, kasi hagip yan kapag nag-skills training tayo, yung documentation. And of course, generally speaking, better quality of care. Okay, but then guys, alam natin na may benefits, yes. Pero sa kabilang spectrum, may challenges naman. Ano-ano yung mga challenges na pwede nating maisip? Okay? Yung mga little things lang na akala natin little pero it would contribute to, alam mo yun, such as yung lack of stationery. Okay? Minsan guys, sa mga hard to reach areas, sa mga far-flung areas, okay? Bond paper, ball pen, wala sila. Okay? Paano pa kaya yung more advanced technology such as the computers, the printers, mas wala sila nun. Okay? So yun yung mga alam natin na parang simple lang pero ang laki ng impact sa program. Okay? What else? Yung referral system from the health center to the hospital. Okay? Ano pa? Lack of drugs. Alam natin na may separate program na tinatawag na butika ng bayan ba yun? Butika ng bayan. Okay? Minsan, yung mga drugs doon kulang-kulang. Okay, so although alam natin kung ano yung ibibigay na antibiotics or alam natin kung ano ibibigay na drug for this state or condition, kung wala ka namang ibibigay, okay, problema yon. Okay, also, high staff rotation. When you say high staff rotation, minsan sa mga, yun nga, hard to reach areas, okay, sa buong barangay or village or province, okay, isa lang yung doktor nila or isa lang yung midwife or isa lang yung nurse. Sobrang kulang for their population. Okay? Sino dito yung naka-experience ng deployment? Intensive community experience. Yung pinadala sa mga probinsya tapos mag-stay sila doon for 2 weeks or 2 months. Naka-experience ba kayo ng deployment, guys? Ano setup? Kasi nag-pandemic. Oo. So, oo. Nag-pandemic. So, paano nyo na, yung community? Pero nag-uwian. Okay. Online. Yung iba. Kasi iba 2 days. Okay na yan. Basta may community exposure. Virtual. Paano yung virtual? Nag-ano kayo? May pseudo community. Nice. Okay, but as long as na-appreciate nyo yung kung paano mag-serve sa community, okay yun. Win-win pa rin naman. Tondo for 1 month. Yung iba, so urban. Okay, sige, nice to know. Nag-start na daw sila sa community, tapos pinauwi kasi nag-lockdown na. Kami naman, nasa community kami, noong January 2020, di ba yun yung mag-start mag-usbong na yung COVID. Tapos, mag-shift na kami kasi intensive community, tapos intensive hospital. So, mag-shift na, mag-hospital na kami. Pinull out pa mami, okay? March 2020, yung official lockdown, pinull out kami. So, yun na. At least na-experience namin yung 2 months na community experience, pero hindi ko na-experience yung intensive na hospital. Yun yung nawala sa akin, yung hospital experience. Okay? Either way, nakayanan ko naman sa ward. Okay? Ayan. Next, improving your overall health systems. Okay? Improving overall health systems. Siyempre, andyan yung availability ng drugs natin, yung antibiotics, paracetamol, mga ganyan. Yung referral system natin. Alam natin na yes, we need to refer to the hospital. Okay? Pero gaano po ba ka-effective ang referral system sa isang LGU or probinsya? Okay? Gaano po ba ka-effective yung coordination system natin? Okay? And gaano po ba kalayo? In the first place, ang pinakamalapit na hospital sa isang health center. Okay? So these are the things that we have to look into when we want to improve our overall health systems. As we know, guys, health is political, health is multifactorial. So kailangan hagip lahat yan. Okay? And actually, involved pa rin naman dito yung dami tsaka yung availability ng healthcare personnel natin na marunong gumamit ng IMCI. Okay? So the way that we should look into this, it has to be holistic. Alam natin na understaffed to begin with yung mga tao sa hospital. What more sa community? Okay? And sa tingin ko, if i-shift natin yung perspective natin, mas bibigyan natin ng importance yung primary healthcare, mas malilesen yung congestion sa mga tertiary hospitals. So yun yung mga kailangan nating pagtuunan ng pansin. Okay? And I think yun yung isa sa mga wonders kapag may sarili ka ng lisensya. Kasi mas ma-amplify yung boses mo sa mga ganitong issue ng society natin. Okay? Lastly, guys, improving family and community health practices. Okay? We have to strengthen the bond between the health centers and the communities that they serve. Okay, so ibig sabihin, andito rin dapat yung involvement ng family mismo, pati ng community as a whole. Okay? Yung importance no role ng mothers, okay? Yung importance no role ng healthcare centers, mga ganyan. Okay? Dapat masisignify yan sa IMCI program. And also, we have to optimize a multi-sectoral platform for promoting child health and nutrition in a more sustainable manner. Okay, in such a way na ipapalaganap po natin yung konsepto ng IMCI sa community. Kahit sa simpleng paraan lang. Okay, yung mga booklet po na IMCI sa health centers, actually meron sila. Okay, in all fairness, meron sila. Even doon sa province na kung saan kami na-deploy, meron sila. Okay, pero saan ko po nakita? Okay, saan ko siya nakita? Sa lumang cabinet na inaalikabukan na. Okay, may gagamba na guys, may sapot na guys. Okay, so yung mga ganong booklet, nakatago lang sa kanila. Okay, huwag niyo pong itago. Okay, ilabas niyo man lang. Ilabas niyo man lang sa health center ninyo, okay, for the residents to read. Okay, because the more people to who knows about IMCI, the better. Okay, hindi man nila maintindihan yung technicalities, but at least alam nila na may ganito palang program. Okay, then they could seek help from the healthcare professionals to understand it more. Mga ganon. Okay, sige. Next, what are the rationale for an integrated approach? Okay, kasi majority of these deaths are caused by 5 preventable and treatable conditions, namely pneumonia. Ito yung mga sinabi niyo, okay? Diarrhea, malaria, measles, and malnutrition. Okay, hindi natin i-cover yung malnutrition, although suffice it to say, meron malnutrition. Okay? Kasi medyo mahirap, medyo complex siya. May weight for height, okay? C-score, mga ganun. Okay? Most children have more than one illness at one time. Ito yung gusto kong i-emphasize, okay, sa slide na to. This overlap means that a single diagnosis may not be possible or appropriate. Ibig sabihin po, throughout our lecture mamaya, okay, about IMCI, hindi po tayo magda-diagnose. Okay, hindi tayo magda-diagnose. Hindi siya nakafocus sa diagnosis. Okay? It's just all about a cluster of symptoms. Tapos, ika-classify natin yung bata according to those symptoms. Okay? Minsan kasi, yun nga, maraming chief complaints yung bata. Okay? So, before we refer to bigger hospitals, i-assess muna natin ng maigi. Okay? Ayan. To show you the IMCI form, ito yung itsura niya, guys. Para lang hindi kayo ma-lost, okay? So as you would see, as you would observe, nasa long bond paper siya. Mahaba siya, guys. Okay? Ano pa? It's very, very comprehensive. It's very, very wordy. Okay? And you would start by filling out the child's demographics. Okay? So yung pangalan, okay, yung edad, okay, the weight, the temperature, the height, okay? And then the first and foremost step that you are going to do, okay, when applying this IMCA program is to ask the mother what the child's problem is. Okay? Ask the mother what the child's problem is. Andito po siya sa pinaka-taas. Yan. Ano po ang problema ng bata? Okay? Minsan guys, pag itatanong siya sa board exam, okay, nakasama sa choices, yung ask the mother what the problem is, na-overlook siya ng mga students. Bakit? Mas nakafocus yung sagot nila sa assessment right away. Ito, okay, medyo misleading to kasi meron pang dapat prior, blurred ba? Blurred ba yung copy? Sige, mamayang break, mag-show ako ng mas clearer na copy. Okay? But suffice it to say, guys, the very first step that we must do, okay, in IMCI is to ask the mother what the problem is. Okay, ask the mother what the problem is. Apart from the actual color-coded triaging, okay, na usually tinatanong sa board exam, itatanong din po nila yung steps or yung process ng IMCI. Okay, so ngayon pa lang, okay na nagkakaintindihan tayo that the very first step is to ask the mother what the problem is. Okay? Next is to assess. Ito na yung time na i-assess mo yung bata. Okay? Lahat po yan, iisa-isahin mo. Kahit na alam mo namang walang problema yung bata sa certain conditions na sinasabi dito, okay, ano ba naman yung mag-tick ka lang ng no? Okay? Split second lang yan, guys. Okay? So, wag ka nang tamarin. Ubusin mo to hanggang dulo ang assessment ng bata. Okay? Hanggang dulo po. Okay? Tatapusin po hanggang dulo. What if nasa first column ka pa lang or first row rather, okay, checking for any general danger signs. Tapos may na-check kang dalawang symptoms. Okay, apparently the child vomits everything and the child is already lethargic. Okay, yun yung symptoms mo. Okay, would you still finish the form? Would you still finish the form until the end? Okay, kasi sabi natin kapag general danger sign, refer immediately yan, di ba? Refer immediately. Severe na yan. Okay? Would you still finish the form until the end? Yes or no? Final answer. Final answer na walang no, guys. Would you still finish asking those questions until the very end? Okay? Dito ka pa lang sa unang row, dalawa na yung na-check mo. Eh sabi kapag daw dalawa na yung na-check sa general danger signs, severe na yan, tas refer agad. We have to finish until the end. Kasi sabi ko lang, guys. Kasi sabi ko lang, guys, okay? Yes, kailangan mong tapusin hanggang dulo. Bakit po? Ano implication nito? You as a healthcare professional na nagtatrabaho sa healthcare center, kapag nag-refer ka, tapos yun lang yung sinabi mong symptom, mapapahiya ka, mami. Okay? Kasi kulang yung assessment mo. Okay? Tapusin mo. Ang tamang way of doing that is to finish the form as soon as possible, then refer immediately. Okay? Finish the form as soon as possible, then refer immediately. Okay? Wag ka, alam ko medyo internally panic mode na tayo dyan. Okay? But still, we have our job, okay, responsibility to finish the form until the end. Okay? Until the end. Okay? Wala kang ititira dyan. Okay? To make sure lang. Yun din yung sinabi natin sa previous slide, that the child may have more than one illness at one time. Okay? So, paano mo mag-guarantee na yun lang yung issue ng bata kung hindi mo tinapos yung form? Okay? So, yun lang yung gusto kong i-share sa slide na to, guys. Okay? It's very, very comprehensive. Okay? Very helpful in assessing, okay, for the child. Okay? And, para rin malaman mo nga, okay, na holistic yung care, yung assessment na ginawa mo for the child. Okay? Next. Yeah. Who are the children covered by the IMCI protocol? Okay, who are the children covered by the IMCI protocol? Basically, generally speaking, okay, it's those children below 5 years old. Okay, it's those children below 5 years old. Okay, pero yung age range ng children na yon, dinivide pa natin sa dalawa. Okay, the first one are the sick children from birth up to 2 months old. Okay, those are your sick young infant. Ang tawag natin sa kanya, okay, ay sick young infant. Okay. Next are the children from 2 months old until 5 years old. Ang tawag naman natin sa kanya is the sick child. Okay, sick child, mommy. Okay, sick child. Bakit? Bata na to, 5 years old. Okay, sick child na tayo dyan. Okay, for example, ikaw yung duty sa isang health center, sa Pedro Hill Health Center. Okay, may lumapit na nanay, may sakit yung anak niya. Okay? Cough and colds, okay? Ang bata ay 18 months old. Saan mo siya i-classify? Sick young infant or sick child? The child is 18 months old. Anong tawag sa kanya? Sick young infant or sick child? (18 months old. Okay? Ito yung ano natin, criteria natin. 18 months old. Ay, sick child pala. Sorry. Sige. Okay. Pasok siya dito sa sick child. Okay, sick child na siya. Okay. What about the child is 18 days old? Yon. 18 days old lang si baby. Saan mo siya ka-classify? Sick young infant or sick child? Okay. Sick young infant. Correct. The baby is 3 years old. The child is 3 years old. Okay, sick child. The child is 3 months old. 3 months old. Nalilito pa rin. Okay lang yan. The child is 27 days old. 27 days old. Okay. Sige. Ano yung implication? Bakit kailangan malinaw sa atin kung ano yung edad ng isang bata? Okay? Kasi mag-iiba po yung interventions natin for these two specific age ranges. Okay? Last, the child is 4 years and 27 days old. Okay. Sige. Please do not forget. Please do not be confused anymore. Sick young infant from birth up to 2 months. 2 months lang siya. 2 months. Sick young infant. Okay? Pag 2 months to 5 years, until 5 years lang naman. So from 2 months to 5 years, sick child na siya. Sick child na siya. Okay. Gets. Next slide. Ganon. Okay? Ganon. Next slide. Okay. Basis for classifying the child's illness. Okay? Ito na yung alam natin na IMCI. Okay, parang yung vision nyo, yung imagination nyo about IMCI, mas nagiging klaro na. Okay, nagkakaroon na kayo ng idea. Okay, these are the 3 basic colors. Okay, dito lang tayo maglalaro mamaya. Okay, first, let's go to the pink classification. Okay, pag wala po kayo nakitang color pink na word, okay, sa multiple choice, sa board exam, okay, bakal po merong color red. Yun na yun. Tanggapin mo na yun. Okay, color red. Yan. Pag meron po kayo nakita violet, yon sa multiple choices, sa board exam. Okay? Pinakita kang violet. Uy, favorite color. Okay? Huwag kang ma-excite. Burahin mo na yan sa paningin mo. Bakit po? Wala tayong pag-uusapang violet, mami. Okay? Panglito lang nila yan. Okay? Violet, X ka na po. Okay? Wala ka na po. Okay? So it's either pink or red for the severe, then yellow, then green. Let's start with the pink, okay? Ang keyword natin na kailangan mong tandaan, guys, remember, okay, kapag sa board exam, napakadami mong kailangang aralin, okay? Yes, triage system siya. Yes, oo, tama yan. Okay? Napakadami mong kailangang aralin. Hindi mo lahat yan matatandaan. Hindi mo lahat yan mamememorize word by word. Okay? So keywords lang tayo. Okay? Diyan tayo mabubuhay. Okay? And kapag pink or red, ang classification, guys, ang keyword lang na kailangan mong tandaan, na kailangan mong makita, okay, ay yung word na referral. Okay? Referral. I-refer mo na yan. Okay? Ano pa? Severe. Yan. Magagasgas yung word na severe mamaya kasi lagi siyang mababanggit. Okay? And ganun pa rin naman, if severe yung word na lumabas, automatic, that's color pink, that's color red. Okay? And alam natin na kailangan mag-refer. Pero bago mo siya dalhin sa ospital, kailangan may gagawin ka muna. Okay? Yung mga paunang lunas, yung mga pre-treatment referral na sinasabi. Okay? Kasi yun din yung responsibilidad mo as a healthcare professional sa health center. Okay? So immediate treatment first, then refer. Ulit, immediate treatment first, pasulat na lang sa notes. Okay? Kasi bukas pa ako matatapos pag tinapos ko to. Okay? Immediate treatment first, then refer. Okay? Immediate treatment first, then refer. Ano ba yung parang general treatment na gagawin natin under this classification before we refer? First one is to give the first dose of antibiotics. Okay? Give the first dose of antibiotics. Ganon. Okay? Correct. Okay, give the first dose of antibiotics. Usually, guys, pasulat na lang po, that is ampicillin. Okay. Naging student na ba kita, ma'am, before? Okay, usually, okay. Ampicillin and gentamicin. Okay, usually, that's ampicillin and gentamicin. Okay, tama yung yung sinabi mo, ma'am. Wait lang, tapusin ko lang to. Okay, tama yung chloramphenicol. Before, sa previous IMCI manual, it's really the chloramphenicol. Okay, pero latest researches, latest journals would say it's the ampicillin and gentamicin. Okay, ampicillin and gentamicin. Ulit, ampicillin, gentamicin. Okay, these two antibiotics are basically broad spectrum antibiotics. Okay, broad spectrum po sila. Naka-vial form po ito. Okay, so kailangan nyo pa siyang i-dilute according to age of the child. Okay, if referral is delayed, okay, if referral is delayed, okay, you have to give ampicillin IM every 6 hours. You have to give ampicillin IM every 6 hours. Okay? These two antibiotics, ang route po nila ay IM. Okay? Ang route po nila ay IM. Bakit po? Kasi nasa severe classification po tayo. Okay? So imagine natin or i-assume natin na hindi nila matotolerate yung per RM. So idiretso mo ng IM. Okay, again, if referral is delayed, give ampicillin injection every 6 hours. Okay, sige. Next, after giving the first dose of antibiotics, okay, what is the next step or next treatment before you refer? Ito yung pre-treatment referrals, remember? Okay, next is to treat the low blood sugar of the child. If meron siyang low blood sugar, okay, treat low blood sugar. Alam mo, ma'am, wag mo na lang kaya isulat. Mas nalilito kami. Ang pangit ng sulat mo. Hindi, sulat natin yan. Yan. Yun. Okay? Treat the low blood sugar. Okay? Possibly in the form of breastfeeding or sugar water. Okay? Meron tayong mga criteria dyan. If kaya mag-breastfeed ng bata, okay? If kaya niya po mag-breastfeed, ipa-breastfeed mo. Okay? If hindi niya kaya mag-breastfeed, if hindi niya po kaya mag-breastfeed, pero nakakalunok siya, okay? If hindi kaya ng bata, but the child is able to swallow, okay? Bigyan mo siya ng expressed breast milk or sugar water, okay? How do we do or how do we make sugar water? How do we make sugar water? Okay, we dissolve 4 levels or 4 teaspoons, okay, of sugar. 4 teaspoons of sugar in 200 cc or 200 ml water. Again, 4 teaspoons of sugar in 200 ml cup of clean water. Hindi 4 teaspoons. 4 teaspoons. Here, 4 teaspoons. Yan. 4 na kutsarita. Yon. Okay, 4 teaspoons. Yeah. 4 teaspoons of water, sugar rather, okay, in 200 cc water. Okay, ayan. That's how we make our sugar water. Okay, next, if the child is not able to swallow at all, okay, if the child is not able to swallow at all, ano na sa tingin natin yung next na treatment na ibibigay? Paano na natin siya bibigyan? Bago pa IVF, meron pang isa tayong kayang ibigay. Through NGT, guys. Yes, NGT, correct. Okay, NGT mo na yan. Bigyan mo siya ng milk or sugar water through NGT. Okay, and then refer to the hospital. Ganon. Yan na yung third step. Refer to the hospital. Guys, kapag natandaan mo itong general pre-treatment referrals, okay, na sinabi natin or na pinag-aralan natin, okay, kapag nakita mo yung actual table mamaya, hindi ka na ma-overwhelm. Bakit? Kasi halos pare-parehas lang sila ng sasabihin. Ito lang din yung sasabihin nila sa'yo. Okay? Hindi ka na malilito, hindi ka na ma-overwhelm or magpapanik na kailangan mong memorizein yung buong table. Okay? Hindi na, kasi naintindihan mo na siya. Okay? Next step. Yes, oo. Yung antibiotics po ba ibibigay sa lahat ng patients na i-refer? Yes. Okay, ibibigay mo siya, yes. Okay, depende doon sa algorithm. Okay, pero usually, yan yung sinasabi nila. Give first dose of appropriate antibiotics. Makikita natin mamaya. Okay, kung ano yung itsura niyan. Okay, how do we refer? Even referral has steps. Okay, how do we refer? First step. Okay, first step. Explain to the mother the need for referral and get her agreement to take the child. Okay, yun yung first step. Explain to the mother the need for referral and get her agreement to take the child. Hindi sapat na pinaliwanag mo lang na kailangan niya, kahit wala pong prescription ng doktor, pwede po tayo magbigay ng antibiotics. Guys, antibiotics, di ba ano yan? Kailangan ng doctor's prescription. Okay, kailangan siya ng doctor's prescription. Ilang water po, i-dilute ang 4 teaspoons of sugar, 200 ml water. Okay, 200 ml water. Ito pong IMCI interventions, not solely nagagawin ng nurse lang. Okay, hindi lang siya nurse. Okay, team siya sa healthcare team yan. Okay, but I'm just showing you the process. Okay, the information. Okay, paano po ma'am, kadalasan, walang doctors or HU? Okay, hindi siya kadalasan, walang doctors or RHU. Meron yan, may isang doktor yan sa RHU. Okay, meron yan. Okay, sige, how do we refer? Balik tayo. Okay, explain to the mother the need for referral and get her agreement to take the child. If wala talagang doktor, tapos you need to give the antibiotics, okay, I think you have to refer immediately na. Okay, kasi hindi ka po pwedeng magbigay ng antibiotics na ikaw lang. Okay, next. If you suspect, kunwari, okay, pinapaliwanag mo sa nanay, okay, kunwari pinapaliwanag mo sa nanay, bakit kailangan dalhin ng anak niya, okay, sa ospital, okay, tapos ayaw niyang pumayag, okay, ayaw niyang pumayag, you have to find out why, okay, ano po ba yung alam nating kadalasang rason kung bakit ayaw pumunta ng mga residente sa ospital? Marami yan. Ano yung mga factors na naisip natin? Yes, finances, okay, walang pera pang bayad, ano pa? Finances ulit. Ano pa? Pera ulit. Ano pa? Fear, anxiety. Yes, that's true. Ano pa? Transportation. Yes, yung mga simple reasons na valid. Okay, kunwari wala po magbabantay sa anak ko, sa ibang anak ko po na sa bahay. Or wala po magbabantay sa nanay ko na bedridden sa bahay. Mga ganyan. Yes, correct. Okay. Culture, pwede rin. Okay? We have to find out why and explore those reasons. Okay? Kasi kailangan maintindihan mo rin kung saan siya nanggagaling. Okay? The next step in referring. Okay? The next step, second step in referring. Okay? You have to calm the mother's fears and help her resolve any problems. Okay? You have to calm the mother's fears and help her resolve any problems kung meron. Okay? Kung meron. Okay? Kasi yun yung isa nating trabaho as a healthcare professional. We have to explain and reassure. Not just explain, but you also have to reassure. Okay? Explain and reassure. Okay? So, hindi mo man matreat yung bata per se, at least, nagawa mo yung part mo. Okay? Nasa referral part ka na. Alam mo na yun na yung next step na gagawin mo to refer. Okay? You have to encourage the mother to go to the hospital. Okay? Kung pumayag yung mother, okay, sige po, dali na po natin siya sa hospital. The third step in referring, okay, is to write a referral note for the mother to take with her to the hospital. Okay, write a referral note for the mother to take with her to the hospital. Minsan kasi ikaw lang yung duty sa health center. So hindi ka makakasama. Okay, sa hospital. So ang gagawin mo na lang, sasabihan mo yung nanay, okay, yung mother, sabihin mo sa kanya, mother, ito po yung yung file, yung dokumento or yung mga papeles na kailangan mong ipakita doon sa hospital. Okay? Natawagan ko na po yung hospital. Okay, hinihintay na po nila kayo doon. Bigay mo lang po ito. Okay? Tell her to give it to the healthcare worker there. Nasasalubong sa kanya kung meron. Okay? Fourth step in referring. The fourth step in referring is to give the mother any supplies and instructions needed to care for the child on the way to the hospital. Okay, anong itsura nun? Siyempre, dapat kahit in transit pa lang, kahit papunta siya sa hospital, may treatment pa rin, may intervention pa rin. If the child has to breastfeed, okay, tell the mother, painumin mo lang ha, padedayin mo lang hanggang sa makarating kayo doon sa hospital. Pwede naman yun. Okay, bigyan mo siya ng supplies, bigyan mo siya ng instructions in a way na maintindihan niya. Okay? Para walang gap doon sa treatment na gusto mong gawin doon sa bata. Okay? Questions so far? Fourth step is to give the mother any supplies and instructions. We needed to care for the child on the way to the hospital. Okay, on the way to the hospital. So ang 4 steps natin, explain to the mother the need for referral. Okay, calm the mother's fears and help her resolve any problems. Write a referral note for the mother to take with her to the hospital. Okay, then give the mother any supplies or instructions. Okay, on the way to the hospital. Okay, questions? Second step, calm the mother's fears and help her resolve any problems. Okay. Yes, oo. You can give sugar water on your own. Okay lang yan. If severe, ang classification ng bata, what color? Anong kulay? Basta ang criteria, if the child cannot swallow, is not able to swallow, mag-NGT ka na. Okay? Iba kasi yung setup ng iba ang setup ng community sa hospital. Okay? You can do NGT on your own. Okay? Sa community. Kung kaya mo. Okay? Kung kaya mo. Pero syempre, licensed nurse ka, di ba? So parang expected na kaya mo siya. Okay? If na-assess mo yung bata, tapos sabihin natin na kailangan siyang i-refer, what color? If the child needs to be referred, what color? If alam mo na kailangan mong i-refer ang bata, pero before you do that, meron kang pre-treatment na kailangang ibigay. Okay? What is the usual antibiotic of choice for children under pink classification? Ano yellow? Ay, sagot na yellow. Wala pa. Wala pa tayo sa yellow. Okay, ampicillin, gentamicin. What is the route of ampicillin? Okay. If the referral is delayed, okay, what is the frequency of giving ampicillin injection? Okay. Ang gentamicin, is it broad spectrum or narrow spectrum? Okay. Ang ampicillin po ba ay broad spectrum or narrow spectrum? Okay, nabigay ko na yung ampicillin, tapos hypoglycemic yung bata. Okay? If the child is able to breastfeed, okay, i-breastfeed ko ba? Yes or no? Okay. If the child is not able to breastfeed, okay, but is able to swallow, anong pwede kong ibigay? Sugar water or expressed breast milk. Okay. Wala pa. Excited yung mga sumasagot. Sige, ito na. Okay, ilang sugar ang pwede kong ibigay or pwede kong ang tawag doon? Yon, alam niyo na yan. Alam niyo na yan. 4 teaspoons. Okay, so that's 4 teaspoons of sugar in 200 ml clean water. Very, 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 very good. Okay, if the child is not able to swallow at all, ano pwede kong gawin? Next step, me as a healthcare professional, okay, use NG. Okay, nabigay ko na yung antibiotics, na-treat ko na yung low blood sugar niya. What is the next step that I have to do? Refer mo na. I'm so proud of you guys. Kayang-kaya nyo na. Okay? Kayang-kaya nyo na. Tiwala lang. Okay, so we're done talking about your pink classification, your red classification. Ganun lang. Okay, tatapusin pa ba natin to guys? Charot lang. Okay, so okay na tayo sa pink. Malinaw na sa pink. Okay, ang goal ko kasi pagdating natin sa table, hindi na kayo ma-overwhelm na, oh my God, ang daming words, ang daming kong kailangang aralin. Okay, hindi na. Ganon. Okay, kasi naisa-isa na natin siya. Kahit po hindi pa delayed referral. Yes, oo. Kahit hindi delayed yung referral, IM pa rin siya. IM pa rin. Okay, under the pink, okay, pink, okay, tas first dose ng antibiotics, IM yan. AIM natin. Kasi yun nga, i-assume natin na hindi nila tolerated yung per RM. Okay? Sige. So tapos na pa tayo sa pink. Okay? Dito na po tayo sa yellow classification. Burahin ko na po yung mga pinagsusulat ko dito. Na hindi ko naman sure kung helpful ba guys. Ayan. Next, outpatient treatment. Ito po yung keyword natin. Okay? Sa mundo ng yellow classification. Kunwari sa pink, okay. Sige. Ang first step sa referral is to explain the mother the need for referral and get her agreement to take the child. Explain, okay, then get her agreement to take the child. Okay. Sige. So sa yellow classification naman po, ang keyword natin would be outpatient. So pag sinabi mong outpatient, ano itsura nun? Kaya mo siyang ma-address sa health center at pwedeng pauwiin ang bata. Okay, yun yung pinagkaiba niya sa pink. Kaya mong ma-address sa health center, pwedeng pauwiin ang bata. Under pink kasi, nag-address ka sa health center, ni-refer mo sa hospital. Okay, pero sa pink, sa yellow, rather sa yellow, in-address mo, trinit mo sa health center, at pinauwi mo ang bata. Okay, may steps din tayo ng treatment dyan. Yes, oo. Uy, grabe, ang gagaling nyo. Hindi pa ako nagtuturo, alam nyo na agad. Sige, may steps din tayo dyan. The first one that you have to do, basically, is to treat the local infection. Okay, we have to treat the local infection. Local infection. Ganun. Okay, paano? Okay, now this time, ang ibibigay mo na ngayon, antibiotic. Of course, antibiotic pa rin yan kasi may infection. Okay, ang ibibigay mo na ngayon na antibiotic is oral form na. Okay, pwede ka na magbigay ng oral drugs. Bakit po? Okay, kasi na-assume natin na kaya na niyang i-tolerate. Okay, so it's either tablet form or syrup form. Depende po sa reference ng bata, kung gusto niyang tableta, kung pwede niyang syrup. Depende rin po sa availability, okay, sa health center. So, kunwari, syrup lang po yung available sa health center, ibibigay ko pa rin po ba? Yes, ibigay mo. Okay? Tableta lang po yung available sa health center. Ibibigay ko pa rin po ba? Yes, ibigay mo pa rin. Okay? And what are those two drugs that we have to give under yellow classification? Okay? The first line of antibiotic that you have to give is amoxicillin. Amoxicillin. Okay? First line, first choice. Okay? Amoxicillin. Okay? Naghanap po ako sa health center ng amoxicillin pero wala po akong mahanap. Okay? Ano po yung pwede kong ibigay pa? Okay? The second drug of choice, okay, under your yellow classification would be your cotrimoxazole. Okay? That is cotrimoxazole. Cotrimoxazole. Okay, more specifically, pwede natin itong ibigay under your pneumonia classification, acute ear infection, very severe disease, mga ganyan. Okay, which we are going to see later on. Okay, so after you give your oral drugs, which is either amoxicillin or cotrimoxazole, okay, we have to treat the specific infection na. So how do we do that? Okay, hindi naman lahat ng algorithm may ganitong portion. Okay? For example, measles with eye or mouth complications. Okay? Tapos nakita mo yung bata, meron siyang pus in the eye. Okay? Anong pwede mong ibigay dyan? You can give your tetracycline eye ointment. Okay? Kunwari ang bata is na-classify mo under measles with eye or mouth complication ulit. Pero this time, meron naman siyang mouth ulcers. Ano yung pwede mong ibigay? You can give your gentian violet. Very, very, very good. Okay, you can give your gentian violet. What about ear infection? What about ear infection? For chronic ear infection, you can give your quinolone ear drops. Okay, you can dry the ear by wicking. Okay, then after giving your specific infection, ano na yung third step? Yung magsasawa ka makita ito. Okay, advise the mother when to return. Advise the mother when to return to the health center. Okay, then the fourth step is yung follow-ups. Okay, yeah. Third step is to advise the mother when to return. Then the fourth step is the follow-up. Okay, sige. Friday the 13th, okay, sa Pedro Hill Health Center, ikaw po yung assigned. Okay, during that day, merong lumapit na nanay sa'yo. Dala-dala niya yung batang anak niya. May sakit daw yung anak niya. Na-classify mo under yellow classification. Anong keyword for the yellow classification? Anong keyword natin? Okay. Outpatient. Outpatient. Wala ba magkakamali? Outpatient, okay? So alam mo, outpatient, ang treatment natin under yellow classification, ibig sabihin, kaya mong ma-address sa health center. Saan na siya susunod na pupunta? Sa ospital or sa bahay? Okay. Papauwiin mo na siya, mami, okay? Pero bago mo pauwiin, may may treatment ka muna, okay? Na gagawin sa health center, okay? First is you have to treat the local infection. What is the first line of antibiotics that we have to give? Mami, yellow classification na tayo. Okay? Nakakalito, yes, kasi parehas silang letter A. So ang ampicillin po would be the pink, tapos amoxicillin sa yellow. Okay? Sige, ang amoxicillin, anong route? Anong route ng amoxicillin na yan? Palabay yung mga iba. Nag-uunahan. Sige, wala po akong makita amoxicillin. Doc, ano na yung next nating pwedeng ibigay? Sige, nurse, bigay mo to. Ganyan. Okay. Sige, cotrimoxazole. Cotrimoxazole IM or PO? IM or ORM? Okay. Ang gagaling. Okay. May lumapit na bata, nakita ko may pus in the eye at may tigdas, mami. So anong pwede kong ibigay? Pwede mo i-crush. Okay. Pwede pong i-crush ang tablet kung yun lang yung available. Okay? Tetracycline eye ointment. Very, 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 very good. Okay? Very good. Question, sa yellow classification. Nagets niya na. Nagets niya na. Okay? Now, pupunta na po tayo sa green classification. Okay? Ito yung isa rin sa pinakamadaling intindihin. Okay? Kasi, ang keyword mo naman dito is home care lang talaga. Okay? Home care lang tayo dyan. Ano pong ibig sabihin ng home care? Kasi kanina sa yellow, okay, in-address natin sa health center, tapos pinauwi natin yung bata. Hindi po ba home care na rin po yun? Hindi po. Ang pinagkaiba po ng yellow, sa ear ay kapag chronic ear infection, quinolone ear drops. Quinolone ear drops, okay? Kapag green classification naman po, purely, okay, papauwiin mo lang talaga. Okay, wala kang treatment na ibibigay. Okay, so ibig sabihin, you just have to counsel the mother. For example, in-assess mo yung bata. Okay, color green ang classification niya. Okay, tapos sinabi natin home care lang po siya. Okay, you just have to counsel the mother. Okay, advise mo kung kunwari feeding problem yan, i-advise mo siya. Purely health education ka lang dito. Okay, tuturuan mo lang yung nanay about the home care. Tapos, also, advise the mother when to return. Tapos, yung follow-ups nandyan din. Okay? So I hope malinaw po tayo. Ano yung significance ng follow-ups natin? For example, okay, the very first time na na-meet mo yung bata, classify mo siya under yellow classification. Okay? So trinit mo siya sa health center, binigyan mo ng health education nanay, pinauwi mo siya sa bahay. Sabi mo sa nanay, mother, balik ka po after 3 days or after 5 days. Okay? Bakit po kailangan ko pong bumalik? Okay? Kasi, minsan, yung mga nanay, hindi nila naintindihan yung instructions mo. Okay? Minsan, wala silang ginagawa at all sa mga instruction na binigay mo. Okay? Pagbalik ng bata sa health center, okay, the next time na nag-meet kayo, hindi na siya yellow classification, mami, pink classification na siya. Okay, so all the more na kailangan mo talaga mag-reassess and reclassify. Okay? On the other hand, meron namang mga nanay na super duper obedient. Okay? For example, binigyan mo sila ng instructions, pinauwi mo, sinabihan mo na balik po kayo after this day. Okay? Pagbalik ng bata, yellow classification na una mong na-meet. Tapos, ni-reclassify mo siya, green na lang, which is what you want. Okay? For the child to be better. Okay? Green na lang siya. Okay? So, yun yung importance ng follow-ups. Kasi, kailangan mo siyang i-reclassify. Kailangan mong i-make sure, okay, na natitreat natin yung bata. Okay? Sige. I would not really expect you to memorize this overnight. Okay? In fact, hindi ko nga kayo in-encourage na i-memorize this. Okay? Intindihin mo lang talaga. Basahin mo lang talaga siya. Okay? Enough for you to be familiarized with the concept lang. Okay? Para kapag kayo na lang mag-isa yung nag-aaral nito, alam mo kung paano siya aaralin. Okay? Hindi kayo sabog-sabog. Okay? Next. What are the steps of the IMCI case management process? Okay? The steps in the IMCI case management process. Sabi ko po kanina, okay, apart sa ang tanungan sa board exam is yung color classification, okay, yung mga technicalities ng terms, okay? Pwede rin po nilang itanong yung steps, okay, ng buong IMCI. And sabi natin kanina, before i-assess, before all of these steps would happen, okay, ano po yung bago natin or yung una natin gagawin? Pagtungtong nung nanay sa health center. Meron pa tayong gagawin dapat bago i-assess. Yes. Okay. Ask the mother, what is the child's problem? Okay, you have to ask the mom. Kailangan malaman mo muna yung chief complaint. Okay? Kasi, doon mo i-base yung assessment mo sa chief complaint ng bata. Doon mo i-correlate yung cues mo. Okay? After asking the mother what is the problem of the child, that is the time that you have to assess. Okay? That is the time that you have to assess. Please do not overlook this step. Okay? Baka lang po kasi ma-overlook ninyo. Okay? The next one is to assess the child or the infant. Okay? First and foremost, yung general danger signs natin, which we are going to talk about later on. Okay? Ano pa yung pwede nating itanong or i-assess sa bata? Okay? Meron tayong history taking dyan. Meron tayong physical exam dyan. Okay? Ano pa? Yung nutrition status ng bata. Yung immunization status ng bata. Minsan kasi, yes, correct, Ma'am Jana. Okay? Minsan kasi kulang lang pala sa bakuna yung bata. Okay? So, pati yung immunization status, tatanungin mo rin. Okay? Next, number 2, you have to classify the child's illness. Ito na yon. Okay? Yung color-coded triage system na binabanggit natin kanina pa. Okay? Kung mapapansin nyo rin, guys, hinihingal na ako. Kung mapapansin nyo rin, guys, okay, wala siya, dito sa slide na to, walang binanggit na diagnosing the child at all. Okay, so let me remind you guys, we are not going to diagnose the child. Okay, we just have to classify, ito po yun, second step, the child's illness. Okay, since the child can have more than one condition, okay, paano natin siya ika-classify? So first, of course, kung kailangan ba niya ng urgent referral, okay, kung kailangan lang ba niya ng specific na medical treatment sa health center, tapos pwedeng pauwiin ng bata, or yung simple advice lang when it comes to the home management. Okay, so that's the red, yellow, green classification. Okay, then the third step, we have to identify the specific treatments for the child. Yun nga yung sinasabi natin, if kailangan ng urgent referral, okay, pre-treatment muna, then refer. Okay, kung kailangan i-immunize, bakunahan natin yung bata. Okay, specific treatments for the child, tailor-fitted yan. Okay, the next is we have to treat the child, actually treat the child. Okay, and this would include the teaching of the caregivers on how to give the fluids, okay, how to give the food, how to give the drugs na pinaprescribe natin sa kanila, okay? And we have to make sure na maiintindihan po yun ng caregiver, na maintindihan po yung ng nanay or ng tatay na mag-aalaga sa bahay. Kasi pagdating nila sa bahay, wala ka na doon. Okay, wala ka na doon. So hindi mo mababantayan or matututukan yung progress ng treatment natin sa bata. Okay, so kailangan malinaw sa inyo yung role ng mother when it comes sa IMCI process. Okay, also we have to advise the mother very well kung kailan siya babalik sa health center. Okay, importante rin po yun. Okay, number 5 is yun na nga, counseling the mother. Okay, then number 6 is giving the follow-up care. Okay, giving the follow-up care. Okay, questions so far? So when you say IMCI case management process, parang ito yung skeletal treatment, okay, na gagawin natin sa bata, no matter what the child's classification is. Okay, ayan. So kung wala pa rin questions, okay, magtunong muna tayo sa alam nating IMCI talaga. Uy, alam mo ba, ito lang yung naintindihan ko ng IMCI lecture namin before. Maraming ganong students na nagsasabi sa akin. Okay, general danger signs lang yung alam nila. Okay, in fact, yung actual words lang talaga na general danger signs. Other than that, wala na daw silang naalala. Okay, so ito po yun, ibabalik lang natin. Okay, i-refresh lang natin. Okay, so these are your 4 general danger signs with the acronym HUVA, okay, or VOLC. Okay, kayo po ang bahala kung saan po kayo mas komportable na acronym. Okay, pero parehas lang po yan. So, pag sinabi mong VOLC, ito yon. Okay, that is your vomiting everything. Okay, the child is unable to eat or drink. Okay, the child is lethargic. And the child has convulsions. Okay, on the other hand, pag gusto mo namang mas maintindihan yung KUVA, that's your convulsions. Okay, unable to eat or drink. Okay, the child is vomiting everything. Okay, ito pong letter apple na to, this one is your abnormally sleepy. Okay, abnormally sleepy. Yan, isa lang po sila nung lethargic. Okay, sige. And either of these or any of these general danger sign is a automatic severe classification. Automatic severe classification. Okay, automatic severe, automatic refer. Isa-isahin po natin. First one, the child is vomiting everything. Okay, ito yung isa pa nating important keyword. The child has to be vomiting everything. So for example, okay, lumapit ang nanay sa'yo sa health center. Okay, tinanong mo siya, nagsusuka po ba ang bata? Okay, sabi nung nanay, opo, nagsusuka po siya. Sinusuka po ba niya lahat? As in, wala siyang tinatanggap na kahit anong pagkain o tubig? Okay, ang sabi nung nanay, opo, sinusuka niya po lahat. Okay, syempre ikaw, you have to have your own assessment. So, pinatry mo, okay, pinabreastfeed mo yung bata. Okay, nagbe-breastfeed, mami, sa harap mo. Okay, nagbe-breastfeed siya sa harap mo. Is that considered as a general danger sign? Yes or no? Is it considered as a general danger sign? Yes or no? According sa history taking mo sa nanay, nagsusuka daw siya. Okay, pero pinabreastfeed mo, nagbe-breastfeed naman. No. Okay, no. Kunwari, sabi nung nanay, sumusuka po ba ang bata? Sabi niya, opo, sumusuka po siya. Ano po yung mga sinusuka niya? Ano po, yung mga solid foods po, sinusuka niya. Okay, yung mga solid foods po, sinusuka niya. Pero yung mga yung gatas, sinusuka niya, hindi po. Okay, is that considered as a general danger sign? Yes or no? Okay, still no. Okay, still no. Ito, criteria ni ma'am. Baka po later niya po isusuka. Okay? Hindi pa rin siya considered as general danger sign kasi ang gusto natin sa bata, okay, para ma-classify siya as vomits everything, walang tinatanggap yung GI niya at all. Okay? Like right then and there, wala pa rin siyang tinatanggap. General danger sign yan. Okay? Kung ngayon, she or he is not vomiting the food that you give, pero afterwards, nagsusuka siya, hindi pa rin siya classified as general danger sign. Okay? Kasi under your severe classification, we would want to assume na severe talaga siya. Okay? Ayan. Okay? Sige. Yun. So, vomiting everything talaga. Okay? Wala talaga siyang tinatanggap at all. Either food or solid foods or milk, wala pa rin. Okay? Next, unable to eat or drink. Okay? Same as vomiting everything yan. Okay? The child is not able to swallow. Okay? Niluluwa niya. Okay? Yun yung unable to eat or drink. What about this one? Lethargic or abnormally sleepy. Okay? May iba't iba pang words ang ginagamit ng BUN for that. Pwede siyang unconscious. Okay? If the child dumating sa health center, hawak-hawak ng nanay, unconscious, hindi mo magising. Is that a general danger sign or no? Diyos ko, mami, wala. Kahit anong tawag doon, ganun mo. Yanig ba yung term doon? Wala pa rin. Kabahan ka na. Internally panics. Ganon. Okay? If the child is unresponsive. Ayan. Pwede nila rin gamitin yung word na to. Unresponsive. Kami nga sa word, adult patients, unconscious. Di ba? Parang grounds for intubation na yun. Paano pa kaya yung bata na unconscious? Di ba? Okay. Sige. If the child, let's say, okay, gising yung bata. Okay? Karga-karga nung nanay. Okay? Pero, nag-snap ka sa mata niya, pumapalakpak ka sa mata niya, walang response. Is that considered as a general danger sign? Yes or no? Yes. Okay? Cause of concern pa rin yun. Okay? So yes, general danger sign, siya, severe, refer immediately. Okay? Yan. Ang binibigay ko lang sa inyo yung iba't ibang words na pwede pang gamitin ng BUN for you to be confused, okay? Minsan kasi yung ibang students nag-stick lang sa kung ano yung binasa nila, okay? Tapos kapag sa actual board exam, hindi nila nakita yung mga binasa nila, nagpapanik na. Where in fact, the BUN just use another word for it. Okay? So you have to be able to analyze the statement very, very carefully. Minsan, akala ng student hindi niya alam yung sagot, okay? Pero binasa niya ulit, alam niya pala. Okay, so i-analyze mo lang, then calm yourself. Okay, kaya mo yan. Okay, alam mo yan. Kasi tinuro sa atin yan. Okay, next, the child has having convulsions. For example, okay, tinanong mo yung nanay, what is the problem? Sabi nung nanay, umuubo-ubo po siya. Okay, ayaw po tumigil ng ubo niya. Okay, tapos inisa-isa mo yung general danger signs. Nagko-convulsion ba yung bata throughout the duration na umuubo siya? Okay, sabi nung nanay, opo. Nag-convulsion po siya kagabi, nag-convulsion po siya. Is that considered as a general danger sign? Yes or no? Okay. Yes. Okay. Very good. What if, this is the case, the mother lumapit sa'yo, okay? You ask the child, the mother, what is the problem? Umuubo po yung anak ko, tsaka sinisipon po. Okay, cough and colds. Okay, tinanong mo yung nanay, nagko-convulsion po ba yung bata? Okay, throughout the duration na meron siyang chief complaint. Sabi niya wala po. Pero may history po siya ng pagko-convulsion. Nung mas bata pa po siya, nagko-convulsion po siya. Is it considered as a general danger sign? Yes or no? No. Okay. Very good. The point is, if the child has a history of convulsion episodes, okay, pero walang actual convulsion episode throughout the duration of his or her chief complaint, okay, it is not considered as a general danger sign. Okay, the convulsion has to be happening at the same time na meron chief complaint yung bata for it to be considered as a general danger sign. Okay? And either way, kahit ano lang po dito, okay, yung matchekan mo sa IMCI form, okay, automatic severe classification, refer urgently to the hospital. Okay? Questions so far? Questions? Okay? Break tayo, 15 minutes. Okay lang? Para tuloy-tuloy tayo. Kasi ang next na natin is yung actual algorithm na. Okay? Sige. So, 15 minutes break. Balik tayo ng 10. Basta yun. Hindi ako so math, guys. Yun. After 15 minutes. Okay? Thank you, guys. Please enjoy your morning break. Thank you. 10:40. Yon, 10:40. Balik tayo 10:40. Thank you, guys.
till January.
Guys, okay na po. Ready na ulit? So, we're done talking about the general overview of your IMCI para lang mas ma-appreciate nyo yung wonders ng IMCI na it's really helpful when it comes to the application of the program sa community. Okay? So now, magtutungo na po tayo sa individual algorithm or table that we really know about when we are imagining IMCI. Okay? Ito yun, guys. Okay? Let's start first with the cough or difficulty breathing as a chief complaint, as a main problem of the child. Okay? So kung mapapansin niyo yung form kanina, yung IMCI form kanina, it started with asking the mother what is the problem, then proceeding with the assessment. Okay, we started with the GDS or general danger signs, which we talked about earlier. Can you give me one general danger sign na alam po ninyo? Okay. We have convulsions, lethargy, vomits everything, unable to eat or drink. Very good. Okay. Next nun is to ask the mother if the child has having cough or difficulty breathing. Okay. We will start the assessment. Okay. Lagi po ito under the pink classification. Okay. I-assess mo yung bata. Ay, mali. Okay. So, tinanong mo. Okay. Tinanong mo yung nanay. Okay. Umuubo po ba ang bata or nahihirapan po ba siya huminga? Okay. Ang sabi nung nanay sa'yo ay hindi po. Hindi po. Okay? Do we still have to go over these symptoms? Do we still have to go over these symptoms? Okay? Tatanungin ba natin yung nanay? Tinanong mo yung nanay, inuubo po ba yung bata or nahihirapan po ba siya huminga? Okay? Sabi nung nanay, hindi po. So, iisa-isahin mo pa ba to? Tatanungin ang nanay, yes or no? Isa-isahin mo pa ba yan? Yes or no? The answer is, hati kayo. Okay? Not anymore. Okay? Not anymore. Huwag ka na magsayang ng effort. Okay? Sabi na sa'yo, hindi naman siya umuupo. Hindi naman difficulty breathing yung problema niya. Okay? Balikan lang natin yung IMCI form. This one. Okay? So we proceeded this. Does the child have cough or difficulty breathing? Okay? Sabi nung nanay, no daw. Okay? And i-check mo yung no. Not necessarily na isa-isahin mo pa to. Okay? Then proceed to the next problems. Okay? Again, then proceed to the next problem. So balik tayo sa table. If ang nanay, tinanong mo, may upo po ba ang bata? Nahihirapan po ba ang bata? Okay nga? Sabi nung nanay, yes. Then that is the time, okay, that you have to go through this algorithm or to this table. Okay? Isa-isahin natin. Let's start with the pink classification because under your IMCI principle or program, okay, we always want to assume that the child has a severe classification. Okay? For us to refer him or her urgently to the hospital. Okay? So, we started with any general danger sign, yung mga nabanggit nyo kanina. Okay? May isa pa siyang criteria. Or, stridor in a calm child. Okay? Again, or stridor in a calm child. Take note of the word or. Okay? Sabi natin kanina sa pinakaumpisa pa lang, IMCI is a very technical concept. Magkaiba kasi yung word na or, magkaiba rin yung word na end. Okay? Yung iba kasi end dito. Okay, but this time, or lang yung sinabi. So, ibig sabihin, either of these criteria, okay, isa lang dyan, mag-yes siya, pink na yan, automatic. Okay, and when you say stridor, guys, when you say stridor, that is a harsh noise that is made by the child when the child breathes in or out. Upon inhalation ba ang stridor or upon exhalation? Is it in or out? Okay, dapat malinaw tayo dyan. Okay? As the child breathes in. Okay, as the child breathes in. Wala naman nagkamali. Okay, very good naman lahat. Okay, so the child has the stridor when the child breathes in. Stridor happens basically when there is a swelling of the larynx, okay? Pwede ring swelling of the trachea, pwede ring swelling of epiglottis. And obviously, guys, okay, this swelling would tend to interfere, okay, with the air moving in and out of the lungs. So, ibig sabihin, ano to, life-threatening po ito. Medical emergency po ito. Okay? Kaya po kapag ang isang bata may stridor, yes, correct, okay? Cause of concern, pink na yan, automatic. Okay? At ang proper, at ang appropriate term natin, okay, under your pink classification would be severe pneumonia or very severe disease. Ulit, it's severe pneumonia or very severe disease. Okay, reminder lang po. Itong mga sinasabi natin na terms na ito, this is not the actual diagnosis of the child. Okay, classify lang natin sila dito. Yan lang yung terms natin for that classification, but not necessarily the actual diagnosis. Okay? So, nasabi na natin, I think tong batang to. Okay, ano na yung interventions na gagawin natin? Ito, give first dose of an appropriate antibiotic, which is what? Which is what? Ano yung ibibigay nating antibiotic dito, guys? Ampicillin and gentamicin. What is the route of the drug? What is the route? Okay, IM. Okay, after giving you first dose of antibiotic, which is ampicillin and gentamicin, we are now going to refer the child urgently to the hospital. May memorize ka ba dito? Wala po. Bakit? Kasi even before na-encounter mo tong table na to, alam mo na yung gagawin. Okay, so one less column for you to memorize. Okay, kasi alam mo na yan. Okay, next, tawid tayo. Color yellow. Okay, if the child has chest in drawing. Okay, if the child has chest in drawing. At ang chest in drawing na po na ito, you have to observe it, okay, to the child. Okay, ang chest in drawing po ba, does it happen when the child breathes in or out? When the child breathes in or out, kailan mo siya i-observe? Okay, as the child breathes, breathes in. Okay, as the child breathes in. Okay, so the child basically has chest in drawing if yung lower chest wall ng bata, okay, if the lower chest wall of the child goes in, okay, when the child breathes in. Okay, so ibig sabihin, this chest in drawing occurs when the effort of the child has to be greater, okay, than what is normal. Okay, so ibig sabihin, nahihirapan siyang huminga. Okay, and for chest in drawing to be present, para ma-checkan mo, okay, yung criteria na may chest in drawing ang bata, it must be clearly visible, it has to be present all the time. Okay, it has to be present all the time. Okay, whether umiiyak siya, whether kalmado siya, may chest in drawing siya, yes, checkan mo yun. Okay, next criteria, sabi daw chest in drawing or fast breathing. Take note of the word or, again, either of these two. Okay, not necessarily na kailangan dalawa to present. Isa lang dito. Okay, and when we say fast breathing, classify natin siya into two. Okay, if the child is 2 to 12 months, that's 50 breaths per minute. Okay, if the child is 12 months old to 5 years old, that's 40 breaths per minute. Again, if the child is 2 to 12 months old, that's 50 breaths per minute. Then pag 12 months to 5 years old, 40 breaths per minute. Okay, ito yung fast breathing nila. Okay, and under your yellow classification, ang term natin for that would be pneumonia. Okay, pneumonia. Sabi natin, paulit-ulit, sorry, paulit-ulit talaga tayo dito. Okay, isang word lang, yung matanggal sa term, iba na ulit yung sagot mo. Okay, for example, tinanggal mo lang yung word na severe dito. Okay, yellow na lang siya, pneumonia na lang siya. Okay, and what do we do under this yellow classification? We have to give oral amoxicillin for 5 days. Okay, tapos ito yung mga more specific interventions that we do to the child. If wheezing is present, okay, we give an inhaled bronchodilator. Yes, included yung less than 2 months, 60 breaths per minute. That's true. Okay, that is for the sick young infant naman. Sick young infant naman sila. Remember? Okay, 60 breaths per minute yung fast breathing nila. Okay, if the child has chest indrawing in HIV exposed or infected child, you give the first dose of amoxicillin and refer. Okay, then you soothe the child or the throat and relieve the cough. If coughing is more than 14 days, okay, or recurrent na siya, refer mo siya for possible TB or asthma assessment. Kasi possibly iba yung problem niya when it comes to the respiratory tract infection. Pwedeng hindi siya pneumonia pag chronic yung cough niya. Okay? Tapos andito na rin yung alam nating usual treatment under your yellow classification, which is advising the mother when to return and follow up in 3 days. Okay? Following up in 3 days. Okay? Next, pagtawid naman natin, medyo milder form lang naman siya, green classification. Okay? Sabi natin kanina, the way that we would assess the child, we always start with the pink classification. So, kapag nag-no ka sa lahat na to, na criteria na to, okay? Pero may ubo ng bata, color green na lang siya. Ang tawag na lang natin sa term na yon ay cough or colds na lang. Okay, cough or colds na lang siya. Okay, then ganun pa rin, the usual treatment, soothe the throat, okay, advise the mother when to return, then following up in 5 days if not improved. Okay, ganun. So, if we go through each statement under this third column, you would notice na, okay, napag-usapan na natin siya kanina, not really necessary to memorize it anymore. Okay, so I'll give you 1 minute to look at this slide, tapos pa-practicein natin if may pumasok pa, guys. Okay, sige lang. For example, merong nanay na lumapit sa'yo sa health center. Dala-dala niya yung anak niya, okay? 11 months old. Okay? 11 months old. Okay? You would want to assess if the child has fast breathing. So, binilang mo yung breaths per minute niya. Okay? Nag-stop ka sa 50 breaths per minute. 11 months old, 50 breaths per minute. Is it considered as a fast breathing? Yes or no? Yes, okay. May nanay na lumapit sa'yo, dala-dala niya yung anak niya, okay? 4 years old. 4 years old yung anak niya. Okay? You would want to assess if the child has fast breathing. So, binilang mo yung breaths per minute niya. 40 breaths per minute. Is it considered as a fast breathing or no? 40 breaths. Okay. Ano yung question sa third intervention ng yellow? If chest indrawing in HIV exposed child, give first dose of amoxicillin and refer. Yes. Okay, sige, please tell me what color is this one? What color is this one? Any general danger signs? What color? Any general danger signs? Okay, that's color pink. Stridor in a calm child. Stridor in a calm child. What if may stridor in a crying child? Stridor in a crying child, what would you do? What would you do? Stridor in a crying child. Imaginary situation. Okay, yes, very good. Okay, calm the child first. Patahanin mo muna. Okay, kasi hindi mo ma-appreciate yung strider pag umiiyak siya. Sometimes may mga strider na normal kapag umiiyak ang bata. Okay, so dapat kalmado yung bata. Okay? Sige, next. Wala lang. Kasi strider in a crying child, ni-refer niya agad. Okay? Calm mo muna. Patahanin mo muna. Okay? Hour of child 12 months to 5 years to be considered as fast breathing. To be considered as fast breathing. Okay? Yes. 40 breaths per minute. Yellow classification. What is the proper term for yellow classification? Kailangan alam niyo to guys kasi minsan nagkakalituan sa multiple choices. May multiple choice. Yellow classification, letter A, pneumonia. Letter B, mild pneumonia. Letter C, moderate pneumonia. Tapos ang sinagot, since yellow, tapos nasa gitna, baka moderate pneumonia. Mali na agad. Okay? Pneumonia lang po. Okay? Pneumonia lang po. Okay? Next, green classification. Green classification. Anong term natin for that? Okay? Anong term natin for that? Dito naman, paano kayo malilito dito? Ang gagawin ng BON, isasama nila yung no pneumonia, letter A. Letter B, pneumonia. Okay? Ganyan. Cough or colds? Yes, cough or colds. Next, antibiotic of choice for pneumonia. Antibiotic of choice for pneumonia. Okay? Amoxicillin. IM or per oral? Nalito na. Yellow tayo. Okay, super oral. Kaya ng oral niya. Okay, next. Antibiotic of choice for severe pneumonia. Okay. Ampicillin and gentamicin. Okay, ampicillin and gentamicin, IM. Next, fast breathing. What color? What color? What color? Okay, color? Yellow. Very good. Refer urgently to the hospital. Walang kasawaang refer urgently to the hospital. Hanggang sa panaginip, may refer urgently to the hospital. Okay? That's either pink or red. Very good. Pink or red. Wala pong violet. Okay? So we're done talking about your cough or difficulty breathing portion. Okay? Pupunta na po tayo sa diarrhea for dehydration. Okay? So na-assess mo. Okay? Nagtatai po ang bata. Okay? Mas concern mo kung may dehydration na ba. Okay? So ito, ganun pa rin. We start with the pink classification. Okay? Sabi daw, 2 of the following signs. Again, just 2 of the following signs. Not necessarily na kailangan lahat to makita mo sa bata. Okay? Just any 2 of the following signs. The first one is lethargic or unconscious. Basically, pag hindi mo na magising yung bata, okay? Pag niyuyug-yug-yug mo, wala siyang response. Okay? Severe dehydrated na yung bata. Okay? Next one. Okay? Pag sunken eyes na yung bata. Okay? Lubog na po yung mata niya. Third one, unable to drink or drinking poorly. Okay? If the child is unable to drink or drinking poorly, then if the skin pinch goes back very slowly. Okay? Take note of the word very slowly. Kasi mamaya may encounter nyo to pero wala na yung word na very. Okay? Again, skin pinch goes back very slowly. That's color pink, severe dehydration. Okay, severe dehydration. Hindi ka naman na mahihirapan intindihan kasi may word na severe. So, automatic pink na yan. Okay? Sabi daw, if the child has no other severe classification, okay, just give fluid for severe dehydration muna. Okay, ito yung isa sa mga sikat na lumalabas sa board, yung mga plan. Okay, yung plan B, plan A, plan C. Okay, under your pink classification, that's plan C. Okay, that's plan C. Okay, silipin natin kung ano yung plan C. Ito yon. Okay, so may algorithm ulit. So you have to treat severe dehydration quickly. Can you give IV fluids immediately? Okay, so kapag yes, ibigay mo. Okay, kapag no, proceed to the next. Is IV treatment available nearby? Okay, kung yes, i-refer mo na. So kung mapapansin nyo, ang pinaka-endpoint lang din naman, okay, na algorithm na to is to refer the child urgently to the hospital. Okay, referring the child urgently to the hospital, which goes to show na, okay, parallel din naman yung intervention kasi nga, nasa color pink classification tayo, which is basically, or mainly speaking, referring the child urgently to the hospital. Okay, if the child also has another severe classification, okay, refer urgently to the hospital. Okay, so di ba sabi natin, tatapusin mo yung IMCI form. So kung hindi lang naman po pala, isa lang yung severe, okay, kung dalawa yan, refer urgently. Ayan, huwag mo nang practice yung plan C. Okay, sige. Next, yellow classification. Under your yellow classification, ganun pa rin. Just 2 of the following signs pa rin. Okay, just 2 of the following signs. Not necessarily lahat to makikita mo sa bata. Okay, first one, kung sa pink classification, okay, hindi mo na magising yung bata. Dito, on the other hand, restless siya, irritable siya, gising na gising. In fact, kapag inoferan mo yan ng tubig or kapag inoferan mo siya ng gatas, okay, iinumin niya yan with all his heart and soul, okay, because she or he is very thirsty, okay? That child would be drinking eagerly, okay? Ito yon. Okay, what else? Ganun pa rin, sunken eyes, and then the skin pinch would go back slowly. Okay, nawala na yung word na very. Okay, again, wala lang yung word, yung isang word, iba na ulit yung sagot mo. So you have to be very careful in reading the statement. Okay, yung iba na excite sumagot. Okay, so na-overlook yung isang word. Sayang yung point. Okay, and under your yellow classification, ang tawag na lang natin sa kanya ay some dehydration. Okay, take note of the word that was used. It's some dehydration, not moderate dehydration. Okay, walang moderate, wala ring mild dehydration. Okay, nakakalito yan sa board exam. Okay, next, ano yung treatment na gagawin natin under yellow classification? We have your plan B. And basically, ano yung nilalaman ng plan B? Just treating the dehydration with oral or ORS. Okay, yung ORS natin. Okay, so after giving the child ORS, i-reclassify mo na siya. Okay, but then, if the child also has another severe classification, okay, upon completing the IMCI form, okay, mag-proceed ka na sa hospital, i-refer urgently mo na yan. Okay, sige. Next, lastly, inisa-isa mo tong signs, symptoms na to, lahat naman siya no. Okay, lahat naman siya no, pero nagtatae. Okay, lahat siya no, pero nagtatae. Okay, if there is not enough signs to classify as either some or severe dehydration, color green na lang siya. Okay, which is no dehydration. Okay, which is no dehydration. Okay, ganun pa rin ang treatment natin. Plan A na lang siya. You have to give enough fluids, okay, the zinc supplements and food to treat your diarrhea at home. Okay, tapos yung walang kamatayang advising the mother that following up in 5 days if not improving. Okay, ganun siya. One minute. What color classification, okay, is this one? Some dehydration. What color? Some dehydration. What color? Some dehydration. What about moderate dehydration? Moderate dehydration. Pumili. Pumili. Wala. None. Non-existent. Correct. Okay. Next, no dehydration. No dehydration. Di ba sabi natin, it's very either you know it or you don't. IMCI is very technical concept. So dapat kung ano yung nabasa mo doon sa book, sa manual, yun din yung hahanapin. Okay? No dehydration, color green. Next, unconscious. The patient is unconscious. Color pink. The patient is lethargic. The patient is unresponsive. Okay. Plan C. Plan C. Plan C. Color pink. Drinks eagerly. Parang hindi pinainom sa bahay. Ano yan? Color yellow. Okay, color yellow. Sunken eyes. Sunken eyes. Pink lang. Pink and green. My green was the option. Pink and yellow pala. Okay. Pink and yellow. Unable to open eyes. Unable to open eyes. Tatandaan ko yung mga sumagot. As in, nagtatampo na ako. Meron ba tayo na pag-usapang unable to open eyes? Balikan nga natin yung table. Hanapin natin. Baka maliliit lang yung sulat. Wala, guys. Apparently, wala. Sorry to disappoint you. Okay? Guys, wag kayong uto-uto. Okay? Pwede naman kayo sumagot na none of the above. Ganon. Okay? Okay lang yan. Unable to open eyes. Walang ganon, mommy. Okay? So, no. None of the above. Okay? Next, unable to close eyes. Yon. Unable to close eyes. Not-carried away. Okay? Sa actual board exam, bawal yung mga naki-carried away, guys. Okay? Okay lang ma-carried away ngayon. Pero sa actual boards, wag naman po. Sige, unable to close eyes. Wala pong ganon, Mars. Next, drinks eagerly. Drinks eagerly. Okay? Yellow. Skin pinch goes back slowly. The skin pinch goes back slowly. Okay, yellow. May nakikita pa akong pink. Kung pink ang sagot mo dito, then paano naman to, guys? Skin pinch goes back very slowly. Napagbaligtad nyo. Okay. Napagbaligtad. Okay. Pink yan. Okay. Very slowly is the pink. Okay. Very slowly is the pink. Take note of the word very. Okay. Yun nga yung sinasabi natin. Tanggalin mo lang or dagdagan mo lang yung isang phrase or statement, iba na ulit yung sagot. Okay, plan A. Plan A. Plan A, that's color green. Very good. Okay, not enough signs to classify as some or severe dehydration. Okay, green. Next, pink classification. Pink classification. Anong term natin for that? Okay. Anong color? What color kapag sinabing ultra mega dehydration? Okay. Walang ganon B. Okay. Wala pong ganon. None of the above. Next, restless or irritable. Next, restless or irritable. Okay. Color yellow. Referring urgently to the hospital. Sisisihin kita, ma'am, pag napanaginipan ko to mamaya. Okay. Refer urgently to the hospital. That's color pink. Now, we're not talking about your dehydration in the context of your, your diarrhea in the context of your dehydration. Meron pa pong isa. Okay, meron pa pong isa. May diarrhea si baby. Okay, may diarrhea si baby, pero ang concern natin is yung chronicity niya, if it's for 14 days or more. Okay, now, if the dehydration is present, color pink yan, severe persistent diarrhea. Ganun pa rin, present pa rin yung word na severe. Okay, treat dehydration before referral unless the child has another severe classification, then refer to the hospital. Okay, next. Kapag may diarrhea siya for 14 days or more, pero wala namang dehydration, yellow lang siya, which is persistent diarrhea. Okay, persistent diarrhea. Advising the mother on the feeding. Okay, give your multivitamins and your zinc. Okay, for 14 days, then follow up in 5 days. Okay, follow up in 5 days. Next, what about Okay, may diarrhea siya for 14 days or more. Tapos tinanong mo yung nanay, may dugo po ba sa dumi ng anak ninyo? Okay, and then she said yes. Ang tawag na natin dyan ay dysentery, which is still under your yellow classification. Okay, nag-introduce po siya ng bagong antibiotic that is ciprofloxacin for 3 days exclusively for your diarrhea, dysentery, ciprofloxacin for 3 days. Okay, then follow up in 3 days. Follow up in 3 days. Nay, ito po yung gamot, ciprofloxacin. Okay, painom niyo po ito sa bata. Isang tableta, okay, sa loob ng 3 araw. Pag naubos to, okay, balik ka sa akin. Follow up in 3 days. Okay, so kung mapapansin nyo guys, sa slide na po na ito, walang color green. Okay, so mamaya pag magtatanong po ako, wala pong green na sagot. Okay, so another minute for you guys to study. Okay, to take a look at this slide. Tapos, check natin kung naintindihan. Paano po kung unable to drink yung bata? Pero sabi natin kanina sa referral steps is to advise the mother to breastfeed or give frequent sips. So in that case, you have to analyze the situation. So dapat tailor-fitted talaga yung interventions na ibibigay mo per case of the child. Okay? So ito, yung IMCI, parang ito yung mga recommended instructions, interventions for you to do with the child who has this certain condition. Na kung hindi pala applicable sa isang bata, okay, yung ganong intervention, of course, you wouldn't want to do that. Okay? So gawin mo lang yung kaya mong gawin. Remember, CHN community setting ito. Hindi naman lahat may resources. Okay, so kung kulang ka sa resources, just do what you can do, then refer immediately. Okay? Ready, 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 ready. Which color is it? If there's a blood in the stool. Blood in the stool. Ay, nakita ko to, photographic memory, nasa pinakababa. Okay, color green. Nasa pinakababa, color green. Okay, tapos kasasabi lang na wala pong color green sa slide. Ah, so yellow. Okay, so that's color yellow. Next, blood in the stool. What term? Anong term natin dyan sa blood in the stool na yan? Anong tawag natin dyan? Nag-iisa lang yan. Ay, nasa baba ulit yan. Nasa baba ulit ng slide. Color yellow, dysentery. Okay, dysentery. Ulit, that's dysentery. Follow up in 5 days. Follow up in 5 days. Alam ko na kailangan mag-follow up sa yellow tsaka sa green. Definitely, walang follow-up na mangyayari sa color pink kasi refer urgently na yan. So, malilito na lang ako between yellow or green. Okay, that's 5 days daw. So, that's color yellow. Okay, that's color yellow. Follow up in 3 days. Follow up in 3 days. Color yellow. Okay, pero anong term natin dyan? Anong term? Yellow dysentery. Yellow dysentery. Okay, yellow dysentery, follow up in 3 days tapos na. Severe persistent diarrhea. Ay, severe. Nakita ko yung word na severe. Kailangan ko pa ba mag-isip dito? Okay, hindi na po. Automatic, that's color pink. Automatic color pink. Severe persistent diarrhea. What about, tinanggal ko yung word na severe, mami. Ano na lang siya? Persistent diarrhea na lang. Okay, persistent diarrhea na lang siya. Okay, color yellow. Very, 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 very good. Antibiotic of choice for dysentery. Antibiotic of choice for dysentery, ciprofloxacin. Nag-iisa lang po siya dyan. Wag na po kayo magpapalito. Okay, wag na po kayo magpapalito. Ciprofloxacin. How many days to give your ciprofloxacin? How many days to give your ciprofloxacin? Okay, for 3 days. Then follow up in how many days? Kailan ako magpa-follow up? 3 days pa rin. Pag naubos yung gamot, balik ka sa akin, nanay. Okay? Walang kamatayang referring urgently to the hospital. What color? What color? Color pink. Okay? Color pink. Very good. Very good. Sir V, kailangan pa ba ako dito? Para alam na nila. Okay? Next one. Okay, so we're done with your cough and colds. We're also done with your diarrhea in the context of having dehydration or yung chronicity niya for 14 days or more. We'll be talking about your fever. Ano po yung restless or irritable? That's color, what do you mean? Yellow. Color yellow. Okay? Color yellow siya. Okay? May fever ang bata, may lagnat yung bata. Okay? Pero may isa siyang criteria. Kapag nakatira daw po, okay, yung pamilya nila sa either high or low malaria risk, ito yung susundin mo. Okay? Ito yung susundin mo. Ngayon, hindi naman siya nakatira sa either high or low malaria risk. Huwag mo nang pansinin to. Itong table na to, hindi applicable to sa kanya. Okay, now we'll start with the color pink classification. Ganun pa rin. Any general danger sign or take note of the word or, ibig sabihin, isa lang po dito yung mag-satisfy, color pink na siya. Okay, or stiff neck, guys. Or stiff neck. Okay, stiff neck para exclusive sa malaria mo siya makikita. Malaria lang, okay? So, under your pink classification, ang tawag natin dyan would be very severe febrile disease. Okay, very severe febrile disease. Okay, very severe febrile disease. Ganun pa rin. Give first dose of artesunate or quinine for severe malaria. Okay, may inintroduce po siyang bagong antibiotic for your anti-malarial. Okay, pakisulat na lang po artesunate or quinine. Ano po ang route? IM pa rin. Okay, IM pa rin po yan. Okay, IM pa rin. Next, give the first dose of an appropriate antibiotic, which is what? Under your pink classification? Ampicillin and gentamicin. So, paano po yun, ma'am? Parehas po ba itong ibibigay? Artesunate or quinine, pati yung ampicillin, gentamicin? Yes, parehas nyo po siyang ibigay. Okay, parehas nyo po siyang ibigay. Then, treat the child to prevent your low blood sugar. That's either giving the child a breast milk or sugar water. Then give 1 dose of paracetamol in clinic for high fever. Okay? Kasi po, nasa mundo po tayo ng fever. Febrile po ang pasyente. So magbigay ka ng antipyretics, which is paracetamol. Okay? Then referring urgently to the hospital. Okay? Hindi po yan mawawala. Lagi siyang nandyan. Refer urgently to the hospital. Okay? What if IM din po yung quinine? Yes. Okay? What if nag-malaria test tayo? Okay? Ano ang diagnostic test ng malaria? Blood smear, right? Okay, nag-malaria test tayo at nag-positive si baby. Okay, nag-positive si baby. Yellow na lang siya, malaria. Consider it malaria. Okay, so give recommended first line oral antimalarial. Okay, artesunate, pwedeng PO na yan. Okay, then give your 1 dose of paracetamol. Ganun pa rin kasi may lagnat po si baby. Okay, give appropriate antibiotic treatment for an identified bacterial cause of fever. And for you to do this, kailangan may culture ka dyan. Okay? Kailangan may culture ka dyan. Okay? Kailangan mo ng lab dyan. Okay? Advising the mother when to return immediately, then following up in 3 days if the fever persists. Okay? Kasi nasa color yellow tayo. Okay? What if the malaria test is negative? Pinatest mo yung bata sa malaria at nag-negative. Okay? Ano na lang siya dyan? Color green. May lagnat lang siya, pero walang malaria. May lagnat lang siya, pero walang malaria. So that is the time for you to explore more about the causes of that certain fever. Okay, anong gagawin mo? Ganun pa rin po. Just give your 1 dose of paracetamol kasi may lagnat po si baby. Then appropriate antibiotic. Okay, in case nalaman niyo yung cause ng fever or kung may infection present. Okay, then advising the mother when to return immediately, then following up in 3 days if fever persists. Okay, may kailangan ka bang i-memorize dyan ng malupitan? Wala naman, may bago lang siyang binigay, yung artesunate quinine, the rest alam mo na yan. Diba? May tanong ako, what if sa certain province or RHU, wala silang paulit po ng medication sa malaria, that is your artesunate or quinine. Ito po yun, artesunate or quinine. Okay? Wala silang microscope sa RHU. Okay? And that certain province is a high malaria risk. Tapos may fever si baby. Okay? would I consider the child to be positive of malaria and treat the child as if may malaria siya? Yes or no? Yes. Yes. Okay. Yes. Kung wala kayong microscope, tapos high malaria risk, okay, just treat the child as if may malaria siya. Okay? Color yellow tayo dyan. Okay? Color yellow tayo dyan. Okay? Sige. What color classification is it when the child has fever and at the same time, okay, has any of the general danger signs? May fever plus any general danger signs. Ano yan? Okay, that's color pink. What if tinest natin ng bata sa malaria and the child tested positive? What color? Child tested positive. Parang yun lang naman yung kaisa-isang criteria for color yellow. Okay, so that's color yellow. Very good. Malaria test negative. The malaria test is negative. Okay, the malaria test is negative. Its color green. Color green. Wala ka ng ibang choice. Okay, next, fever, no malaria. Fever, no malaria. May fever pero walang malaria. Anong kulay yan? Okay, that's color green. Color green. Next, antibiotic of choice for severe malaria. Antibiotic of choice for severe malaria. Okay. It's not ampicillin and Genta. Okay, anti-malarial yung hinahanap natin. So that's artesunate and or quinine. Okay, artesunate or quinine, whichever is available. Which route should I give this artesunate or quinine? Yung artesunate pala, pwede siyang suppository. Okay, may suppository in option. Okay, for artesunate. Pero yung quinine, IM talaga siya. Okay, next, give 1 dose of paracetamol for a fever. 1 dose of paracetamol for a fever. Okay, across all colors. Okay, across all colors. Kasi nasa mundo po tayo ng fever. So lahat yan, okay, bibigyan mo. Next, pink classification. What term? Anong term natin for that? For color pink classification. Okay, so any general danger signs or stiff neck. Okay, very severe febrile disease. Okay, so that's very severe febrile disease. Again, very severe febrile disease. Stiff neck. What color? Anong kulay ang stiff neck? Stiff neck in my neck. Anong kulay yan? Color pink. Okay, color pink. Nag-iisa lang siya dyan. Give quinine for this classification. Give quinine for this classification. Okay, so that's color pink. That's color pink. Next, green classification. Anong term for your green classification? Mali yung no malaria lang. Dapat kompleto. Okay, it has to be fever, no malaria. Paano ko ang choices? Letter A, no malaria. Letter B, fever, no malaria. Tapos na-excite ka sumagot. Sanagot mo yung letter A. Sayang yung point, mami. Okay, bawal lang po magbura. Okay, sayang. Okay, so dapat kompleto. Again, it has to be complete. Okay, ngayon pa lang practicein nyo na dapat kompleto. Okay, next one. The baby has a fever and is lethargic as well. What color? Okay? The baby is 18 months old. Okay? Has a fever. Okay? Has a fever, is lethargic, does not vomit everything. Okay? Ano yung first line ng oral anti-malaria ulit? That's your artesunate po, artesunate. Okay? Nawala ako. So the child is 18 months old, has a fever, is lethargic, does not vomit everything, does not have any convulsion, does not have a stridor. Okay? What color? What color? Di ba lethargic? So automatic, pink na siya. Okay? Automatic pink na siya. Okay? Basta any of the general danger sign, pink siya. Automatic. Okay? Next one. Referring urgently to the hospital. Referring urgently to the hospital. Paano po yun, ma'am? Yung ganong klaseng situation, yung pinagsama-sama sa isang situation. Tapos, ang style natin doon, basta may makita kang isang general danger sign, automatic pink na siya. Okay? Tsaka kung ano yung pinaka-severe, yun yung pipiliin natin. Because yun nga, yung main principle ng IMCI, we want to assume na severe yung classification ng bata. Hindi, oral. Oral yung paracetamol. Okay? Oral yung paracetamol. Okay? Sige. What if nasa mundo pa rin tayo ng fever, pero yung bata, wala na siya sa malaria risk. Okay? Hindi rin siya bumiyahe, nag-travel sa malaria risk areas. Ito po yung susundin mong table. Okay? Ito yung susundin mong algorithm. Okay? Ganun pa rin, we'll start with the pink classification, any general danger sign, and stiff neck. Okay? And stiff neck. Okay? So pink yan, very severe febrile disease. Okay? So give first dose of appropriate antibiotic. Walang kasawaan ang penicillin, gentamicin, IM. Okay? Then treat the child to prevent low blood sugar. Okay? Then give 1 dose of paracetamol in clinic for the high fever. Then refer urgently to the hospital. May memorize ka ba dito? Parang wala naman. Kasi alam na natin lahat to. Okay? Ito lang yung iintindihin mo. Yung criteria, pati yung appropriate term for the classification. Very severe febrile disease. And as you can see, wala tayong color yellow. Okay? Yung iba na may photographic memory, okay? Wala pong color yellow, green agad. Okay? Ito yon, no general danger signs and no stiff neck as well. Walang everything. Okay? Fever lang talaga meron siya. That's color green. Okay? Color green. Just give your 1 dose of paracetamol. Okay, then give appropriate antibiotic treatment should you explore further for the cause of the fever. Pag once na nalaman mo, okay, kung ano yung bacteria na meron siya, ibigay mo yung appropriate antibiotic for that. Then advise the mother when to return immediately and then follow up in 2 days if fever persists. Okay, laging may follow up. Okay, laging may follow up. Ito, it has to be present both na. Kailangan both meron na siya. Any general danger sign and stiff neck as well. Okay? Sige. Ang chief complaint daw po ng bata na 3 years old, okay, ay fever. Okay? Nilalagnat po yung anak ng nanay. Okay? In-assess mo, wala namang general danger sign. Which color? Color green. Wait lang, may ay, nawala na. Wait lang po. Ang penicillin and gentamicin is Antibiotic for what po? Those are your recommended antibiotics under your pink classification. So, chinek natin yung each table kanina, tapos may nakita kang statement na ganito, give first dose of appropriate antibiotic. It talks about your ampicillin and gentamicin. Okay? Ayan. Generally speaking, for your pink classification. Okay? Sige, what about, in-assess mo, walang general danger sign, may lagdat, at wala ring stiff neck. What color classification is that? What color classification? Okay? What color? Kailangan ko pa bang isipin yan? Okay? Color green. Okay? Color green. Mild form. Okay? Next, may stiff neck na siya ngayon. May stiff neck na siya ngayon. Okay? Color pink. Color pink na. Follow up in 2 days. Fever persists. Follow up in 2 days if fever persists. Okay? Tapos nakita ko kanina, wala namang color yellow. Eh pag pink, refer urgently. So green na lang yung natira. Color green tayo dyan. Okay? Color green tayo dyan. Questions so far. Okay? So we're done talking about the outline lang natin. Yung general overview, okay, na IMCI, tapos na tayo. General danger signs, tapos na tayo. Okay, cough or difficulty breathing, tapos na. Diarrhea for dehydration, tapos na. Okay, what if may stiff neck pero no general danger sign po? Okay, under what? Malaria risk area or no? In malaria risk or no? No malaria risk. I think it's safe to say you consider it as pink. Okay, consider it as pink pa rin. Okay. Ay, asa na tayo? Wait, naligaw na ako. Okay, so tapos na tayo sa diarrhea for dehydration. Diarrhea for more than 14 days or more. Okay, we talked about your fever in either high or low malaria risk areas. We also talk about your fever in no malaria risk areas. Okay, dito na po tayo ngayon sa measles. Okay, measles. Mamaya pag-uusapan natin, okay, yung measles as a communicable disease. Pero this one, gusto ko ring i-appreciate ninyo. Paano ba yung approach ng measles intervention under your IMCI program? Ito yon. Okay? So we still start with your pink classification with any general danger sign. Hindi naman po mawawalan yan. Okay? Or clouding of your cornea. Okay, so ibig sabihin may eye complication na siya. Okay, what else? Deep or extensive mouth ulcer. It's not just a simple mouth complication, pero deep or extensive mouth ulcer. Uy, parang severe na talaga siya, which is yes, severe complicated measles ang tawag dyan. Okay, again, severe complicated measles. Wala pong nabanggit na severe measles. Kaya naman kapag nakita niyo siya sa multiple choice na may severe measles, huwag niyong isagot kasi kulang yon. It has to be complete. Severe complicated measles. Okay, severe complicated measles. You give your vitamin A treatment. Ano yung importance ng vitamin A treatment kapag may measles ang bata? Kapag may measles ang bata. Obviously, guys, kung mapapansin nyo, isa sa complications ng measles, okay, na children's measles, is yung eye complications. And as we know, if the child has vitamin A deficiency, more prone siya sa eye complications as well. Okay, so if you give the child a vitamin A treatment, okay, mas ma-reduce yung chances of having further eye complications such as your xerophthalmia, okay, yung dryness ng conjunctiva niya, ano pa, as well as blindness even, okay? Hindi lang din siya limited sa eye complications, okay? Pwede rin siya sa respiratory complications, okay? May journals tayo supporting, okay, the fact that giving vitamin A treatment to the child having measles, okay, would also reduce his or her complications with regards to his respiratory system, such as yung pneumonia, okay? Sige. Alam natin sa CHN concept, yes, okay, I'm going there, okay? Na kailangan nating magbigay ng vitamin A, okay, na mandatory, okay? For babies ages 6 months, okay? For babies ages 6 months to 12 months old. Sana naiintindihan niyo yung sulat ko. For 6 months to 12 months old, ang dose po ng vitamin A natin should be 100,000 IU. 100,000 IU, international units. Okay? Paano po kapag medyo tumanda-tanda si baby? Okay, so that's 1 year older. 1 year or older. Okay? Ilang dose na po yung ibibigay natin? Siyempre, mas mataas na dose. So that would be 200,000 IU. 200,000 IU. Yung. Okay? And these 2 vitamin A dosages are mandatory for every children. Okay? Pag tumungtong ang bata ng 6 months, magbigay ka ng 100,000 IU. Okay? So, balik tayo sa table. Sabi daw, you have to give your vitamin A treatment. Therefore, ang sinasabi nitong vitamin A treatment would be just a supplement, okay, to the mandatory vitamin A that you will be given to the child. Okay? Kunwari, lumapit sa iyo yung nanay, may measles yung anak niya. Okay? Nag-assess ka, nabigyan na po ba siya ng vitamin A before? Okay? Sabihin natin 6 months yung bata. Sabi niya, hindi pa po. Therefore, okay, ang gagawin natin, you have to give the mandatory dose of vitamin A as well as the additional vitamin A treatment, okay, under your IMCI program. So, 2 dose ang ibibigay. Okay, 2 dose ang ibibigay natin. Okay, next, treatment. Okay, have to give the first dose of appropriate antibiotic, which is what? So, kakalimutan niyo pa ba to, guys? Which is what? Ampicillin, gentamicin. Ampicillin, gentamicin. Okay? If clouding of the cornea or pus draining from the eye is present, okay, nasabi na rin natin ito kanina, apply your tetracycline eye ointment. Okay? Eye ointment. Okay? Ilang dose po? Same lang. Same dose according to the age. Same dose. So parang i-double dose mo siya if wala pa siya no previous dose. Okay? And then we have to refer urgently to the hospital. Okay, refer urgently to the hospital. Nasa color pink tayo. Okay, tawid tayo, color yellow. If the child has a pus draining from the eye, may nana siya, okay, or mouth ulcer, pero hindi naman ganun ka-extensive. Okay, it's just measles with eye or mouth complications. Okay, medyo mahaba. Measles with eye or mouth complications under your yellow classification. Ganun pa rin, dahil may measles ang bata, still give your vitamin A treatment, okay? Either supplement kung nabigyan na siya before, okay? Or yung both dose na mandatory, pati yung supplement niya. Okay? Then, if pus draining from the eye, ganun pa rin, tetracycline eye ointment. If with mouth ulcers, treat with gentian violet. Alam ko na to since from the start. Okay? I don't really have to memorize na. Okay? Next, follow up. In 3 days. Sabay po bang ibibigay sa ampicillin and gentamicin? Okay? According to the IMCI, dapat as much as possible, kung available yung 2 antibiotic, ibigay mo sabay. Okay? Sabay. Okay. Ayan. Kasi kapag binasa mo yung manual, hindi siya nakabanggit doon na ampicillin or gentamicin. So, it has to be both. Be given. Okay? If nabigay na previously, yung itong mandatory, yung supplement na lang. Yung supplement na lang ibigay mo. So, isang dose lang na supplement. Okay? Sige. What if, under your green classification, ibigay mo yung supposed na mandatory, tapos idagdag mo yung supplement. Magda-double dose ka. Okay? Parang prophylaxis, prevention mo siya. Kasi may measles yung bata. Tapos prone to complication kasi siya. Yun yung ayaw nating mangyari. Ay, sorry. Na-typo ka po ata, sir. Okay, pipili. Sa first dose po na antibiotic, hindi ka both po na ibibigay yung ampicillin and gentamicin. If both are available. If both are available. Okay? So, kung isa lang dun yung available, either of the two. Pero kung both, yan. Okay? Sige. So, yun guys. If may measles lang siya, walang any complications, okay, just classify the child under green classification, under measles. Okay? Then just give his or her vitamin A treatment. Yeah. Oo. pag sobrang dami. Extensive mouth ulcers, pag sobrang dami na ng lesions niya. Pwede ka magbigay. Oo. Pwede ka magbigay dito ng gentian violet for the mouth ulcer. Tapos i-refer mo lang. I-refer mo na immediately. Actually, either way, yung mga gagawin mong treatment dito, syempre, di ba, when you refer, you have to tell the healthcare professionals hospital kung ano yung mga binigay mo na sa kanya. Okay? And then just tell the healthcare professionals hospital that you were able to give this tetracycline, this gentian violet. Okay? Sige. What if yung nanay, ipakalala na nga natin yung nanay, mami. Ulit po ng vitamin A. Okay, sige. Lahat ba ng concept about vitamin A? Sige. Alam natin, under your CHN concept, that when the baby reaches 6 months old, kailangan natin magbigay ng 100,000 IU na vitamin A na mandatory. Okay? Pero in this case, kapag lumapit sa iyo yung nanay na may tigdas yung anak niya, okay, according to IMCI principle, you have to give additional dose of vitamin A treatment because according to studies, this vitamin A helps reduce further complications of the measles. More specifically, your eye complications such as your xerophthalmia or blindness or yung clouding ng cornea, as well as respiratory complications such as pneumonia. Okay? If according to your history taking, na ibigay na po yung mandatory dose even before, okay, supplement mo na lang yung ibibigay mong vitamin A. You still have to give your vitamin A. Okay? Separate siya, dose. Okay? Ganon. And since ang main chief complaint ng bata ay measles, so ibig sabihin, across all colors po, magbibigay tayo ng vitamin A. Okay, whether it's severe or measles with complications or simply measles lang, still give your vitamin A. Okay, because ang target natin, ayaw natin magkaroon ng complication yung bata. Okay. Pwede, oo. Oo. Double dose mo siya. Okay? Kasi ang lalabas nun, kaya siya double dose, sinupplement mo yung vitamin A, which is all right, okay? Kasi the baby needs that, okay? Kasi may measles siya. Okay, assume double dose. Assume double dose. Okay? Babalik lang tayo sa significance ng vitamin A kung bakit ba siya kailangang ibigay. Okay na? More questions? Okay, sige. If the mother comes to you sa health center, dala-dala niya yung anak niya na merong measles, okay? May measles siya and upon assessment, the child is lethargic as well. Okay? What color classification is that? Okay, color. Wait lang, sorry po, hindi ko po naintindihan yung question. Then yung quinine, pwede, na-typo ka po ata. Yung artesunate can be given IM or suppository, whichever is available. But the quinine, you have to give it IM lang. Okay? Yung artesunate naman, under your yellow classification, can be given per RM. Okay? Sige. Next, give first dose of appropriate antibiotic. Which color? Which color? Color pink. Okay, color pink. Measles. Pag measles lang yung term na binigay sa'yo, which color is it? Which color? Okay, color green. Color green. What if, okay, walang measles ang bata ay walang measles ang bata, ano nang gagawin mo? Nalito na. Walang measles ang wala. Proceed to the next. Okay? Proceed to the next. Okay? Balik tayo sa IMCI form. Wala kang gagawin. So proceed to the next. Next, severe complicated measles. Severe complicated measles. Which color? Okay. Which color? Color pink. What if complicated measles? Complicated measles lang yung sinabi. Walang ganun, Wars. Non-existent. Okay. Wala na. Hindi na siya magpapauto. Okay. Next, measles with either eye or mouth complications. Measles with either eye or mouth complications. What color? Okay. What color? Color yellow. Again, it's color yellow. Give vitamin A treatment. Give vitamin A treatment. Yes. Across all colors. All color classification, correct. Lahat po yan bibigyan mo kasi measles tayo. Okay, may measles yung bata in the first place. Next, antibiotic of choice for pus in the eye. Antibiotic of choice for pus in the eye. Tinamad na magsulat. Ano po yung antibiotic of choice? Okay. How do we give tetracycline? How do we give tetracycline? Ointment. Okay, as ointment siya. Okay, use it as an eye ointment. Very good. Treatment for your mouth ulcer. Treatment for your mouth ulcer. Gentian violet. Okay, gentian violet. Such a proud mama. Ang gagaling nila turuan, Sir V. Kailangan pa ba talaga ako dito? Okay, next. Clouding of cornea. Clouding of cornea. Okay. Uy, it's not just a simple eye complication. May clouding of cornea pa. Okay. That's color. Walang kasawaan. Color pink. Next. Lethargy. Lethargic. Lethargic. Color pink. Unconscious. Unconscious. Color pink pa rin. Pink classification. Hala, di natin maubos yung tanong. Pink classification, what term ang hinahanap natin? It has to be complete. Malay mo mabudol kayo sa choices. Kulang. Okay? Complicated measles lang, yun na yung sinagot mo. Mali ka pa rin. Okay? Severe, complicated measles. Sana po okay tayo dyan. Severe, complicated measles. Pag severe measles lang nakita mo sa multiple choice, very wrong. Wag mo isagot yon. Mali yon. Okay. Next, yellow classification. Ayaw i-type. Ang haba. Medyo mahaba. Okay. So that's measles with eye. Copy paste. Measles with eye or mouth complications. Okay. So that's your measles or eye or mouth complications. Green classification. Green classification. Okay. Wala na siyang ibang problema. May measles lang po talaga siya. Give your vitamin A treatment, measles. Measles lang. Refer urgently to the hospital. Refer urgently to the hospital. Diyos ko, pagkay nagkamali pa dito. Color pink. Lenny pink. Mink. Okay? Color pink. Next classification. Okay? We reach the world of your ear problems. Okay, we reached the world of your ear problems. We'll start with the color pink classification. Okay, it's called your mastoiditis. Pakihawak nga no likod ng tenga nyo guys at pakisabihan ako kung sumasakit siya ngayon. Sakit ba siya ngayon? Pag pinalpate mo, hindi. Pero para sa mga batang may mastoiditis, masakit kapag pinagpalpet tuloy. Palpate mo, okay? It's very tender for them, okay? Itong mastoiditis, ang criteria natin is the actual definition of the term itself. It's just a tender swelling behind the ear, okay? And under your pink classification, you don't really have to memorize ulit again. Okay, kasi alam mo na to. Give your first dose of an appropriate antibiotic, which is your ampicillin. Treatment for mouth ulcer is your gentian violet. Okay, the gentian violet. Ampicillin or gentamicin. Okay? And of course, it's painful for the child to have your mastoiditis. So magbigay ka po ng pain reliever, which is your paracetamol. Okay? So after you give your antibiotic and paracetamol, refer urgently to the hospital for further treatment. Okay? For further treatment. As we know, iba yung anatomy, okay, ng tenga ng mga bata. Okay? So prone to infection talaga sila. Okay? When we proceed to the next classification, under your yellow, pansin po natin, divided siya into two. Ganun pa rin. Depende, okay, sa longevity ng presence ng infection. You can give it. Okay, you can give gentian violet. Okay? Under the pink. Okay? Sige. Under this yellow, divided siya, depende sa longevity ng presence ng infection. If sinabi po na acute ear infection, meron siya, acute. Okay, so alam natin that's less than 14 days. The child has a pus in the ear for less than 14 days or may ear pain siya. Okay, or may ear pain siya. Okay, so give your antibiotic for 5 days. Okay, which is what? Ano ibibigay nating antibiotic dito, guys? Nasa yellow tayo. Yes. Okay. Amoxicillin. Pag wala akong makita ang amoxicillin, cotrimoxazole. Ang gagaling talaga. Okay? Magaling, magaling, magaling. Okay? At the same time, sabi daw, may ear pain si bata. Okay? So magbigay ka pa rin ng paracetamol for that. Okay? And when the child has a pus in the ear, okay, ayaw mo ma-aggravate it further, ayaw mo ma-infect it further, you would want to keep the ear dry and clean. Okay? So anong gagawin mo? You dry the ear by wicking. And how do we wick? Okay? Yun yung para mag-form ka ng maliit, manipis na tela. Okay? Gaganon mo. Ano yung term doon? Yun. Basta ikutin mo siya. Tapos, ano mo lang. Punasan mo lang yung tenga niya. Okay? Hanggang sa maging soiled yung yung wick na yun. Okay? Papalitan mo siya, yung cloth na yun. Okay? Just keep the ear dry and clean. Okay? Then after that, since nasa yellow classification tayo, follow-up is important. So, follow-up in 5 days. Okay? Follow-up in 5 days. Next, yellow pa rin, pero yung pus na meron yung bata, yung pus na meron yung bata is for more than 14 days or more na hindi kasi safe para mako-compromise din yung safety kapag cotton buds yung ginamit natin. Okay? So, hindi masyadong ginagamit yung cotton buds. Okay? If the child has a pus in the ear for 14 days or more, okay, chronic ear infection ang tawag dyan. Okay? Chronic ear infection. Clean cloth lang. Walang masyadong specific type for the week. Just a clean cloth lang talaga. Okay? Gusto mo lang talaga na ma-dry yung ear niya. Okay? Ganun lang yung target natin for that. Okay? Dry the ear by wicking. Okay? Then nag-introduce po siya, okay, ng bagong antibiotic specifically for your chronic ear infection, which nabanggit na po natin kanina, that is quinolone ear drops. Okay, for 14 days. Okay, then follow up in 5 days. Okay, then follow up in 5 days. What if wala naman siyang ear pain? Wala rin siyang pus, seen draining from the ear. Okay, no ear infection, no necessary treatment needed. So under your green classification, that's no ear infection. Okay. What color? Agad-agad. Classification. Okay, is this one. If the child, okay, upon assessment, has no ear pain naman pala. Okay, wala siyang ear pain. Anong kulay yan? Okay, anong kulay yan? Okay, that's color green. That's color green. Next, no treatment needed. Kasi wala naman siyang ear pain in the first place. Anong kulay po yan? Color green. Next, no pus in the ear. Pauwiin na natin ang bata. Okay? Wala siyang problema. Okay? Color green pa rin. Color green pa rin. No ear infection. No ear infection. Still color green. Still color green. What if there is a pus in the ear but then less than 14 days lang? Less than 14 days. What color? What color? Okay, what color? Yellow. Color yellow for acute ear infection. What if more than 14 days na pala? Ano nang tawag sa kanya? Yellow pa rin, chronic na siya. Yellow chronic ear infection. Very good. Yellow chronic ear infection. Give antibiotic for 5 days. Give antibiotic for 5 days. Anong kulay? Color yellow, acute. Color yellow, acute. Dry the ear by wicking. Dry the ear by wicking. Color yellow. Acute or chronic? Acute or chronic? Yellow skin. Yellow both. Okay, yellow, very, very good. Chronic and acute. Next, treat with topical quinolone for 14 days. For 14 days. Ayaw na naman maubos ng tanong, guys. Ayaw maubos ng tanong, okay? Color, yellow, chronic. Yellow, chronic. Exclusive lang siya for chronic ear infection. Next, acute ear infection. Kulay. What color? Acute ear, yellow. Next, chronic ear infection. Chronic ear infection. Uy, kulay yellow pa rin. Okay, kulay yellow pa rin. What if this one, tender swelling behind the ear? Tender swelling behind the ear. Okay, which is painful. Do we have to give paracetamol here? Yes or no? Yes, ang galing. Next, mastoiditis. Mastoiditis. What color? What color? That's color pink. That's color pink or red, but never violet. Next, antibiotic of choice for mastoiditis. Antibiotic of choice. Nagkamali na. Okay, antibiotic of choice. Okay, sige. Huwag malilito guys ha. Nasa color pink tayo. Color pink tayo. So, ang penicillin, gentamicin. Okay, ang penicillin, gentamicin. IM, OREM. IM or OREM? IM. Very good. Refer urgently to the hospital. Refer urgently to the hospital. Color pink. Hindi pa ba tapos, ma'am? Gutom na ako. Hindi pa tayo tapos, guys. Apparently, last na to. Okay, last na to. Okay, your anemia classification. Okay, ang tanging criteria lang for it to be said severe anemia is we have to observe if the child has severe palmar pallor. And if that is the case, okay, classify it under the pink classification, refer urgently to the hospital. Okay, refer urgently to the hospital. Whereas, if you reach the yellow classification and you observe na konti lang, some pallor, yes, okay, consider it as anemia. Okay, that is your proper term. Give your iron, okay, as a supplement. Give your mebendazole if the child is 1 year older or if she or he has not had a dose in the previous 6 months. Ito pong mebendazole na ito. Anong klaseng drug ito? What drug is this? Yes, okay, anti-parasitic drug. Okay, bakit tayo kailangan magbigay ng anti-parasitic drug in the context of your anemia? Basically, itong mebendazole, single dose lang siya. Okay, 500 mg. Okay, basically, because itong parasites would feed on the inside of the child. Okay, sa bloodstream niya. Okay, so maapektuhan yung level ng hemoglobin ng bata. Okay, kaya baka nagkakaroon siya ng anemia. Okay, so if that is the case, give your mebendazole. Kung hindi pa siya nabibigyan. Okay, then you have to follow up, okay, in 14 days. Okay, kasi nasa color yellow tayo. Okay, on the other hand, if you reach the green classification, wala naman siyang palmar pallor, wala siyang anemia. Okay, so if the child is less than 2 years old, assess the child's feeding. Okay, more on health education lang tayo dito. Okay, if na-assess mo na may feeding problem si baby or yung bata, follow up in 5 days. Okay, follow up in 5 days. Now, this is the question. What color classification is it? Okay, pag na-assess mo na ang bata ay merong severe anemia. Severe anemia, guys. What color? Kailangan ko pa bang mag-isip? May word na severe, di ba automatic pink yan? Okay, automatic pink siya. Next, severe palmar pallor. Ganun pa rin, may pink pa rin, guys. Okay, may pink pa rin. Ay, may pink pa rin. Nasasabi ko na pala, may severe pa rin. Okay, may severe pa rin. So, pink pa rin siya. Okay, still pink. Next, some palmar pallor. Okay, some Palmer pallor. Some Palmer pallor. Color yellow. Color yellow. Moderate Palmer pallor. Moderate Palmer pallor. Walang ganon Mars. Okay, wala pong green. Okay, walang ganon Mars. Mild Palmer pallor. Mild Palmer pallor. Wala pa rin ganon Mars. Okay, walang ganon Mars. Next, anemia. Anemia. Okay, anemia. May sumagot ng green, but this is actually color yellow. Next, green classification. Green classification, guys. Okay, green classification. Okay, no anemia. Last, finish na. Mic drop. Launch na tayo. What about this one? Refer urgently to the hospital. Refer urgently to the hospital. Okay, uwian na tayo. Okay, it's color pink. Color pink. Questions pa more. Do you have any questions? Okay. Clarifications. Violent reactions. Violent reactions. Wala. So I hope you learned a thing about IMCI. Again, I'm not really expecting you to memorize this overnight. Okay? Enough for you to familiarize lang with the concept. Kasi I understand na sobrang pahapyaw lang siya nung college. Okay? Ang goal natin, whether or not lumabas po siya sa board exam, at least may dadalhin kayong idea, information about your IMCI, especially for those of you who would venture the world of CHM. Okay, again, thank you very much for spending your Friday morning with me. Okay, meron pa po tayong communicable diseases lecture in the afternoon. So I'll give you your 1 full hour for your lunch break. Balik tayo ng 1:05. Okay, happy lunch po everyone. Thank you very much. Thank you very much. Thank you po. Please enjoy your lunch. Ayan. Good afternoon, everyone. Okay na ba ulit? Nandito na ba ulit tayo? So, for this afternoon, we're going to talk about an entirely different topic. So, tatawid na po tayo, communicable diseases na. Another advice for the boards for your review journey here in Top Rank, and as you go along, and study for your nursing board exam, I would really advise you to have proper time management, especially iba-iba tayo ng circumstances sa life. So yung iba dito, feeling ko nag-work na. Ako, when I was reviewing for the boards, I was also working at the same time. But I didn't want to miss the live lectures ng Top Rank kasi for me lang I didn't want to watch the recorded video anymore. Para kapag meron ako free time outside of my work and Top Rank, I'll get to review on my own yung topics na gusto kong aralin. Yung topics na alam kong kailangan ko pang i-brush up for myself. So yung sa mga working in the morning, tapos ang time na lang nila na natitira is sa gabi. So you really have to have a proper time management kasi kailangan niyo pang magpahinga. Kapag walang tulog, walang proper food and nutrition ng katawan, eventually, bibigay rin yan. The nursing board review season and phase, it is a journey, it is a marathon. So along the way, some of us would feel the anxiety, would eventually feel the exhaustion, and it's totally valid, it's totally normal for us to feel that way. Pero ang advice ko sa inyo is to not neglect your personal health and to also give in to your body. Kung ano yung gusto niya, kung anong kailangan niya. So kung kailangan na meet up with friends, with the family, carry lang. Okay? Iplano niyo lang ng mabuti. Okay, so another tip, pag may naisip pa ako along the way. Sige, i-share ko sa inyo. Work sa gabi, review sa umaga. Yan, laban lang tayo guys, laban lang tayo. Hindi ko kasi pwedeng i-impose yung mga ibang strategies na ginawa ko kasi iba-iba tayo ng circumstances sa life. Iba naman totally focused dito sa board, which is better, which is good actually. So, kailangan nyo lang din i-build yung confidence nyo when it comes to answering the board exam questions. Kasi minsan, alam nyo yung tamang sagot, pero nag-aalangan kayo na yun yung isagot kasi baka, alam mo yun, baka may much better answer. Pero kung alam nyo naman sa sarili nyo na yun yung sagot at yun yung nabasa nyo, go lang, isagot nyo siya. Okay? Once again, yon overthinker kayo, aawayin nyo ko soon kapag nag-rasyon na tayo. Yan, marami ng mga away dito soon. Pero okay lang yan. Hindi, iba-iba kasi yung references natin with the other subjects. Pero iisipin natin together. Malayo pa naman yung rush. Oo, malayo pa naman yan. We'll work as a team together to find out what is the best answer for those types of questions. Okay? So once again, good afternoon, everyone. My name is JD Ross. I'll be your lecturer until the end of this day. Communicable diseases. As we know, guys, okay, when we are talking about your communicable diseases, napakarami po niyan. Napakarami po yan. Our main site would be, or main reference would be, syempre, doon na tayo sa sturdy, okay, na reference. Sa CDC na tayo. And if you would try to visit the CDC site, you would notice na meron na silang bibliography doon from A to Z. Okay, from A to Z of all the communicable diseases that was ever recorded. Okay? And with that, hindi naman natin lahat yun matatakel. So, ang i-share ko lang sa inyo are the basic, okay, the enough for you to know kinds of diseases, yung mga frequently occurring, frequently repeated types of diseases in the board exam, yung mga hot topics, okay? But then again, marami po tayong hindi mako-cover, okay? Yung iba sa intensive phase na po siya mapapag-usapan. Okay? Ganun pa rin, if you have any questions, please feel free to ask me. I'll do my best to answer questions. If hindi, ipapark natin, then I'll look for the best answer. Okay? Ang break natin, that's 10 minutes break na lang. Okay? I think 2:30 or 3 o'clock. 2:30. Ganyan. Okay? Hopefully, matapos tayo ng maaga. Hindi tayo mag-extend. Okay? Sige, let's go now. Ang dami ka namang sinabi. Now, before we go to the certain communicable diseases, alamin muna natin kung ano ba yung definition, okay, ng communicable disease. And sabi daw, basically, sabi natin, kaya natin mabuhay ng keywords lang. It is caused by any of your infectious agents that is spread, okay, spread from person to person, okay, spread from person to person. Nakakahawa po siya. Ngayon, lahat ng mga sakit, ay, guys, pa-type naman already na para alam ko na nandyan na ulit talaga kayo for real. Wala naman ako open cam. I feel alone and lonely kasi ako lang mag-isang naka-open cam. Nahihiya tuloy ako, guys. Nahihiya tuloy ako. Okay, ayan, sige. So, lahat ng mga maisip nyo po na disease or condition na hindi naman nakakahawa, readily na nakakahawa sa ibang tao, labas sa free time, aral na naman. Oo, yan, kailangan natin yan, diskarte. Okay? Lahat yon ang tawag sa kanila is non-communicable diseases. So, in that sense, ang HIV po ba, is it a communicable disease or not? Ang HIV ba ay communicable disease or hindi? Yes or no? Yes or no? But no. It can be spread from person to person. Okay? Bloodborne, di ba? Bloodborne siya. Okay? Ang kidney failure ba? Chronic kidney disease, is it an communicable disease? Yes or no? Communicable disease, yes or no? Chronic kidney disease. CKD. No, hindi. What about asthma? Is it a communicable disease? Yes or no? Asthma. No. What about hepatitis A? Hepa A. Communicable disease? Yes or no? Yes. Okay. Schizophrenia. Schizophrenia. Diabetes. Diabetes. Okay. Varicella. Pertussis. Yan, pertussis. Hypertension. Okay. Now, allow niyo na. Ganun lang siya. Okay? Communicable disease if it is spread from person to person caused by any infectious agent. Now, second bullet, contagious versus infectious. Ito pong dalawang words na ito, malimit po siya or madalas po siya na napagpabaligtad ng ibang mga tao. Interchangeable siya. Pero ang main difference lang po talaga nila, when you say contagious, basically, it is easily transmitted, kind of your communicable disease. Okay, yun lang yung kailangan mong tandaan. Easily transmitted siya. And when we say easily transmitted, isipin na lang natin yung transmission methods nila. So for example, yung airborne, any airborne transmission or droplet transmission, isipin mo lang yan, tuberculosis, measles, varicella, contagious sila. Easily transmitted versus your infectious. Okay, kapag sinabi mo namang infectious, nakakahawa pa rin. Yes, pero hindi ganun madaling nakakahawa, not easily transmitted. So for example, may mga bloodborne diseases natin. We talked about your Hepa A, Hepa B, HIV, what else? Yung foodborne diseases natin, salmonella, ganyan, STDs even. Okay, we have your syphilis, your gonorrhea. Okay, those are your examples of your infectious diseases. Okay, meron tayong statement dito sa pinakababang slide. Sabi niya, all contagious diseases are infectious, but not all infectious diseases are contagious. Huwag niyo pong pagbabaligtarin. Okay, kasi mali na yan. Pag binagbaligtad mo, all contagious diseases are infectious, but not all infectious disease are contagious. It makes sense nga naman. Okay, sige. Next, we have your chain of infection for the next slide. If you want to learn more about chain of infection, pasok kasi siya sa konsepto ng communicable diseases, pero pwede mo rin siyang pag-aralan under your fundamental concept. And when we are talking about your funda, okay, your funda concept, okay, ano ba yung main reference natin for that? Si mother, causer, and herb. Okay, yung causer and herb po natin, marami pong available na ePDF, okay, files, kung wala kayong physical copy. Ako, since pandemic, hindi naman pwedeng lumabas, so nabuhay lang din ako sa PDF files lang, okay? Possible naman, napatunayan ko naman na pwede siya, okay? Sige. Mayroon siyang separate chapter na puro ano lang, chain of infection lang. Okay? You would want to check that out also. Okay? Pero isa-isahin natin yung chains dito. Let's start with the infectious agents. Okay, by its definition, okay, those are your microorganisms capable of causing disease or illnesses. Ano-ano yung example? Not, for example, bacteria. Okay? Another one is your fungi, your parasites, and your prions. And ngayon pa lang, I would like to remind you guys that when you are studying and reviewing for the board exam, you have to make sure to treat any information that you will be reading as important as any other information that was provided to you. For example, hindi porket med-surg, okay? Hindi porket med-surg yung nahihirapan ka, med-surg ka lang yung aaralin mo solely. Okay? Hindi porket psych, yung sinabi nila or may narinig ka sinabi nila na psych daw yung maraming lalabas. Okay? Psych na lang solely yung aaralin mo. Hindi po. In the first place, this is a hard fact when it comes to the nursing board exam. Wala pong nakakaalam kung ano yung lalabas sa boards. Fact yun. Katotohanan yun, guys. Okay? So all the more, what are you going to do with that fact? Okay? You have to prepare yourself for any topics that might possibly show in the actual board exam. So in that sense, okay, kahit malaking information yan, kahit maliit na information yan, guys, panghawakan mo kasi hindi natin alam kung ano lalabas sa utak ng mga BON. For example, merong past board question. The BON simply ask the students, okay, ano daw ang causative agent na isang typhoid fever? Okay, it's a past board question and my friend didn't answer it well, okay? Alam niya kung ano yung sagot, pero hindi niya natama sa actual boards. Bakit? Marami ring factors kung bakit hindi nakakasagot ng tama ang isang estudyante sa board exam. For example, environmental factors. Kunwari, ang testing site mo na-assign ka sa isang room na maraming aircon, tapos 12 lang kayo doon kasi pandemic, so spacing, okay? Sobrang lamig, wala kang jacket. So sobrang lamig, na-distract ka, okay? Naapektuhan yung focus mo, di ka nakasagot na maayos. Okay? On the other spectrum of that situation, meron mga na-assign naman. Okay, sa mga basketball court naman sila na-assign. Napakainit, tirik yung araw. Okay? Saktong tirik ng araw, dun siya nakapwesto. It will also affect your focus, your ability to focus, okay? It would also distract you. Okay, yun yung mga factors kung bakit hindi ka nakakasagot. Or sumasakit yung tiyan mo, nagkakaroon ka ng psychosomatic symptoms, you also have to prepare for those things. Okay, guys, to answer that question, ano po ba ang causative agent ng typhoid fever? Is it a bacteria, a virus, a parasite, or a fungi? Okay? For you to be able to answer it correctly, alamin mo muna kung ano ba yung actual, okay, etiologic agent, which is salmonella. Okay? And salmonella is, sorry. Okay, it is a type of a bacteria. Okay, it is a type of pure bacteria. So yung mga ganon. So when you are being, or when you start to review for those communicable diseases, it's also important for you to know kung ano ba yung mga causative agents, okay, nung mga diseases na yun. Kasi tatanungin siya sa iyo. Okay, tatanungin siya sa iyo. Okay, ang lumabas sa amin nung time na yon was scabies. Okay, scabies yung highlight nung question. Okay, anong klaseng causative agent daw ng scabies? So, it's a parasite. Okay, mga ganon. Okay, mga ganon. Okay, next, pagtawid natin to the next chain, we have your reservoir, and by its definition, it is a place in which infectious disease live, grow, and reproduce. So, sa madaling salita, kapag narinig mo po yung word na reservoir in the context of your chain of infection, basically speaking, sinasabi lang po nito kung saan gustong-gustong tumambay ng mga infectious agents na ito. Okay? Human as a reservoir, alam natin yan, maraming pwedeng pagtambayan, okay, na sites ang mga bacteria, fungi, parasite sa katawan ng tao. For example, wait lang. Sorry guys, balik tayo sa infectious agent. Nakalimutan kong i-share. Okay, sige. I would like to share with you this word, pathogenicity. Okay, from the root word pathogen. Okay, kapag po narinig nyo or nabasa nyo yung word na pathogenicity, it talks about the ability, sulat natin ha, para pare-paras tayo na notes. Okay, that is your ability of a pathogen, okay, to cause a disease, For example, alam natin na maraming bacteria sa mundo. Okay? Hindi natin kayang enumerate yan sa isang araw lang. Okay? In fact, okay, out of the world of the bacteria, okay, 5% lang doon yung may ability to cause a disease. 5% lang po doon sa mga bacteria na yon ay yung bad bacteria. The rest, healthy bacteria na yon. Okay, yun yung sinasabi ng pathogenicity. Pero kapag sinabi sa inyo yung konsepto ng virulence, when we talk about the word virulence, on the other hand, that is the ability of a certain infectious agent, okay, to damage its host. In other words, alam natin na yung pathogen na yun ay nakaka-damage, nakaka-cause, okay, ng damage pathophysiology sa katawan ng tao. Pero gaano ba? Okay, ilan yung probability, ilan yung percentage na fatal siya, okay, sa tao kapag nakuha siya ng tao. So for example, one of the most famous, okay, highly virulent virus that we know is the Ebola virus. Okay, Ebola virus. Ano bang fatality rate niyan? That's 80 to 90%. That's as high as 90%. Once you have that Ebola virus, magpe-pray na lang ako. Ganon, okay? Ganon siya ka nakakahawa. Ganon din siya ka nakakamatay. Okay, yun yung konsepto ng virulence. Okay, pag sinabi mong virulence, gaano siya ka nakakahawa at nakakamatay as well. Okay, ability to damage its host. Okay, for example, yung anthrax, okay, yung anthrax, okay, iba't iba yan, di ba may spores yan, highly ano rin yan, highly virulent din yan, okay, most especially yung inhalation na anthrax, okay, parang ginamit din siya as ano anong term doon, as weapon din, biological weapon ba yung term doon, okay, ayun, okay, as opposed to your bioterrorist agent, ayun, biological warfare, yan, ginamit yung anthrax na yan, okay. As opposed to when we are talking about your tuberculosis, for example, sa isang ward, okay, isang malaking ward, 20 yung pasyente mo, 10 doon may tuberculosis, okay? No matter how much your exposure to those kinds of patients are, if your immune system is high enough, okay, kung matibay naman yung immune system mo, okay, hindi siya sapat for you to have your tuberculosis. Hindi ka agad-agad makakawa. Okay? So tuberculosis compared to your Ebola virus, definitely mas highly virulent yung Ebola virus. Okay? Ganun yung konsepto ng virulence. May nakalimutan ba? Wala. Okay, so balik na tayo sa reservoir. Okay, kung saan gustong tumambay ng mga infectious agents natin. For example, blood. Okay, blood. Can you give me your blood-borne diseases that you know? HIV. Okay, hepatitis B. Okay, ano pa? Mga ganyan. Okay, kapag pumasok kayo sa hospital, requirement yan, yung HIV screening, pati yung hepatitis B titers nyo. Kasi, pwede, okay? Exposed tayo sa dugo ng mga pasyente. Okay? So, kailangan matataas yung titer natin sa Hepa B. And to share you a story, okay, nung bago pa lang po ako sa ospital, tas bago-bagong nag-night shift po ako, okay, dating kasi ng 5 AM guys, 5:30 kasi magbibigay ka na ng insulin, right? Okay, pagdating ng 5 AM, 12 yung pasyente mo, mami. So, simulan mo na maaga, okay? Mag-CBG ka na yan, okay? So, nag-CBG galore ako, nag-prick ako ng mga capillary ng mga pasyente, okay? Sa sobrang kamamadaling ko, kasi bago lang ako noon, so na-pressure ako na ang dami nila, tapos hindi ko siya matatapos on time, okay? Binilisan ko yung gawa ko, okay? At the end of it, pinaprick ako ng gamit na na-lancet. Okay, na-prick ako ng gamit na na-lancet. So, panic internally ako nun. Okay, panic internally. So, pumasok or pumunta ako sa HICU. Dumiretso naman ako sa HICU. And then, they tested my hepatitis B titer, pati yung HIV. Meron silang rapid test for the HIV screening. Luckily, negative naman yung patient, negative din ako. So, for those of you who want to venture the world of bedside, the world of hospital, iba siya. Masaya siya, guys. Oo, enjoy siya. Okay? Andun din yung fulfillment sa bedside. Yung iba, okay? I would highly recommend, okay? Syempre gusto natin na protektahan yung patients, yung safety ng patient nandyan. But at the same time, ngayon pa lang, syempre, kailangan mo rin bigyan ng importansya yung safety and protection mo as a healthcare professional and as a person. Okay? Ayan. Segue story lang. Okay? Ano pa? After the blood, respiratory tract. Yung mga flu virus, yan. Flu virus. Okay? GI tract. Pwede rin yan gamitin as a reservoir. Mga orophycal route natin, hepatitis A, salmonella, ganyan. Okay? Ano pa? Reproductive tract. Yan, yung mga reproductive tract, yung STDs that we know. We have your gonorrhea, your herpes virus, gonorrhea ulit, candidiasis, syphilis, mga ganyan. Okay? Those are your reproductive tract STDs. Okay? Na as a reservoir. Okay? What else? Hindi lang humans, actually. Pwede rin yung water. We have your gastroenteritis. Skin, pwede rin. Skin and mucous membrane, pwede rin. Okay? So water as a reservoir, gastroenteritis. Pwede rin pong animals as reservoir. Okay? Yung cat feces, guys, ano pwede niyang matransmit? Ano pwede niyang matransmit dun? From the cat feces. Na teratogenic din, apparently. Okay? Yes, correct, Ma'am Angela. So, toxoplasmosis. Okay? Toxoplasmosis. What about the bats? They are capable of transmitting what kind of diseases? Rabies could be. Okay? Huwag na tayo lumayo, guys. Okay? The very cause of the pandemic, okay? COVID-19. Okay? COVID-19. What about the monkeys? Monkeys. Monkeypox. The Zika virus. Okay, Zika virus. When we talk about your Zika virus, ano yan, yung isa sa mga further complications that we know, di ba nagkakaroon ng microcephaly yung mga baby. Yan, as a complication of Zika virus. Okay, sige. Next chain is your portal of exit. Sabi daw, these are your ways in which infectious agent leaves the reservoir. Okay, so basically, kung saan sila tumambay, parang most likely, doon na din sila lalabas. For example, is the blood, yung secretions, excretions, pati yung sa skin natin. Okay? Next chain is your modes of transmission. Okay? These are your ways in which the infectious agent is spread from the reservoir to the susceptible host. So we have your physical contact, droplet, and airborne transmission. Ito yun, guys. Nasa next slide siya. Pag-usapan na natin. We have your direct contact versus your indirect contact. Okay, ang keyword lang na kailangan nating tandaan when it comes to your direct contact is yung actual word na dapat may word talaga na direct. Okay, dapat may direct. Okay, ayan. With the tissues or the fluids of an infected individual. That is your physical transfer and entry of microorganisms, okay, through your mucous membrane. So, for example, pwedeng splash sa mata, okay, pwede sa mouth, okay, open wounds and even your abraded skin, yung lesions mo, pwede yan. Okay, as we know, skin is our first line of defense against infections, right? Whereas, when we are talking about your indirect contact naman, okay, these are your contact between a person and a contaminated object. If you hear the word fomites, pasok yan dyan. So for example, meron kang gamit na face mask, mami. Okay? Kakauwi mo lang sa bahay. Naka-face mask ka pa. Tapos nag-commute ka lang. So imagine all the bacteria. Okay? Yung gamit na face mask na yun, nilapag mo siya sa dining table nyo. Okay? Tapos magdi-dinner na kayo. So good luck. Good luck na yung nasabi, okay? Pwede mo matransfer yung mga bacteria na nandoon sa face mask to other members of the family and even to the other inanimate objects like the table. Okay? Kasi yung very face mask na yun, madumi na yun, may bacteria na yun. Okay? Yun yung indirect contact transmission na sinasabi. Okay? Ano pa? Sa hospital setting, for example, you're working in a public tertiary hospital na sobrang kulang. Okay, sobrang kulang sa kagamitan. Diyos ko, mami, kahit gloves. May face kami na gloves, walang maibigay. Okay, sobrang kawawa talaga. Okay, so pag ganun, you have to provide your own. Okay, for example, you're taking care of 12 patients with a limited glove supply. Okay, Huwag ka naman kadiri na for example, bed 1, intubated, nag-suction galore ka sa intubated na pasyente, ginamit mo yung same gloves sa bed 2 na pasyente na GCS 15 naman at relatively healthier. Okay, huwag ganon. Huwag may compromise yung safety ng ibang pasyente just because you have a limited hospital supply. Okay? Principles pa rin tayo ng infection control. Okay? Kasi ayaw natin ng further transmission of any infectious agents. Okay? What about this one? The droplet versus airborne transmission. Okay? Droplet versus airborne transmission. Ito, usually nalilito yung mga students. But let me remind you the big and main difference of the two concepts. Basically, when you say droplet transmission, isipin niyo lang yung literal na droplet, di ba? Paano ba natin dinodrawing yung drops, okay? Kasi when a person, for example, sneezes, okay? When a person sneezes, okay? Yung particles ng sneeze na yun would be relatively larger. At dahil medyo relatively larger siya, malaki po siya, okay, na particle, at the same time, mabigat din siya. Okay, at dahil mabigat din siya, okay, babagsak lang din agad siya sa floor. Okay, in that sense, those particles would travel only for short distances. Okay, what do I mean by short distances? Technically speaking, okay, it's up to 6 feet or 2 meters. I-highlight na natin yan. Okay, 6 feet o hanggang 2 meters lang siya. Okay, tapos babagsak lang din. Yes, correct, Ma'am Hazel. It won't suspend in air for longer periods of time. Okay, again, medyo mabigat, medyo malaki po ang particles ng droplet. Okay, kaya po babagsak lang po siya sa floor agad. It won't suspend in the air for longer periods of time. Okay, short distance lang siya. For example, we have your diphtheria pertussis. Okay, COVID-19, yan, droplet transmission yan. Yung iba, sa ibang references, pinagsasama nila droplet contact, which is okay lang din naman, yung droplet contact transmission because those larger particles, pag bumagsak sila, for example, sa doorknob, okay, sa table, okay, doon na mag-start yung possible contact transmission. Okay? Whereas, when you're talking about your airborne transmission, ang pinaka-example lang natin dyan is your tuberculosis, your measles, and your varicella. Okay, silang tatlo yung main example ng airborne transmission natin. And when we say airborne, yung droplet nuclei nila, yung particles po na yun, okay, ay maliliit, okay? So much so na 5 millimeters or smaller in size. Okay, anong implication nun, guys? Kapag umubo po or bumahing ang isang taong may tuberculosis, those particles would travel for further places. Okay, malayo po ang mararating ng particle na yun kasi maliit lang siya, kasi po magaan lang siya. Okay, in that same sense, it will be suspended for longer periods of time. Kaya nagsisirculate lang siya sa room niya for longer periods of time. Okay, kaya isa sa mga treatment, di ba, kapag may tuberculosis ang isang tao, as much as possible, dapat maganda yung ventilation. Okay, para yung circulation ng hangin, hindi lang concentrated doon yung TB virus. Okay, sige. Meron pa tayong isang pair ng concepts na medyo nalilito din ng students. So we have your vehicle route versus your vector borne. Okay, so kapag sinabi mong vehicle route, okay, with these examples, food, water, and blood, we can safely imply, okay, yes, that these are your non-living, okay, inanimate objects. Non-living, sige na nga, non-living, pwede rin inanimate. Ito yung mga terms na kailangan mong tandaan. Okay? Buhay ka na sa boards. Okay? Basically, buhay ka na sa boards kapag naalala mo yan. Okay? We don't really have to memorize a lot of words. Keywords lang tayo dito. Syringes, pwede. Oo, syringes, pwede rin yan. Okay? Pagdating mo po dito sa vector borne, okay, define muna natin ano ba yung vectors. Vectors, basically, those are your living organisms. Okay, sulat natin. Vector. Dito. Living organisms, okay, that is able to transmit infectious pathogens between humans. Okay? Kung mapapansin po natin, for example, ito po, chikungunya virus. This is caused by your what? Anong vector nito? Mosquito. Anong species ng mosquito? Aedes mosquito, right? This is caused by your Aedes mosquito. Okay, on the other hand, filariasis and malaria is caused by your what? Not really caused, pero ano? Ano vector niyan? Okay, Anopheles mosquito. Gagaling, gagaling, gagaling. Okay, Anopheles mosquito. What about your Japanese encephalitis? Mosquito rin, pero anong species naman yan? Culex mosquito. Yes, okay, you have your Culex mosquito. If you would notice, okay, ang daming virus na pwedeng matransmit ng mosquito alone lang. Okay, mosquito yan pare-parehas, pero iba lang sila ng species. Okay? In this kind of example, we would notice that many or majority of these vectors are actually insects, your blood-sucking insects, actually your mosquitoes. Okay? Ganun yan. So kapag vehicle po, non-living siya, think of your inanimate objects. Kapag vector naman, living organisms naman sila. Okay? Living organisms naman sila. Sila yung nagtatransmit ng infectious agents from humans to humans. Okay, sometimes from animals to humans. Okay, sige. Balik tayo sa chain of infection. Mabilis ba guys or saktuhan lang? Saktuhan lang ba or mabilis? Yung pacing, okay lang. Hindi naman kayo hinihingal. Maulan ba sa inyo? Maulan ba sa inyo guys? Okay lang. Ingat tayo dyan. Ito medyo makulimlim. Okay, sige. Balik tayo. So we're done talking about your modes of transmission. Dito naman tayo sa portals of entry. Okay. So when you're learning a concept, definition muna tayo. Okay, ways in which the infectious agent enters the susceptible host. So most probably, kung saan sila lumabas, doon din sila papasok. Okay? You still have your mucous membranes, your respiratory system, your digestive system, and your broken skin. Okay, next is your susceptible host na po. Okay, these are your individuals that have the traits, okay, that affect the susceptibility and severity of your diseases. For example, yung patients natin with immune deficiency issues, yung mayroong mga autoimmune diseases, like your SLE, like your rheumatoid arthritis, okay, mga immunocompromised patients that we could think of, like patients with cancer, okay, patients with diabetes, okay, with burns, most especially kasi yung skin nila compromised, okay, patients who underwent surgery, okay, and patients who have who are too young or too old, okay, yung mga extremes of ages, okay, affected din sila dyan, susceptible hosts sila dyan, okay. Now let's go to the actual diseases na po. We will start with your diphtheria. Wow, ang linis ng slide. Sige, sulat tayo para sabay-sabay tayo, tsaka pare-pares tayo ng notes. Okay? As we know guys, ito pong term na diphtheria. Okay? Diphtheria, basically, that is a toxin-mediated disease caused by your, so causative agent muna tayo. Okay, that is your Corynebacterium. Diphtheria. Corynebacterium diphtheria, or kapag hindi nyo naman ito nakita sa choices guys at itinanong kung ano po ba ang causative agent ng diphtheria, answer your Klebs-Loeffler. Yun, Klebs-Loeffler. Okay, either of the two. Okay, either of the two. Okay, ito pong bacteria na ito, kapag pumasok po yan sa loob ng katawan, magre-release siya ng toxins. Magre-release yan ng toxins. Okay, next, mode of transmission. Mode of transmission natin is a droplet transmission. A droplet transmission. Next, incubation period. Incubation period. Pag sinabi mong incubation period, medyo magagasgas tong term na to when we're talking about your communicable diseases. Basically, this is the period wherein, okay, you have your first exposure to the infectious agent, okay, first exposure to the infectious agent until the appearance of the first symptoms. Until the appearance of the first symptoms. That is your incubation period. Ulit, incubation period is the period in which you have your first exposure sa infectious agent until the first appearance of the symptoms. Okay? Incubation period ng diphtheria, medyo mabilis lang yan. That's 2 to 5 days. Okay? Ano yung mga risk factors that we could think of when we could have your diphtheria? Of course, yung mga usual, yung mga generic, for example, overcrowding, ano pa, poor health situation, substandard living conditions. Okay? But most especially, we have to think about incomplete immunization or vaccination because we have a vaccine for this. And in the first place, guys, okay, kung mapapansin nyo, wala naman kayo masyadong naririnig, okay, ng diphtheria cases here in the Philippines because relatively compliant naman most of the population ng Philippines when it comes to the DPT vaccine. Okay? Isa pa po, requirement ng diphtheria para masabi natin na fully immunized na yung child ng nanay. Okay? So, pinaka-risk factor, okay, of a child having diphtheria is the fact that baka wala pa siyang vaccine. Okay? Let's go to the signs and symptoms. Let's go to the signs and symptoms. Chinichill-chill ko lang tong lecture ha. Okay? Chill-chill lang tayo. Friday the 13th, guys. Okay? Signs and symptoms. So we have your respiratory diphtheria. Respiratory diphtheria. Marami pong mga kinds, marami pong types ang respiratory diphtheria, but this respiratory diphtheria is the most common type of your diphtheria. That is the most common type of your diphtheria. Ano yung pwede nating ma-observe sa batang may respiratory diphtheria? We have your sore throat. Okay? We have your fever. Okay? We have your dysphagia. Kung mapapansin nyo guys, medyo non-specific symptoms pa lang to. Okay, non-specific symptoms. Okay? Pero, pag po narinig nyo or nakita nyo yung word na meron siyang bull-neck appearance, ay hanapin mo sa choices. Diphtheria yan. Okay, ito po yung itsura ng isang bata na merong bull-neck appearance. If you would notice, okay, obviously, meron siyang edema sa may throat area or neck area niya. Okay, and the way the child would compromise is that the patient would tend to hyperextend the neck, okay, para ma-lessen yung feel niya no pain. Okay, kasi painful din po yan. Okay, para ma-lessen yung feelings ng pressure. Okay, masakit po ito guys. Okay, yung bull neck appearance yan. Okay, pero guys, kapag tinanong po kayo sa board exam, what is the pathognomonic sign? Pathognomonic sign. Mnemonic sign. Okay? Pag po nakita nyo yung word na pathognomonic sign, okay? Ma'am, galit ka ba? Hindi po, okay? Pag nakita nyo word na pathognomonic sign, ibig sabihin nito guys, tinatanong sa inyo, ano yung symptoms dito sa choices na fail-proof kapag nakita mo sa isang bata, automatic diphtheria yan. Okay? We have your pseudomembrane. Yes, correct. Pseudomembrane. Pag nakita mo yun sa bata, may pseudomembrane siya, no doubt, diphtheria po yan. Okay? Ano po yung itsura ng pseudomembrane? Ito po yan, guys. Okay? Sa left picture is your pseudomembrane. If you would notice, para siyang nakadikit sa throat niya, right? Kapag kinutkot ko to, guys, or yun ang tanong, pwede ko ba siyang kutkutin? Pwede ko ba siyang tanggalin? Yes or no? Yes or no? Can I make kutkot of that pseudomembrane? Wala bang sasagot ng yes? Okay, definitely no. Definitely no. Kasi dalawang complication yung pwede nating makuha dito. The first one is that, of course, tama si Ma'am Hazel, okay, bleeding. Okay, bleeding. Kasi meron po tayo diyang mga vessels, mga microvessels. Kapag yan kinutkot mo, mami, okay, expect bleeding. Okay? Ano pa? Kapag po yan ay kinutkot mo, or simply, kapag na-dislodge po ang pseudomembrane, nasa throat area yan, guys. Okay? Very, very high risk for the child to have aspiration problems. Okay? Aspiration problems yan. And if ever na ma-aspirate niya yan, that would cause you to have airway obstruction. Eventually, masasuffocate ang bata. Eventually, mamamatay po siya. Okay? So, yun yung pinaka-cause of death ng mga batang meron diphtheria because of airway obstruction, possibly secondary to pseudomembrane dislodgement. Okay? Ano pa po yung gusto kong i-share sa inyo? Kung makikita niyo po yung pseudomembrane, di ba parang naka-chill lang siya dyan sa lalamunan ng bata. But this one is highly infectious. Parang dyan po nanggagaling yung kapangyarihan ng virus. Okay? Dyan siya pinaka-concentrated. Therefore, kapag na-assess niyo po ang isang bata na merong pathognomonic sign ng pseudomembrane, all the more that you have to practice or observe your droplet precautions. Okay? Kasi highly infectious po siya. Okay? Highly infectious po yan. Okay? Sige. Next one. After your respiratory diphtheria, pag baniliitan ko yung font, makikita niya pa. Ma-appreciate niyo ba yan? Or burahin ko na lang? Sige. Next one. After your respiratory diphtheria, sulat ko lang, this one is your most common. Okay, we have your laryngeal diphtheria. Laryngeal diphtheria. Okay, this laryngeal diphtheria, isipin niyo lang yung mga possible symptoms na pwede natin i-associate sa any larynx problems. First and foremost, yung hoarseness of voice. Boses ang affected dyan. Okay, at the same time, pwede rin siya magkaroon ng ubo. At the same time, stridor. Okay, and kapag nagkaroon ka ng observation, assessment, may stridor ang bata, is it a medical emergency? Yes or no? Medical emergency po ba ang stridor? Yes or no? Kabahan ka na, mami. Okay? Sige. Ayan. Bakit po medical emergency? Swelling po yan. So possibly airway, pink. Pink. Possibly airway obstruction ang problem natin dyan. At ako naman ako sa pink. Guys, iwan na po to. Oh. Okay. Other one. The other type is your diphtheria. Okay. Meron tayong most common. Okay. Meron tayong mildest. Okay. Meron tayong most common. Meron din naman tayong mildest form. Okay. In this case, we have your nasal diphtheria as the mildest form. Okay. Of your diphtheria. Okay. Gaano po siya ka-mild? So mild na it can even come and go without you knowing na nagkaroon pa ng nasal diphtheria yung bata. Okay, ano po ba ang symptom ng isang nasal diphtheria? Basically, para lang po talaga siyang sipon. Guys, Englishin lang natin yon. We have your clear nasal discharge. Ganyan lang. Okay, parang sinisipon lang yung bata. Okay, eventually, if naging complicated yung situation ng nasal diphtheria, it can even become blood-stained. Okay, pero since ito po yung mildest form, okay, parang rare occurrence lang naman na nagpo-progress siya, okay, sa further complications. Okay, most often, parang sinisipon lang yung batang may nasal diphtheria. Okay, not really a cause of concern. Okay, the last type of your diphtheria rather. The last type of your diphtheria is what we call your cutaneous diphtheria. Okay, cutaneous diphtheria. With the word cutaneous, ano po ang affectation niyan? Ano ang affectation niyan? Okay, sa skin. Again, remind ko lang kayo guys, the BON would use different choice of words for you to be confused. Okay, so read as much as possible. I-extend nyo yung vocabulary nyo kasi minsan di mo lang makita yung word na skin. Cutaneous pala yung ginamit. Ganun. Okay, na mali ka na. Okay, under your cutaneous diphtheria, okay, nagkakaroon ka lang dyan ng lesions or ulcers. Most commonly, makita mo yan sa legs. Okay? Most commonly, nasa legs po siya. Okay? Kung mapapansin nyo guys, recap lang po. We have your respiratory diphtheria. I-bold natin, which is the most common form of your diphtheria. Okay? We have your respiratory diphtheria. We have your laryngeal diphtheria. We also have your nasal diphtheria and your cutaneous diphtheria. Okay? The first three types of diphtheria, okay, respiratory system ang affectation. Okay? The last type of your diphtheria, cutaneous, integumentary system ang affectation. Okay? It just goes to show that yung causative agent po ng diphtheria, which is your Corynebacterium diphtheria or your Klebsiella, Okay? Exclusive lang po siya makikita sa mucous membranes ng respiratory system at the same time sa skin lang po siya makikita. Wala na pong iba. Hindi mo po siya makikita nakatambay sa dugo. Okay? Respiratory and then skin lang siya. Okay? Yun yung feature ng diphtheria. Okay? Sige. Uy, sabihin nyo kung mabilis ha. Babagalan natin. Next. Okay, gusto ko lang mag-next slide para next picture. Okay? Diagnostic test. Diagnostic test. Okay? Diagnostic test, culture. Magkukulture tayo dito. So, you have your nose swab or your throat swab. Okay, or your throat swab. Kailangan natin ng culture dyan. Let me introduce you the word Schick's test. Schick's test. Okay? Kapag narinig po ninyo yung word na Schick's test, basically, okay, itong test na po nito, okay, gusto lang niya malaman kung susceptible ka ba sa bacteria. In other words, malalaman po ng test na ito if you already had diphtheria before, yung actual sakit na diphtheria before, or if you have your DPT vaccine already. Okay? Yun lang yung gusto niyang malaman. Okay? Ito pong Schick's test na po na ito is injected intradermally sa left forearm natin. Para siyang parang allergic test. So ID lang din siya. Okay? Next, let's go to the interventions. Let's go to the interventions. Ano po bang itsura ng mga tanungan sa board exams when it comes to your communicable diseases? Guys, kung mabait ang BON, isang sakit lang ang i-feature niya sa 500 item exam. Okay? Isang sakit lang yung i-feature niya, tas 5 items lang. Tapos na. Okay? Kung medyo hardcore, kung medyo mainit yung ulo ng BUN habang ginagawa yung exam, okay? Isang exam or isang disease lang yung i-feature niya, yung itatanong niya sa'yo, pero 15 item test. Okay? Yung 15 items out of that 500 item exam, puro isang sakit lang na yon. Let's say diphtheria. Ano yung lalaman ng mga tanong na yon? Of course, pwedeng itanong yung causative agent. Pwedeng itanong yung mode of transmission. Okay? Pero karamihan doon itatanong yung interventions. Okay? Itatanong doon yung interventions. Isa-isahin natin. Of course, alam natin na this one, okay, is highly infectious. Could be highly infectious. This one is a communicable disease. So isolation and bed rest, dapat nandyan yan. Bed rest because we want the child to recover. Okay? Para maiwasan natin yung further complications. And when we isolate, hindi naman throughout the duration na meron siyang diphtheria, kailangan isolated ang patient. Kailangan lang po natin i-isolate ang pasyente until we have your 2 negative, either nose or throat swab test result. Swab test result. Together. Okay, ayan. Isolation until 2 negative throat or nose swab test result. Okay, taken 24 hours apart. Okay, taken 24 hours apart. Next one, diphtheria. Causative agent nito, bacteria. Therefore, magbigay po tayo ng antibiotics. Okay, sabi natin kanina, under your respiratory diphtheria, pwede mag-learn ng fever si pasyente. Therefore, we also have to give your antipyretics. Okay, ang bed rest po, sabi natin, this is necessary for patients with diphtheria, but not really necessary or mandatory for patients with nasal diphtheria. Okay, not really for nasal diphtheria. Sabi natin, it can even come and go without you knowing. Ganun siya ka-mild. Okay, next, isipin natin yung presentation ng pasyente. Meron daw po siyang bull-like appearance at the same time pseudomembrane. So yung oral hygiene, dapat nandyan din. Okay, oral hygiene. Paano po yung oral hygiene na yan? So, okay na yung warm mouthwash. Okay, alcohol-free. Okay, ano pa? Do not ever, do not use toothbrush. Okay, just don't. Okay, just don't. Bakit ayaw natin na ma-further irritate yung mucous membrane natin? Okay, kung hindi po pwedeng gumamit ng toothbrush, kahit po soft bristles, huwag ka nang tumawad, mami. Sabi na bawal ang toothbrush. Okay, ano yung pwede nating alternative for dyan? We have your cotton pledgets. Pwede rin naman. Okay, just to make sure na mild lang yung the way that we take care of the child's mouth. Okay, ayan. What about the prevention? Iitan ko lang. Okay, what about the prevention? here. Prevention. So we have your either active immunization, okay, or passive immunization. Okay? Tuturuan ko na kayo guys para lang mabilis ninyo. How about po yung mouthwash? Pwede yung mouthwash na alcohol-free. Yung hindi siya stinging. Oo. Ayan. Tuturuan ko na kayo guys, okay? Baka lang din kasi itanong, tas malito-lito na naman kayo, okay? Ang pinagkaiba lang po ng active versus passive ay ito mga keywords lang tayo, okay? Vaccine. Okay, vaccine, which is your DPT vaccine. Okay, sa mundo ng EPI, Extended Program of Immunization, ilang doses po tayo magbibigay ng DPT vaccine? Ilang doses tayo dyan? Okay, 3 doses. Okay, 3 doses of your DPT vaccine taken how many weeks apart? How many weeks apart? Taken how many weeks apart po? Weeks. 4 weeks apart. So we have your 6 weeks. Okay. 10 weeks then 14 weeks. Okay. Next. So kapag active immunization, just think about your vaccine. Okay. Kapag passive immunization, ano po yung keyword natin dyan? We have your immunoglobulin or your antitoxin. Yan. Antitoxin. Okay, antitoxin. Sabi natin kanina, okay, ang cause po ng diphtheria, toxin-mediated release, bacteria. Okay, so in that sense, magbibigay tayo ng antitoxin for that. Okay, ano po yung drug of choice natin? Drug of choice, we have your erythromycin. Erythromycin. Okay, erythromycin, broad spectrum po yan. Okay, complication. Complication. Ay, liit na. Wait lang po. Kita pa. Okay. Ano po ang complication? Nasabi na po natin, we have your airway obstruction. At the same time, imaginein mo na ang bacteria ay nasa throat area. What if it goes further down the throat? Okay. And it could reach your heart. Okay. We have your myocarditis. Yan. So itong dalawang complication na po ito, ang pinaka-deadly complications when we talk about your diphtheria. Okay? Ayan. Questions? Avoid may term dun eh. Wag mong avoid disturbing yung pseudomembrane. Okay, as much as possible. We wouldn't want to make galaw of the pseudomembrane. Okay? Ang konyo, nakakainis. Okay tayo? So kapag nag-gargle ka dyan, baka ma-dislodge mo. Wag muna. Okay? Wag muna. Okay? Sige. So we're done talking about your diphtheria. Ang pinaka-affected age ranges po nito would be children under 5 years old. But there are some journals, okay, yung mga children ages 12 years old, nagkakaroon pa ng diphtheria. Okay? Next, disease. We have your pertussis. Guys, ito pong diphtheria at pertussis para silang magkapatid. Okay, para silang magkapatid. Kapag pinag-usapan ang diphtheria, i-expect mo susunod na pag-uusapan pertussis. In fact, magkasama sila sa isang vaccine. Okay, ganun sila na parang magkapatid talaga sila. Okay, and when we are talking about your pertussis, just look at this child's picture. Okay, kawawa naman. Okay, whooping cough. Okay, that is your whooping cough, okay? Kapag hindi niyo po nakita yung word na whooping cough, tapos nakita nyo or nabasa nyo yung word na paroxysmal cough, iisa lang po sila. Okay, iisa lang po sila. Same lang din po siya ng diphtheria. It is also a respiratory tract infection. Okay, pero magkaiba sila ng causative agent. Okay, magkaiba sila ng cause. Okay, in this disease, meron na tayong bordetella. Bordetella. Di ba parang palaman? Parang Nutella. Bordetella pertussis. Okay, have your Bordetella pertussis. The most common one. Is this one a bacteria, a virus, a parasite, or a fungi? Ang Bordetella pertussis po ba ay bacteria, parasite, virus, o fungi? Guys, pakigalaw po ang baso. Okay. Sige. Bacteria ata. Tama po. Okay, bacteria po. This one is an example of your bacteria. Okay, ang mode of transmission natin. Mode of transmission would be droplet transmission. Okay, droplet transmission. Okay, next. Sabi daw, humans are the only reservoir of your pertussis. Okay, only reservoir of your pertussis. Next, incubation period. Sorry paulit-ulit ako, pero gusto ko lang kasi na tumatak sa inyo na hindi niyo na siya kailangang balik-balikan. Okay? When you say incubation period, this is the period of the first exposure until the appearance of your first symptoms. Okay? And in this sense, ang incubation period po ng pertussis would be 7 to 10 days. Okay? 7 to 10 days yan. Okay? Meron siyang 3 stages. Meron siyang 3 stages. Guys, are you still with me? Konti na lang magbe-break na ulit tayo. Okay? Okay, galingan natin guys. Kumapit tayo guys. Okay, sige. Pag sabihan nyo kung wala ng sense yung sinasabi ko, tatapusin na natin ng maaga. Okay, sige. Ang pertussis po, meron siyang 3 stages. Okay, meron siyang 3 stages. In fact, ang tawag ko sa kanya, pertussis is actually a 6-week disease. Okay, 6-week disease. Bakit po? In each stage, it could last up to 2 weeks. Okay, isa-isahin natin yung stages. We have your catarrhal stage, okay, catarrhal stage, or prodromal stage. Ayan, yung ibang students now overwhelmed. Parang social sila sa term na catarrhal stage or prodromal stage. Ayaw na nilang basahin yung mga susunod kasi nawala na sila ng gana, nahirapan na sila sa terms, okay? Pero, iisa lang po itong catarrhal stage at prodromal stage. Iisa lang sila na ibig sabihin, which is, okay, ito yung phase kung saan nag-appear yung mga non-specific symptoms. Yan, mga non-specific symptoms. Yan lang isipin nyo, wala nang iba. Okay, kapag binigyan kayo ng word na catarrhal stage, isipin nyo lang na sa non-specific stage pa tayo. Okay, this would occur on the first 7 to 14 days, okay, of a child having pertussis. Okay, in that sense, ay, wala pa ako doon. Okay, sige, 7 to 14 days. So, first 2 weeks, okay? In that sense, tama. Kung sabi natin kanina na not specific symptoms, okay, ang catarrhal stage, mag-iisip lang tayo, mag-enumerate lang tayo na ng mga non-specific symptom na alam natin. We have your mild fever, okay, headache. We also have your colds. We also have your cough. Okay, at this point in time, inuubo na po talaga siya. Okay, may persistent cough na siya. And also, pertussis is most infectious. Okay, during this stage. Ulit, pertussis is most infectious during catarrhal stage. During catarrhal stage. Baka lang po itanong. Okay, pertussis is most infectious during catarrhal stage. Yan. I-bold na natin yan. Okay? Pagtungtong niya po sa second stage, that is your paroxysmal stage. Uy, nabanggit na ulit yung word na paroxysmal stage. So, ibig sabihin, ito po yung whooping stage niya. Whooping stage niya na yan. Okay? Ganun pa rin, 2 weeks pa rin. So, that's from 14 days up to 28 days. Okay? From 14 days up to 28 days yan. Okay? Ano na yung main symptom ng batang nasa paroxysmal stage? So, whooping cough galore na siya dyan. Okay? Ayaw niya tumigil. Ubo, galore lang talaga siya. And when we describe, okay, the term whooping cough, okay, first and foremost, the child will take a deep inhalation. Okay, sulat ko na lang din. So, that's deep inhalation. Okay, bubuelo siya niyan. Pag huminga siya, bubuelo siya niyan. Tapos, as the child exhales, okay, yun na yung series, yun na yung cascading cough event. Yun na yung whooping cough na tinatawag. At hindi niya po ito nakokontrol. Siyempre, okay, kaya kawawa yung batang merong pertussis. Hindi niya nakokontrol. Pagod na siya sa buhay niya, pero umuubo pa rin siya. Okay, so that's deep inhalation, exhausting, correct. Deep inhalation, then followed by series of coughs. Series of coughs. Okay? Tapos, after that series of cough, hihinga na naman siya ng malalim. Tapos, magka-cough galore na naman siya. Okay? For some reason, according to our references, the cough is worse at night. Okay? The cough is worse at night. And at the same time, the child would experience anorexia. When you say anorexia, ano to? Pag sinabi mong may anorexia ang bata, ano to? Or anorexia as a symptom, not really loss of weight. Yes, wala siyang gana kumain. Okay? Wala siyang appetite, lack of appetite. Pero guys, pag sinabi ko, anorexia nervosa or pag nakita niyo sa choices, anorexia nervosa, symptom po ba ito ng pertussis? Yes or no? Symptom po ba ng pertussis ang anorexia nervosa? Yes or no? Definitely no. Okay, so what I'm trying to say is that kapag dinagdagan na siya ng word na nervosa, hindi na siya ibig sabihin lack of appetite. It's an entirely different case. Okay, psychological na siya. Okay, hindi na siya communicable disease. So burahin natin to guys. Wag na kayo magpapalito. Magkaiba po ang anorexia sa anorexia nervosa. Yun pa rin, babalik na naman tayo sa reminder ko guys, tapusin nyo pong basahin ang tanong at ang multiple choices. Okay? Baka lang na-excite ulit kayo. Okay? Aside from whooping cough and aside from anorexia, the child could also have vomiting episodes. Okay? The child could also vomit. Okay? So in that sense, pwede ba nating pakainin ng bata, okay, during the whooping cough episode? Definitely no. Okay? Definitely no. Bakit? Isusuka niya yan at the same time, highly risk for aspiration pa yan. Okay? Huwag mo nang ilagay sa danger ang bata. Pagod na siya sa buhay niya. Okay? So after you have your, yes, hindi niya yan matotolerate. Very good. After you have your catarrhal stage, which is the most infectious during the stage, okay, we went to your paroxysmal stage or the actual whooping stage of the child. Then the last one, burahin ko na po ito para pumasya. Okay, we have your convalescent stage. Convalescent stage. Ito na naman yung isang word na intimidate ang mga estudyante. Okay, nasusosyalan na sila sa word na convalescent. Okay, ayaw na nila. So we'll go to that later. Okay, we'll go to the nutrition issue later. Okay, ayaw na nila mag-aral. Okay, convalescent stage is just your recovery stage. Very good po, Ma'am Patricia. Okay, nagre-recover lang ang bata. Ibig sabihin, paggaling na po siya niyan. Ibig sabihin, tinamad na ang bacteria maghasik ng lagim. Okay, na-overcome na ng student, ng child, yung bacteria na yon, paggaling na siya. Okay, healing na siya niyan. Okay, so sabi natin, okay, so yung last, okay, so it can last for 2 weeks, can last for 2 weeks. Okay, it can last for 2 weeks. Ano yung pwede nating makita sa bata na nasa convalescent stage? Correct, may decrease of paroxysmal episodes, okay, less coughing, okay, less vomiting na rin siya dyan. Less coughing, less vomiting, but then, okay, chronic na siya. Ubo-ubo lang din siya. Okay, pero chronic na. Okay, when it comes to so in summary lang guys, okay, when we are talking about your pertussis, it has 3 stages. Okay, it is also called as your 6-week disease because each stage would last for approximately 2 weeks. Okay, the first one is your catarrhal stage or prodromal stage. Iisa lang po sila. Okay, non-specific symptoms lang yan. Okay, next is your paroxysmal stage and the actual whooping stage. Okay, so deep inhalation tapos series of coughs. Okay, the last stage is your convalescent stage or your recovery stage. Okay, so it can last for 2 weeks, less coughing, less vomiting, pero chronic. Okay, next. Okay, let's go to your diagnostic test. Ang diagnostic test natin for pertussis would be the Borde Gengu. Parang pangalan lang ng Pokemon, no? Borde Gengu Agar test. Okay? Agar test. Basically, swab test lang din naman po ito. Okay? Ano ang specimen? Anong specimen nitong swab test na to? We would have a swab test sa ang part sa posterior nasopharynx. Okay? So parang throat culture po siya. Okay? Because I wanted to emphasize with you, okay, na kapag blood culture po ang ginamit nyo in trying to diagnose pertussis, wala kang makukuhang bacteria ng pertussis dyan. Okay? Exclusively found lang po ang bacteria ng pertussis sa respiratory mucous membranes. Okay? Wala po siya sa dugo. Okay? So, hindi po applicable ang blood culture kasi exclusively found lang siya. Okay, sa respiratory mucous membrane. Okay. Depende sa recovery ng bata. Okay, kung mag-proceed pa yung cough niya for more than 2 weeks. Pero approximately within 2 weeks, parang expected na mawawala na yung cough niya. Okay, ayan. Next. So we have your diagnostic test. Depende kasi yung healing period ng isang bata, okay? According sa immune system niya to begin with, ganun. Okay? Pero parang standard lang yung 2 weeks na sinasabi. Okay? What about your management for this disease? What about the management for this disease? The drug of choice. Drug of choice, andyan pa rin yung erythromycin. Erythromycin. Nadagdagan na ng penicillin. Pwedeng penicillin, whichever is available. Okay? And since pertussis can be highly communicable, yes, isolation, nandyan din. And bed rest for the child to recover. Okay? For your paroxysmal stage, sulat natin, for your paroxysmal stage, yung actual whooping cough ng pasyente, okay, we would want to avoid the triggers. Okay, for example, yung dust pollutants, alikabok, okay, baka matrigger yung ubo niya. Okay, we have to maintain a calm atmosphere. Ano po ang significance ng calm atmosphere na yan? Okay, for example, if the child cries, okay, pag po umiyak ang bata, baka po matrigger yung whooping cough episode niya. Okay, so as much as possible, we would want to reduce the crying. Okay, and at the side or at the end of the spectrum, at the other end of the spectrum, if the child laughs, okay, kapag naman po pinatawa nyo, okay, yung bata, baka rin po matrigger ulit yung whooping cough niya, okay? That's why you have to maintain a calm atmosphere while the child is during the paroxysmal stage of the disease, okay? What else? Since this is a respiratory issue, okay, i-ready natin yung oxygenation intervention. Okay, baka kailangan niya ng oxygen support. Okay, oxygenation, nandiyan. Okay, since the issue mainly is about coughing, we also want to promote proper positioning and proper coughing methods, okay? Turning Q2 kapag hindi kayang or kapag nag-bedridden yung patient natin, okay? Anong importance doon? Para ma-avoid yung pooling ng secretions sa isang area lang. Okay? Since it could be painful for the child, you also want to practice yung splinting sa abdomen niya when he or she coughs. Okay? Ano pa? Increase in oral fluids. Yan. Increase in oral fluids. Okay? Administer medication, sinabi na natin yan. What about the nutrition? Yon, may nagtanong, ano yung nutrition ng batang may pertussis? Wala namang bawal sa kanya. Okay, wala namang bawal sa kanya. Pero ang main rule is, kapag ang bata ay nasa gitna ng pag-uubo-ubo niya, okay, wag mong pakakainin. Okay, wag mo siyang pakakainin. Okay? Ang gusto lang din natin na general rule for a child with pertussis is of course, yung mga food, okay, that could help in the recovery of the patient. Yung mga nutritious food like fruits, vegetables, mga proteins, mga ganyan. But general rule, wala namang talagang bawal. Okay? Gusto ko lang i-emphasize na kapag umuubo, huwag mong pakakainin. Okay? What about the prevention? Yan, prevention, yung active immunization. Ano nga ulit yung vaccine natin dito, guys? Ano nga ulit po yung vaccine natin for this one? DPT vaccine. Yes, we have your DPT vaccine. May booster po ba ang DPT vaccine? Yes po. Pwede na pong i-avail ng bata for as young as 2 years old. Pwede rin po as 5 years old. May booster po ba ang pertussis for the adults, meron din actually. Pero ako personally, hindi pa ako nakakita ng booster for the adults. It can be taken every 10 years apart. Yan, 10 years yung interval yan for the pertussis booster. Okay, what about the passive immunization? Sabi natin ano yung keywords kapag passive immunization, either your antitoxin, kung toxin-mediated release yung causative agent, or we have your gamma globulin. Yan, gamma globulin. Okay? Questions for the pertussis. Ito pala yung itsura ng no agar test. So parang seaweed yan. Okay. Questions. So we're done with your diphtheria. We're also done with your pertussis. O yun, yung mga highly irritating foods, okay? Iwasan muna natin yun for them. Kasi yun, kailangan din natin i-observe yung mga triggers ng child when it comes to the whooping cough. Iwasan natin yung mga ganong food. Okay, so we talked about your diphtheria. We're also done with your pertussis. Okay, tapusin na natin yung DPT vaccine, guys. Letter T stands for your tetanus. Okay, that is your tetanus. Very good. Okay, tetanus. Kapag lumabas yung word na tetanus, when we hear the word tetanus, ang next na lalabas sa isip natin ay, yun ba yung lockjaw? Opo, yun po yung lockjaw. Okay, yun po yung lockjaw. Ang causative agent ng tetanus ay, we have your Clostridium tetani. Is it a bacteria, a fungi, a parasite, or a prion? Okay, bacteria pa rin po siya. Okay, bacteria pa rin po siya. Ulit, bacteria pa rin po siya. When this certain bacteria enters our body, they would produce a toxin. So toxin-mediated din po ito, just like your diphtheria. Okay, and that certain toxins that would enter our body would cause your painful muscle contraction. Isulat ko na lang din, okay? So, ito pong Clostridium tetani, meron po siyang toxin na nire-release. Yan din po yung cause, okay? Kaya nagkakaroon ng muscle contractions. Okay? Okay? Tapos, meron pa akong i-introduce sa inyong words. We have your tetanolysin and your tetanospasmin. Wait lang. Okay? Tetanolysin and your tetanospasmin. So these are the two common toxins, okay, that was produced by this bacteria. Okay, pag sinabi mong tetanolysin, okay, ito, according to studies, wala naman talaga siyang pathologic activity. In short, hindi po siya destructive. At kung destructive man siya, ang effect niya sa katawan would just be your local tissue response. Okay? Parang may irritate lang for the very, very slight time lang. Okay? Yung skin, kung saan pumasok yung tetanus bacteria. Okay? On the other hand, when we talk about your tetanospasmin, okay? Tetanospasmin. Okay? This is the toxin that is responsible for the clinical tetanus that we know. Okay? Ito talaga yung may destructive ability. Okay? Sulat ko na lang dito, clinical tetanus. Yan. So, itong tetanospasmin talaga ang may pakana kung bakit nagkakaroon tayo ng muscle contractions. Okay? Ano pa? This is also one of the most potent toxins, no? Okay? So, kapag meron kang tetanospasmin sa loob ng katawan, parang expect mo magkakaroon ka talaga ng destructive response. Okay? Ano pa? Ano yung mga causes ng tetanus that we know? Saan natin pwedeng makuha tong causative agent na to? Meron ako nabasa sa Facebook, yung mga plantito, plantita, they also have to be very careful, okay, in having tetanus kasi very, very highly exposed sila sa soil. Okay? Highly exposed sila sa soil. Sa dumi ng tao, sa dumi ng even animals, manure, pwede rin tayo makuha ng tetanus dyan. What about the rust? Does the rust itself, does the rust per se causes your tetanus? Yes or no? Rust per se, does it cause your tetanus? Yes or no? Actually, it's a common misconception. Okay? Actually, nung mga bata pa tayo, 'di ba? Tas sabi nila, "Uy, pag nakatapa ka nung may kalawang na pako, okay, pwede ka magkaroon ng tetanus, okay? Pero pwede natin tong tignan into different angles, okay? Ang rust po kasi, okay, ang rust kasi, it came from the soil basically. Okay, di parang chemical reaction yan that was primarily found in the soil. Okay, parang na-associate lang natin yung rust itself kasi yun yung nakikita natin. Okay, pero kasi yung rusted na nail na yun ay galing din sabihin natin sa soil. Okay, so ibig sabihin, pag tinanong kayo kung ang rust per se ba does that cause your tetanus? Answer no. Okay, ano pa? Kapag kasi nakatapak po tayo, okay, ng kinakalawang na pako, okay? Tapos, malalim po yung sugat. Malalim po yung sugat. Okay? High risk ka to having your tetanus. Bakit? I-describe natin yung bacteria, itong Clostridium tetani. Gusto niya na anaerobic condition. Nabubuhay siya sa medyo ontik lang yung oxygen. And the deeper the wound, okay, the deeper yung tissues na naabot ng sugat na yon, okay, mas gusto niyang nagtatribe siya doon, yung Clostridium tetani. All the more na pwede kang magkaroon ng tetanus. Okay, ano pa ba? Punctured wounds, sulat natin, punctured wounds. Neonatal tetanus, secondary to unsterile equipment. Yan. Okay, ano pa? Abortion. Pag nagkaroon ka ng abortion, more specifically septic abortion. Okay, patients na merong tattoo. Yan, patient na merong tattoo, patients na merong dental infections. Dumi po, yung manure. Dumi po siya. Feces, parang ganun. Okay? Dental infection, pwede rin yan. Kapag merong umbilical cord or umbilical stump infection, high risk din yan to having your tetanus. Okay? Mode of transmission. Mode of transmission. You have your indirect contact. Indirect contact. Incubation period. Incubation period. Ano nga po ulit yung incubation period, guys? This is the period where first exposure until the first appearance of the symptoms. Okay, very good. Okay. Incubation period, sabi daw it can vary from 3 days to 1 month, pero standardly that's 7 to 14 days. Okay, yan. Next. Gusto ko lang na may mga picture. Ayan. Kita natin yung picture for the signs and symptoms, guys. For the signs and symptoms. Okay? The first symptom na pwede nating ma-observe sa taong may tetanus is, of course, restlessness, mga non-specific, and irritability. Restlessness, irritability. Tapos, mas ma-appreciate natin na, uy, baka tetanus to. Okay? Kasi nagkakaroon na siya ng muscular stiffness, muscle stiffness. Okay? And nagpo-progress yan. Ito yung mga pictures sa right side ng slide. If you would see, we have your trismus. Okay? Kapag nabasa niyo po, nakita niyo po yung word na trismus, it talks about your tight jaw. Okay? Trismus is a tight jaw. Ito po siya sa first picture. Okay? Nahihirapan po siya, ibuka yung bibig niya. Tight jaw. Okay? Ano pa? Ang progression niyan ng muscle stiffness is nagkakaroon siya ng tight jaw. Okay, nagiging stiff yung arms and legs niya. Okay, tapos buong body na yung affectation. Okay, you also have your rhesus sardonicus. Okay, rhesus sardonicus. Ito yung sardonic smile or your devil's grin na tinatawag. Okay, that is your facial muscle spasm. Okay, facial muscle spasm. Buong face niya yung nag-i-spasm. Okay, the last picture is your opisthotonus. Ano spelling? Opisthotonus, ganyan, okay? That is the arcing of the back or arching of the back. Yan, arching of the back. Ito yung classic picture ng tetanus natin, okay? Kasi Nagkakaroon ng spasm yung sa bandang extensor muscles ng spine natin. Okay? Yes, may treatment tayo for the tetanus. May treatment. Okay? Diagnosis or diagnostic test. Diagnostic test. Walang specific diagnostic test for the tetanus. Okay, history taking lang yan. History taking lang yan. Okay, kukuha lang yung ng doktor na enough, okay, na cues para ma-identify, para ma-correlate yung symptoms niya sa tetanus. Okay, so wala tayong specific lab tests to confirm your tetanus. Okay, next. What about the interventions? Interventions. Of course, kung ang main cause ng tetanus mo is punctured wound, okay? Therefore, ano tayo dyan? Source control tayo. So, aggressive wound care tayo dyan. Okay? Aggressive wound care. I-heal mo muna yung main cause ng tetanus, which is the punctured wound. Okay? Ano pa? Drugs or antibiotics. Okay? To control your muscle spasms, okay? Kung may fever, bigyan mo siya ng antipyretics, of course, yung vaccine. Ano nga po ulit yung vaccine natin for the tetanus? You have your DPT, okay? Tetanus toxoid, okay? And you also have your tetanus toxoid. Hindi siya contagious. Okay? Ayan. So, sulat ko lang, DPT vaccine, meron din tayong tetanus toxoid. Kung narinig niyo na po yung word na antitoxin, okay, or antitetanus serum, or yung ATS na tinatawag, okay, this is exclusively given within the first, okay, should be given within the first 24 hours after the first exposure mo sa bacteria. For example, after mo makatapak ng pako, kailangan within 24 hours, mabigyan ka na nito ATS or antitoxin serum. Bakit po? Hindi na siya effective, okay, for the succeeding hours. Okay, dapat 24 hours, maibigay na po na yan. Okay, kung sakaling nalagpasan mo, okay, yung 24 hours, hindi ka na pwedeng magbigay ng antitoxin serum. Okay, may pwede ka pang ibigay. Dito ka na ngayon sa tetanus immunoglobulin. Yan, tetanus immunoglobulin. If merong allergy ang patient sa tetanus immunoglobulin, would you still give it? Yes or no? Would you still give it? Yes or no? Ang tetanus immunoglobulin, tapos allergic si patient doon. Okay? You can still give it. Okay? Pero, how will we give it? In fractional doses, in divided doses. Okay? Unti-untiin mo yung pagbibigay ng dose. And then observe for any allergic reactions. Okay? There are no solid, stable evidence that would support yung treatment minsan ng mga doctor that they would tend to administer antihistamines first before giving this immunoglobulin. Okay? Pero in practice, ginagawa yun minsan. Nagbibigay muna sila ng antihistamine. Okay? Kasi alam nilang allergic yung pasyente doon. Pero wala namang stable evidence for that. Okay? Yung antibiotics na sinasabi natin dito, we have your penicillin G. Okay? That is your penicillin G. Yan. I-highlight na nga natin. Yan. For any muscle spasms, pwede rin po tayo magbigay ng diazepam. Next, pwede ko na itong burahin, guys. Burahin ko na. For the treatment, or interventions, nursing interventions natin. Interventions, okay? Isolation, bed rest, okay? For the patient to recover, okay? Tapos, protect safety precautions, okay? All precautions for the patient with opisthotodus, all precautions, okay? IV, okay? For nutrition, mali mo, nag-spasm na yan dyan, okay? Parenteral IV, okay? Oxygenation, oxygenation. Kung alam mo naman pala na may tendency to close ang airway niya, okay, i-secure mo na, mami. Okay, i-secure mo na. Pwede tayo mag-intubate, pwede tayo mag-tracheostomy for that. Okay, tracheostomy. Okay, sige. Next, questions. May questions ba, guys? Paano po yung nutrition niya? Okay, assess mo muna yung gag reflex. Assess mo muna if the patient is able to swallow. Okay? Doon ka magbigay ng solid food or doon ka magbigay per RM. Kapag mataas yung risk for aspiration, okay, mag-NGT ka na or IV. I-IV mo na yung nutrition niya. May tetanus toxoid na prophylaxis, parang pre-exposure. Merong ganon. Okay? Sige. Ito additional knowledge lang. Actually, under to na OP concept. Okay? Pero kasi isa rin siya sa frequently occurring, frequently asked in the boards. Okay? Yung 5 doses na tetanus na kailangan for the pregnant mother. Okay? If you would notice, yung first dose ng tetanus toxoid, wala pa siyang protection na binibigay. Okay? At dahil wala pa siyang protection na binibigay, kailangan bumalik siya sa health center para magkaroon ng second dose. Kasi doon lang po epekto yung vaccine. Okay? At least 4 weeks later, then for the third dose, at least 6 months later, then for the fourth dose, at least 1 year later. Lumabas daw yan, ma'am, last November. Sabi ng friend ko, SKL. Okay, thank you naman sa friend mo, binigyan tayo ng idea na yun nga, to confirm lang na frequently talaga siyang lumalabas. Okay, so for future reference nyo lang, pwede na siyang screenshot para di na kayo mahirapan maghanap ng table na ganito. Okay, pag may lockjaw na yung patient, high risk na siya for aspiration, huwag mo nang i-attempt, okay, to give the foods per RM. Questions? If no questions, break muna tayo 10 minutes. Thank you, guys. Alala ko, nag-war flashback kanina. So yun na nga, 'di ba? Parang scabies nga ilumabas na feature nung board exam namin ng time namin. Sobra yung overthinking ko noon, as in tinanong ko ano yung parang causative agent nung scabies. Tas it's either a bacteria, virus, parasite, or fungi, ganun. Tas ang lala ng overthinking ko, grabe. As in parang parasite, 'di ba? Hindi ba? Di ba parasite? Gawagad talaga yung sarili ko. Tapos, meron pa siyang tinatanong na interventions doon. Para ang tanong ay, kung mag-a-apply daw ng medicated lotion. Mga ganun yung mga tanungan doon sa boards eh. Saan banda? Okay, tapos may option doon na parang apply all over the body or apply only doon sa kung saan ka merong blister or wound. Grabe yung lala na overthinking ko, mami. Okay. Huwag kayong gano'n, okay? Huwag kayong gano'n. Alam mo yung mga simple lang yung tanong, okay? Simple lang din yung sagot. You just have to think it very carefully and you just have to be more confident and you have to trust yourself more na alam mo yung sagot. So yun yung isagot mo. Mag-stick ka doon kasi minsan sa dinami-dami nung nabasa natin, nung mga nahagip nating information, naghahalo-halo na yan. You just have to discern and analyze well kung ano ba doon yung susundin mo or yung isasagot mo sa boards. Okay? Sige, balik na tayo. Confidence is the key. Totoo yan, guys. Totoo yan. Matututunan niyo rin yan dito as we go along. Okay? To fight for your answer, to fight for the best answer. Okay? So we're done talking about your diphtheria and your pertussis and your tetanus. Let's now go to your poliomyelitis. Okay, apparently, dapat eradicated na itong polio na to. Pero dahil sa Dengvaxia controversy, di ba, medyo umonte, nag-reduce yung compliance ng Filipinos when it comes to the vaccine. Apektuhan yung ibang vaccines, including the polio vaccine. Okay? So when we think about the word polio, guys, nandito na ba ulit tayo? Umuunti tayo ha? Bakit? Guys, paramdam naman, please type in your favorite emoji. Di ba pwede mag-emoji dito? Ayan, sige nga, patingin nga ng mga favorite emoji nyo, guys. Ayan. Your last emoji will tell you kung ano itsura mo sa board exam. Kung ano itsura mo sa board exam. Ganyan. Okay? 100. Yan. That is the spirit, guys. Okay? Ayan. In love tayo sa board exam, sa actual board exam. Kailangan, okay? Kailangan maganda rin yung mood natin sa time ng boards. Promise, it can really affect your scores. Okay? Sige. When we are talking about Angel, okay? Huwag niyo muna akong guluhin. Nagpapadami ako ng ligtas points. Okay? Ganyan. Okay. When we talk about your poliomyelitis, okay? It is also known for being for it being termed as an infantile paralysis. Okay? Infantile paralysis. Okay? Yan. So kapag nakita niyo po sa board exam, word na infantile paralysis, it talks about your polio. Okay? Polio po ang pinag-uusapan natin. Okay? What else? Wait lang. Ayusin natin. Causative agent. Ano po ang causative agent ng polio? Okay, we have your poliovirus. More specifically, that is your Ligio debilitant. Yan. Okay, virus naman tayo ngayon, guys. Okay, nasa virus world na po tayo. Kita niyo pa ba kapag ganyan na lang kaliit? Okay. Kung virus ang causative agent ng polio, ano ang mode of transmission niya? Ano ang mode of transmission niya? Mode of transmission, guys. Okay. Orophycal route. Yan. Orophycal route tayo dyan. Incubation period, that is the period of the first exposure until the first appearance of the symptoms. That's 5 to 14 days. Okay, that's 5 to 14 days. Okay. Yan. Ang konsepto po ng polio, guys, ang konsepto po ng polio, basically speaking, okay, kung i-correlate natin siya sa presenting symptoms, which is having paralysis, okay, having spasms. Okay, it is because this poliovirus, okay, attacks your motor neurons. Okay, it attacks your motor neurons. Okay, it can also attack, okay, your brainstem and your spinal cord. Kaya nagkakaroon tayo ng paralysis. Okay. Yung mga milder forms ng symptoms ng polio is your paresthesia. So when you say paresthesia, basically, feeling mo may tumutusok-tusok sa'yo. That is a feeling of pins and needles, okay, in your legs, okay? The next one, you can have your meningitis. Pwede ka dyan magkaroon ng meningitis. And of course, the worst one is the paralysis. Yan yung mga main symptoms ng polio. Okay? When we are talking about the poliomyelitis signs and symptoms, ayan, signs and symptoms. Signs and symptoms. It is divided into four, okay, 4 stages. The first one is what we call your abortive poliomyelitis, okay? Pag sinabi mong abortive poliomyelitis, basically, ito yung mga non-specific symptoms that we could think of. For example, okay, for example, upper respiratory tract infection. So we can have your cough and colds here. Okay, fever, headache, ganyan, vomiting. Basta yung mga non-specific symptoms na naisip nyo, abortive poliomyelitis ang tawag natin dyan. Okay? Pabalik mo. Paresthesia, meningitis, paralysis. May chance po na mag-progress, okay, yung signs and symptoms natin. And if that's the case, hindi na po abortive poliomyelitis ang tawag natin dyan. Non-paralytic polio na po. Okay, non-paralytic polio. Okay, i-highlight natin. Non-paralytic polio. Okay, pansinin nyo to guys, yung cluster of symptoms nito. Okay, we have your stiffness of the neck or neck stiffness. Okay? Pwede ring stiffness ng back tsaka ng limbs. At the same time, that certain patient under this non-paralytic polio stage can have your nausea and vomiting. And at the same time, kapag pinalumbar tap mo yung pasyente na yun, okay, inanalyze mo yung CSF niya, makikita natin na medyo mataas yung amount ng protein sa CSF niya. Okay? With this cluster of symptoms, okay, or cues, okay, this can very well resemble, okay, the meningitis disease or meningitis condition. Okay, this explains, okay, yung meningitis na symptoms na binabanggit dito kanina. Okay, kasi nga yung virus pwedeng atakihin yung brainstem and even the spinal cord. So kapag nagkaroon ka ng inflamed spinal cord dyan or inflamed meninges, okay, meningitis na yun. Okay, balik tayo. After your non-paralytic polio, it can even have furthermore complications. Ang tawag na natin sa kanya is paralytic polio na po. Okay, paralytic polio na yan. And under this paralytic polio stage, okay, ang main symptom natin is of course paralysis, spinal affectation na po tayo dito. Okay, spinal affectation depende sa level, okay, na affected na part. Okay, pwede tayo magkaroon ng limb paralysis, which is actually the most common. Okay, pwede tayo magkaroon ng limb paralysis. Pwede tayo magkaroon ng bladder and bowel paralysis. Bladder and bowel paralysis. And the most severe case of all, guys. Okay, dito natin ma-associate yung iron lungs na tinatawag. Okay, because possibly, pwede rin ma-paralyze yung diaphragm mo. Okay, may affectation ka rin dyan sa diaphragm. Nahirapan sa spelling. Okay. Ayan. So, paralytic polio, ang pinaka-main affectation, okay, is the spine. Okay. Kaya ka nagkakaroon ng paralysis dyan. Okay. And the last and most severe stage of your polio is what we call your bulbar polio. Okay, that is your bulbar polio. Kapag narinig mo yung bulbar polio, yun yung most severe form of your polio. Okay, this is the most life-threatening actually. This is the most life-threatening Bakit? Magkakaroon ka na po dito ng aspiration issues. Pwede ka rin magkaroon ng encephalitis dyan. Okay? Ang gusto kong itanong, guys, okay? If ang patient natin, ang pinakaunang presenting symptom niya po ay abortive poliomyelitis lang, puro non-specific symptoms lang. Okay? Pwede ba siyang mag-progress deep down hanggang bulbar polio? Pwede ba siyang umabot hanggang bulbar polio? Yes or no? Yes, pwede po siyang mag-progress, pwede siyang mas maging severe, umabot sa bulbar polio. Next question, okay? Lahat po ba ng abortive poliomyelitis cases ay umaabot hanggang bulbar polio stage? Yes or no? Lahat ba yan ay umaabot ng bulbar polio stage? Yes or no? The answer is no. Okay, the answer is no. Minsan hanggang paralytic polio lang tapos nagre-recover na. Okay? Minsan yung iba hanggang paralytic polio lang pero lifetime yung residual paralysis. Mga ganun. Okay? But not necessarily na lahat ng polio cases ay hanggang bulbar polio. Okay? Depende sa severity. Okay? Next. Ano po yung diagnostic test natin for the polio? Diagnostic test. We have your CSF analysis. Sulat natin. Or your lumbar tap. Okay? Management natin. Ano nga po ulit klase ng causative agent ng polio? Is it a bacteria, a virus, parasite, or a fungi? It is a virus. Virus or virus. Okay? In that sense, as we know, guys, yung mga virus cases, virus diseases natin, as we know, self-limiting lang yan. Okay? Pwede siyang umalis kahit wala kang ginagawa. Okay? In that sense, symptomatic ang management natin sa polio myelitis condition. So, symptomatic. Okay? Treatment. Kung ano yung presenting symptom ng bata or ng adult patient natin, okay? Yun yung gawin mo. For example, paralysis. Meron siyang paralysis. So, engage mo siya or enroll mo siya sa rehabilitation program. Okay? For paralysis, pwede rin tayo mag-change positions frequently. So, turn the patient Q2. Okay? Because we would want to promote the correct body alignment of the patient to avoid the deformity. Okay? Ano pa? Kung yun yung main issue niya, kung ayaw mo siya magkaroon ng deformity, you place the patient on a firm mattress. Or kung merong egg crate mattress, why not? Okay? Ano pa? To avoid further deformities, okay? You may also want to use a footboard, okay, to prevent your foot drop. Okay? And as we know, hindi lang naman paralysis yung pwedeng magkaroon yung pasyente. Pwede rin siya magkaroon ng muscle spasms. And if that's the case, pwede kang mag-apply ng heat, okay, to relax the muscles. Okay? Ano pa? Kapag medyo severe form ng polio, meron ng pasyente, okay, affected yung respiratory system niya. Okay, meron siyang secretions. Sabihin natin intubated yung pasyente mo. Meron siyang secretions. So you may want to suction those secretions to avoid aspiration. Okay? Kung meron siyang any swallowing difficulties. Okay? Assess mo muna yung gag reflex. Kung tolerated ang soft diet, okay, mag-soft diet tayo. Kung hindi, NGT feeding, pwede rin naman. Okay? Sabi natin kanina, affected po under the paralytic polio yung spine. Okay? Kapag meron siyang bladder and bowel paralysis, okay, so prone to incontinence ang pasyente, okay, you may want to promote the skincare to avoid further irritation, and of course, catheterization if possible. Okay? Ano pa ba yung mga naisip natin? Usually, dun lang din naman nagsisenter yung interventions natin with polio patients. Okay? What else? Siyempre yung pinaka-basic, mami, di ba? ROMs. Huwag mong kalimutan. What about the prevention? What about the prevention? Yan. For the active immunization, marami tayong vaccines for the polio. Okay, we have your OPV. You have your OPV. You have your IPV. Okay? And itong OPV na to, guys, oral polio vaccine. Okay? Sa bibig po siya binibigay. So kapag na-encounter niyo yung word na Sabin vaccine, iisa lang po siya sa oral polio vaccine. Okay? Sabin vaccine is just the same as your oral polio vaccine. Okay? Sabin, sa bibig. Okay? Sa bunganga po siya. Kaya oral siyang binibigay. Okay? On the other hand, kapag inactivated polio vaccine, okay, ini-inject po ito. Okay? So it's just one and the same with your salt vaccine. Okay? Salt vaccine. Para mas matandaan natin po siya, okay, tusok, itutusok natin siya. I-inject po natin itong IPV na ito. Okay? Which one is the attenuated vaccine? OPV or IPV contains the attenuated virus. Okay? That is your OPV. Susulat natin, attenuated. Whereas, ang IPV, it contains your killed virus. In that sense, pwede ko po bang ibigay ang OPV sa pasyenteng may cancer? Yes or no? No, bawal. Although, yes, attenuated yung vaccine, it is a live virus. Buhay yan. So we wouldn't want to place the patient to any more virus exposure. So skip mo muna. Okay? Huwag ka muna magbibigay ng OPV vaccine sa mga immunocompromised patients natin. Okay? Next one, passive immunization. Under your passive immunization, dalawa lang naman ang keyword natin. At dahil hindi naman po toxin-mediated ito, wala kang antitoxin na ibibigay. Ano na lang po yung natira? We have your gamma globulin. Gamma globulin. Okay? So basically, this is the concept of your poliomyelitis in a nutshell. Okay? In a nutshell. Yan yung mga enough to know details about your polio. Talaga, buti naka-recover siya. Buti naka-recover siya. Okay, next one. We will go now to your measles. So yung MMR, isa-isahin natin. Okay? Ang measles, in other words, it can also be called as your rubiola. Okay? Rubiola po yan. And i-differentiate na natin agad yung term na rubiola versus your rubella. Okay? Para lang sa ngayon pa lang, hindi na kayo malilito. So kapag sinabing rubella, okay, this one is your German measles. Is your German measles. Ang measles po ba at ang German measles ay isa lang? Yes or no? Ang measles at ang German measles, si isa lang po ba yan? Yes or no? Hindi po, magkaiba po yan. Ang rubiola po ba at ang rubella, iisa lang po ba yan? Yes or no? Hindi rin. So, wag yun na pong pagbabalig-paligta rin. Okay? Pag rubiola, isa lang po yung letter L ng rubiola at one word lang po ang measles. So, yun na yun. Mami, measles and rubiola, just one and the same. Okay? On the other hand, rubella has two letter L's. Dalawa yung letter L ng rubella. And in this sense, dalawa yung words ng German measles. German measles, two words, rubella, two letters. Okay? So, German measles corresponds to rubella. Rubiola corresponds to measles. Huwag niyo na pong pagbalik na rin. Okay? Sige. O, di ba? Marami talaga nalilito dito, guys. Ngayon pa lang, okay? Intindihin na natin. Hindi sila magkapareha, okay? At may pinagkaiba sila. Okay? Rubiola measles, rubella German measles. Okay? Pag-uusapan din natin ito mamaya. So, let's go now first to the causative agent of your measles. Of course, it is a virus. Paramyxovirus. Okay. Paramyxovirus. Yes, okay. The causative agent is paramyxovirus. Period of communicability. Baka lang po itanong. Okay, period of communicability. Pag sinabing period of communicability, ito po yung duration kung kailan nakakahawa ang isang batang may measles. Yun yung duration. At ang textbook definition ng period of communicability ng measles ay sabi daw, it's 4 days before the appearance, 4 days before the appearance of the rash to the 5 days, okay, after rash appearance. After rash appearance. 4 days before the appearance of the rash to 5 days after appearance of the rash. Now, ideally or realistically speaking, hindi naman natin ma-observe ito yung 4 days before appearance of the rash. Hindi naman natin makikita yan sa isang tao. Okay? Kaya naman po, umaasa tayo dito sa latter statement, 5 days after the rash appearance. Okay, ito yung usually nalalabas sa multiple choice. 5 days after the rash appearance, pinaka nakakahawa ang measles. Okay, yun yung period of communicability niya. Okay, what is the mode of transmission of these measles? Mode of transmission, guys. Mode of transmission, sabi natin, tatlo lang naman silang airborne transmission. Okay, we have your TB, measles, varicella. So, nasagot na natin yung measles sa airborne. Okay, next, incubation period. Incubation period, sabi daw, unang lalabas ang fever for or within 10 days. Ang susunod na lalabas ay yung rash. Okay, that's for or within 14 days. Okay, so fever muna, tapos rashes. Okay, now let's go to the signs and symptoms. Okay, the signs and symptoms of measles. Okay, kapag na-encounter nyo yung word na coryza, okay, word na coryza, okay, social na naman ng ibang tao when it comes sa word na coryza, okay, huwag kayong panghinaan ng loob, pinasocial term lang yan, ibig sabihin lang yan, okay, sinisipon po yung pasyente, okay, cough and colds lang yan, okay, so ang coryza, non-specific symptom po siya, okay, non-specific symptom yan, okay. Aside from that, pwede tayo magkaroon ng fever, cough, yun na nga yun, conjunctivitis. Ay, nangyari. Dito ka muna. Okay, conjunctivitis. Ano pa ba? Photophobia in that sense. Okay, photophobia. Photophobia, pwede rin maging enlarged lymph nodes mo kasi nga may infection na nangyayari. Okay, Koplik spots. Let's talk about their Koplik spots. Okay, ang Koplik spots po would appear on the day before the rash. Okay, Koplik spots would appear on the day before the rash. Anong itsura niya? Ito po yun. Sabi po sa picture, okay, it would resemble a grain of salt on a red base. Kasi po, whitish spots po siya. Okay, with reddish base. Okay, whitish spots with reddish base. Okay, saan natin ito makikita or ma-appreciate? Sa insides ng mouth natin, sa buccal mucosa. Can be found, okay, sa buccal mucosa ng isang bata. Okay, after we have your Koplik spots, that is the time na mag-a-appear na po yung rashes sa buong katawan ng patient natin. So, isulat natin rash. Okay, anong itsura ng rashes ng taong merong measles? It's your time to shine. Ayun. Yan yung itsura niya, guys. Okay? It would appear first on the face down. Okay, yun lang kailangan yung tandaan. Face down. So, pag sinabi mo face down, so face, neck, or face, forehead, cheeks, basta face, okay? The neck, and then it would spread downwards over the rest of the body. Okay, from face down, so face muna, then spread downwards over the rest of the body. Yun lang yun. At ito pong rashes ng measles, okay, makatip po ito. So, isulat natin pruritus. Okay, so sobrang katip po yan. Okay, minsan di napipigilan ng mga pasyente, nag-scar pa yan. Okay, sige. Next. Meron po bang diagnostic test ang measles? Wala po. So, no specific diagnostic test for the measles. Now, let's go to the management. Ano yung management ng batang merong measles? Sabi natin, measles, highly contagious. Okay, highly contagious po ito. Highly communicable. Okay, so babalik na naman natin isolation and bed rest for the patient to recover. And sabi rin natin kanina, ang causative agent ng measles, ano yan? Para mix of virus. Therefore, it's a self-limiting disease. Okay? Symptomatic management tayo. Symptomatic management tayo dyan. Okay? So, kunwari, kung merong eye complications ang bata, so mag-eye care tayo. Okay, eye care tayo. Okay na yung warm saline. Okay? Kunwari, may lagnat ang bata, so magbigay ka na antipyretics. Kunwari, meron siyang Koplik spots, meron siyang mouth complications, okay, bigay ka dyan ng mouth care. Okay, and then, of course, encourage your fluids. Okay, yeah. Okay, encourage your fluids. Negative pressure room, yes, correcto. Pag hospital setting tayo. Okay, prevention. Prevention. Kapag active immunization, ano na ngayon yung vaccine natin sa measles? Anong tawag sa vaccine natin sa measles? MMR vaccine. Measles vaccine. MMR vaccine. To be given when? To be given when? As early as 9 months, pwede. Okay, as early as 9 months, pwede. Okay. Gusto ko yung reference mo, yung mga matatanda. Gusto ko yung reference. Very highly scientific, very highly backed up by evidence and journal. Okay, may nagtanong, okay lang po ba silang maligo? Kasi sabi po ng matatanda, bawal po silang maligo. Okay? Syempre pwede. Pwede naman, okay? That is to promote your safety and comfort for the patient. Especially, syempre, kapag meron kang rashes all over your body, it's highly irritable, it's highly uncomfortable for the patient. And of course, tama rin si Miss Adel to relieve your pruritus. So, pwede, wag po natin ipagkait sa bata ang karapatan niyang maligo. Okay? Pwede po siyang maligo. Okay? Sige. After your active immunization, MMR vaccine to be given as early as 9 months, pwede rin 12 months. Okay? Passive immunization. Passive immunization. Okay? Gamma globulin. Pwede silang mag-lotion. Pwede silang mag-lotion, yung mild lotion, to relieve the pruritus. And of course, to maintain the moisture kasi magda-dry din yan. Okay, gamma globulin for the passive immunization. And of course, syempre, highly contagious po ito. Huwag niyo na pong ipagamit sa ibang members of the family yung gamit nila para hindi po magkakahawa-hawa. Okay, ayan. So that's all for your measles, guys. Konting-konti na lang. Sobrang konting-konti na lang. Ang tigdas hangin po, same lang sa measles. Yes. Tapos ang bulutong, yun po yung chickenpox. Okay? Common siya sa bata. Common siya sa bata, but not necessarily na exclusive lang siya para sa mga bata. Pwede rin magkaroon yung adults. Pwede rin sila magkaroon ng measles. Okay? Teenagers, yan. Pwede rin. Okay? So let's go now to your moms. Guys, kapit na lang. Konti na lang to. Okay? Konti na lang to. Okay? Let's go now to your mumps or beke in Tagalog. Causative agent of your mumps. Paramyxovirus. Same lang sila na paramyxovirus. Same lang sila ng measles. Virus din po ang cause nitong mumps. Okay? Communicability period or period of communicability. Okay? I-re-emphasize ko lang po, pag narinig niyo po yung word na period of communicability, ito po yung duration kung kailan sila pinaka nakakahawa. Okay, ang textbook definition po ng period of communicability ng mumps would be 1 to 6 days. Would be 1 to 6 days before the first symptoms appears. Before the first symptoms appears until the swelling disappears. Ganun. Until the swelling disappears. And of course, realistically speaking, hindi naman natin ito ma-observe itong 1 to 6 days before the first symptom appear. So, saan tayo aasa? Dito tayo aasa. Until the swelling disappears, okay, i-treat mo yung child as highly contagious. Okay? Until the swelling disappears, i-isolate mo ang bata. Okay? Mode of transmission. What is the mode of transmission of mumps, guys? Ano po ang mode of transmission ng mumps? Droplet. Correct. Okay. Droplet. Pwede rin pong direct or indirect contact or droplet contact. Pwede yan. Okay. Ang alam natin ng mumps or beke sa Tagalog, ang main presenting symptom niyan would be the puffy cheeks. Okay. Tapos kapag hinawakan mo, yung cheeks nila, yung jaw area nila, okay, masakit. It's very tender for them. Yes, that's the term. Tender is the word. Okay? Because this is the result, okay, of a swollen salivary glands. Okay? Swollen po ang salivary glands. Okay? Ang tawag po natin dyan ay parotitis. Okay? Sulat ko na lang din. Kapag may nakita kayong option na parotitis, okay, highly related siya sa mumps as a communicable disease. Okay? I-explain lang natin ng mabilis lang. So when you get the mumps, okay, pag nagkaroon ka ng mumps, sabi natin, droplet transmission siya. So basically, the virus would enter your respiratory tract, okay, that's either from your nose or mouth or throat, okay, into your parotid glands, guys. Okay, ang parotid glands po natin, ito yung saliva producing glands, okay, on either side of our face. Okay? Doon po sila tatambay. Doon sila gagawa ng pamilya. Okay? Doon sila mag-reproduce. Okay? Doon po sila dadami. Okay? And the longer they stay there as the reservoir, this would cause the glands to basically swell. Okay? But at the same time, meron po mga pasaway na virus, gustong-gusto nilang mag-explore sa ibang parts ng katawan natin. Okay? Tinatamad na sila na magstay doon lang sa parotid glands natin. Okay? Some virus can also enter. Okay? Some virus can also enter our CSF or cerebrospinal fluid. Basically, medyo med-surge na po ito, pero I'm trying to prove a point. Okay, so that is the fluid, okay, that can be found on your brain and in your spine. Okay, so once that virus would enter your CSF or your cerebrospinal fluid, it can now spread to other parts of the body. Feeling niyo napaka-powerful niyang virus, okay? Kung saan siya nag-adventure sa loob ng katawan natin. Okay? It can now spread to other parts of our body, such as our brain to begin with, okay? Pancreas, pwede rin silang makaabot doon. Doon na po papasok yung issue ng sterility. Okay? Kasi mararating po nila ang mundo ng testicles for the guys and even the ovaries for the women, okay? For the girls. Okay? Mas commonly lang po talagang affected, okay, yung testicles ng men, okay, kung para mo sa ovaries ng women, okay? But at the same time, nagkakaroon din po ng complication kapag babae, okay? Kapag ang babae ay may mumps, okay? Pero most common lang po kasi, okay, na umabot ang virus sa testicles sa mga lalaking may mumps. Okay? Sige, next. Ayan, para may picture. Next slide natin. Ito yung picture ng parotid gland na normal. Okay, so normal lang siya, nananahimik lang siya dyan. Okay, tapos ito yung picture ng swollen na parotid gland. Nag-i-increase in size. Kaya yun yung presenting symptom natin, puffy cheeks. Okay, we have your prodromal phase. Prodromal phase. Sabi natin prodromal phase, yan yung mga naisip nating non-specific symptoms. Okay, we have your coryza. Babalik tayo dyan sa coryza. Okay, low-grade fever. Pwede silang malagnatin. Okay, pwede silang sumuka-suka dyan. Pwede silang magkaroon ng headache. What else? Pasosyalin natin yung term ng body weakness. Pwede silang magkaroon ng malaise. Okay, yun yung prodromal phase. Again, pag sinabi yung prodromal phase, para lang magsawa ka na sa term na to, guys. Ay, sorry po. Ay, sorry. Yun ang hindi ko pa masyado na-explore. May nagtatanong, bakit po nilalagyan ng vinegar? I would have to read more on that. Okay? Pati yung color blue. Ayan, sige. Aalamin ko yan, guys. Okay na tayo sa slide na to. Okay. After your prodromal phase, syempre, dadating na po tayo sa acute phase. So pag sinabi mong acute phase, yun na yung medyo full-blown na yung mumps as a condition. Okay, basically, we have your mastoiditis. So that's the tender swelling behind the ears. Mastoiditis. Okay, dysphagia. Okay, pwede sila magkaroon ng dysphagia. Pwede sila magkaroon ng parotitis. So yun, wag natin kalimutan yung parotitis. Orchitis, mastitis can even occur. Okay? Ang complication natin dito would be sterility. Sterility or infertility. Okay? As a famous or infamous complication. Okay? Just like any other diseases caused by your virus, it is also self-limiting. Okay? So all of these symptoms, okay, would return to normal in as much as 10 days, okay? In 10 days, babalik na yan sa dati. Okay? Ayan. For the management, guys, liitan ko na lang para makita niyo. Okay? For the management, sabi natin, ang mumps, pwede siyang highly communicable until the swelling disappears. So, papasok pa rin dito lagi yung isolation and bed rest. Okay? Sabi natin kanina, ang mumps caused by a virus. So, ganun pa rin. Symptomatic treatment pa rin tayo dito. Okay? We would also want to encourage more fluids. Soft foods kasi may dysphagia sila, guys. Okay? Painful din yun upon chewing. Okay? We can also apply hot or cold compress sa area na may swelling. Okay? Kapag merong orchitis yung pasyente, you would want to support the scrotum and use cold compress to relieve the swelling, to relieve the pressure, okay, that was felt by the patient. Okay, liitan ko pa ito ng bongga. Okay. Next is the prevention. What about your prevention? We have your active immunization. Ano nga po ulit yung vaccine dito sa active immunization ng mumps? MMR vaccine, walang kamatayan. At ang MMR vaccine, is it a live attenuated vaccine or killed virus? Live attenuated. Therefore, bawal mo siyang ibigay sa immunocompromised patients. Next, passive immunization. Ang mumps by toxin-mediated release, hindi naman, di ba? So, tatanggalin mo na sa choices yung antitoxin. Okay? Therefore, gamma globulin ka na lang dyan. Okay? Ayan. So, basically, that is the concept of your mumps. Again, in a nutshell, guys. Mabubuhay na kayo sa board exam. Kahit yan lang yung alam nyo. Okay? Sige. Next one. Tapusin na natin to. Yay! We have more. Dalawa na lang, guys. Chickenpox. Okay? Chickenpox. Ito, guys, hindi ko na pinapahirapan yung buhay niyo. Okay, nabuhay naman ako sa keywords lang. So, yun yung i-share kong strategy sa inyo. Okay? In fact, guys, okay? In fact, okay, naging big winner din tayo sa time na to. May dulot naman po itong style na to. Okay? So, for your chickenpox, okay, let's start with your causative agent. Lagi tayo magsisimula dito. Kasi, minsan, akala natin, small information lang yung causative agent. Tapos, yun na pala yung itatanong sa board exam. Tapos, hindi mo pa siya masasagot. Okay, sayang yung point. Okay? When you talk about chickenpox, and when you hear the word varicella zoster, iisa lang po sila. Again, chickenpox, varicella, iisa lang po sila. Chickenpox, varicella, iisa lang po sila. Okay, and this varicella zoster is a virus. Okay, it is a virus, just like your measles, just like your mumps. Okay, chickenpox is a virus. Okay, period of communicability. Period of communicability. Again, ito po yung duration kung kailan pinaka nakakahawa ang chickenpox. Sa Tagalog po, bulutong po ito. Okay, so that is from as early as 1 to 2 days, okay, before the rashes appear. Ito yung mga textbook definitions nila. From the rashes appear until the lesions have crusted. Realistically speaking, guys, hindi mo naman readily observable itong as early as 1 to 2 days before the rashes appear. So, dito tayo. Okay, until the lesions have crusted. Yan yung isasagot natin. Kailan daw pwedeng ihalo sa ibang bata ang pasyenteng may chickenpox? Okay, pag yun yung tanungan sa boards, until the lesions have crusted. Kapag wala ka nakitang word na crusted, pwede mong isagot until the lesions have dried. Yan. Kapag natuyo na siya, pwede na yan. Okay, mode of transmission. What is the mode of transmission of chickenpox? Airborne transmission. Okay? Airborne transmission along with your measles, along with your tuberculosis. Airborne po ang chickenpox. Incubation period. Okay? Incubation period, by its definition, okay, first exposure until the appearance of the first symptom. Hindi mo na yan makakalimutan. So that's from 2 to 3 weeks. Okay? 2 to 3 weeks. Yun na yan. Okay, next one. What about the signs and symptoms, guys? Signs and symptoms. Okay. So we have your prodromal stage. That is your prodromal stage. Recap lang, that is all your non-specific symptoms that you could think of. The patient could have a mild fever. Okay. He or she could also have anorexia. Ibig sabihin po na anorexia is lack of appetite. Wala siyang ganang kumain. Okay. Sasakit po ang ulo niya, magkakaroon po siya ng headache. Okay, what else? Pagdating niya po sa acute phase, Pagdating niya po sa acute phase, guys, doon na po lalabas yung rashes niya. Ang description, ang picture, ang definition po ng isang chickenpox rash is just like this picture. Okay? Vesiculo, that is vesiculopustular. Vesiculopustular rashes. Okay? Ano pa? Centrifugal. Centrifugal rashes. So, pag sinabi po centrifugal rashes, okay, balikan muna natin yung itsura ng measles rashes. Pag measles rashes, guys, paano ang progression niya? It starts from where? Yes, sabi natin kanina, face down, head down ang start niyan. Pero in this case, sa chickenpox case, centrifugal rashes daw. So it would begin on the trunk. And when I say trunk, guys, chest and back. Okay, chest and back yan. Okay, trunk in general. Okay, and then would spread peripherally, okay, to the other parts of the body. Okay, sabi daw mas marami daw siya sa covered body parts. In short, sa trunk natin yan. Okay, so isulat ko lang din dito, that is from your trunk and then spread peripherally. Paikot po. Okay, paikot po ang dami ng chickenpox rashes. And just like your measles rashes, basically, napakakati nito, guys. Sobrang kati po niya. Okay. Sobrang kati niyan, okay? In fact, magkakamot-kamot galore yung pasyente. Okay, magsusugat-sugat din yan. Okay, ayan. So watch out for the scars. Next. Okay lang, burahin na natin to. What about the diagnostic test for the chickenpox? Walang specific na diagnostic test, okay, for the chickenpox, no specific. Okay? Then on treatment natin, ang management natin, since we said earlier, the chickenpox is a virus, supportive lang tayo dito. Okay? Supportive, symptomatic, symptomatic manager. Ayan na naman yung highly commendable journal reference mo. Ang mga sabi ng nakakatanda. Ayan. Ang management natin is symptomatic management. Okay. Pero kung gusto mo naman uminom ng drugs, meron din naman tayong drug of choice for this one. Okay. We have your acyclovir. Okay. Itong acyclovir na to, pwede mo siyang inumin orally to reduce the number of your lesions. Pwede mo rin naman po siyang ipahid to lessen the amount of your pruritus. Okay? To relieve the itching, kasi yun yung isang main concern ng patients with chickenpox. To relieve the itching, yes. Okay? Very recommended naman to use a calamine lotion. Okay? To use an antihistamine. Okay? Antihistamine, pwede rin yan. Bath din. Paliguan mo, pwede po silang maligo. To answer your question, Wang, pwede rin po silang maligo, okay? To promote safety and comfort. Kasi very, very uncomfortable feeling din po ang may rashes all over. Okay? Okay lang po silang maligo. Okay? Ano pa ba? Actually, recommended talaga yan to relieve the itching. Okay? And then, highly communicable po ang chickenpox. Therefore, keep the patient in isolation and bed rest for proper recovery. Okay? Next, ano po yung contracturix? Okay? Next, for a patient with chickenpox, recommended po bang bigyan sila ng aspirin, guys? Sige nga. Basahin ko nga yan. Recommended ba silang bigyan ng aspirin for a patient with chickenpox? Yes or no? How about the others? Okay, no. Bakit? Kasi po, ang chickenpox, babalik tayo sa etiology niya. Viral infection po siya dyan. Okay? And when we give aspirin to children with viral infections such as chickenpox, okay, very, very high risk to leading it to develop your Ray's syndrome. Ang Ray's syndrome, guys, anong main organ of affectation niyan? Anong main organ of affectation ng Ray's syndrome? Basically, it would cause your brain to swell, okay? Mamabaga po yung brain natin, and then yung liver affectation natin, it would fail, liver failure. So that's liver and brain, correct. Okay, liver and brain. So never, never, ever give aspirin for patients with chickenpox or for any patients with viral infection. Questions pa more? We're down to the last na, guys. Last na to. Okay? Questions? So, na-discuss na natin kung ano ba yung diphtheria, pertussis, tetanus, poliomyelitis, measles, mumps, chickenpox, okay? Para malaman natin at makatulog tayo na mahimbing, ano ba ang pinagkaiba ng measles at measles na rubiola at German measles na rubella, i-discuss na rin natin ano ba ang German measles. Sabi natin, to begin with, measles and German measles are two entirely different communicable diseases. Okay? Isulat ko lang din po ulit dito. Okay? Sa slide, yung word na rubella para hindi na tayo magkakalimutan ever. Okay? Ang causative agent po ng rubella, biglang nakalimutan. That is our Toga virus. Okay, Toga virus tayo dyan. Okay, rubella virus or your Toga virus which contains your RNA. Okay, ang rubella po guys, isusulat ko lang din dito, teratogenic po siya. So when you say teratogenic, anong ibig sabihin nun? Anong ibig sabihin ng teratogenic? Lagi ko siyang naririnig. Pero parang mom, tagilid, ano po ba yung definition ng teratogenic? Okay, nakakamatay sa fetus if it's really severe complications. Pero yes, it can cause you to have congenital complications, congenital anomalies. Okay? Sobrang fun kasi mas na-appreciate ko yung German measles as a teratogenic nung nanonood ako ng isang palabas sa TV. Nakalimutan ko na if it's MMK or magpakailanman. Pero nakatambay lang ako sa sala nun. Tapos yun yung naka-flash sa screen. Okay? Ang issue is, ang storya is either MMK or magpakailanman, yung nanay, buntis daw siya. Okay? Buntis daw siya. Then apparently, tinamaan siya ng German measles. Okay? Tinamaan siya ng German measles. And as the child was growing old, nilabas niya yung bata, parang normal. Okay, parang walang complication. But then, as the child was growing old, napansin nila, hindi siya responsive. Okay, kinakausap siya, hindi siya lumilingon even. Okay, nang pina-check up nila sa bata, yung sa doktor yung bata, turns out, the child is deaf, the child is mute as a complication of your German measles secondary to pregnancy. Okay, so ganun ka-dangerous yung Toga virus, yung rubella, okay, sa pregnant patients. Okay, kaya naman kapag nagkakaroon tayo ng rubella vaccination, it is advisable na skip muna nung pregnant women or take it after 3 months. Okay, ganun. Okay, next, mode of transmission. Di ba ang galing, learning is everywhere. Parang nanonood ka lang ng TV, tapos may bago kang natututunan. Yes, bawal siya sa first trimester. Okay? Mode of transmission of this German measles. Dito rin sila nagkaiba. Kasi sa measles, airborne siya. Pero sa German measles, ano siya? Droplet lang. Okay? Droplet siya. Okay? German measles, droplet, measles, airborne. Okay? Incubation period. Okay, that's 2 to 3 weeks. That's 14 to 21 days. Okay, period of communicability. Walang kasawaan. Pag sinabi mong period of communicability, the duration in which the patient is highly communicable or highly contagious. Okay, that's during your prodromal period. During prodromal period. Okay, and 5 days now. 5 days after the rash. Okay, 5 days after the rash. So in this sense, wag mo munang palabasin, wag mo munang ihalo. Okay, sa ibang tao, yung batang meron German measles. Okay? If he or she, okay, still have rash after 5 days. Okay? Or within the first 5 days. Ay, hindi mali. 5 days after the rash. Okay? After 5 days na may rash. Okay? Huwag kayong malilito, guys. Okay? That's 5 days after the rash. Okay? Sige. Prodromal stage. Prodromal stage ng patients with German measles. Sabi natin, these are your non-specific symptoms. So, ganun pa rin. We have your mild fever. Okay, we have your malaise. You can also have your headache. Headache, coryza. Pwede yan. rhiza, then sore throat. Pwede rin silang magkaroon ng sore throat. Okay? Ang mild fever, guys. Itong mild fever would disappear once the rash appears. Okay? Would disappear once the rash appears. Ano po yung sa pregnant? German measles. Ito pong German measles, teratogenic po ito. Okay? So if the pregnant woman catches German measles, highly likely na it could cause harm to the fetus. Okay? Nasagot ko po ba yan? Okay. What else? Under your prodromal stage. Under your prodromal stage, dito rin natin makikita yung tinatawag na Forsheimer spots. Okay, Forsheimer spots. I'm sure you've heard of this before. When you say Forsheimer spots, para po siyang complex spots. Okay? Pero ang pinagkaiba nila is that kapag measles at complex spots yan, sabi daw whitish daw siya with a reddish base. Okay? Pero nakita mo yung rash or yung Forsheimer spots na ito. This is basically red and pinpoint siya. Red pinpoint patches. Okay? Red pinpoint patches sa oral cavity. Sa bibig din po yan makikita. Okay? Sa bibig din po siya makikita. Okay? Ano pa? Sa acute phase. Acute phase ng German measles. Ito na po ma-appreciate yung rashes. At ano po ang feature ng rashes ng German measles? We have your faint maculopapular rashes. Faint maculopapular rashes. When you say faint, guys, when you say faint, okay, kapag po pinindot mo yung area ng skin na merong rashes, okay, mag-fade po siya sa pressure. Kaya siya faint maculopapular rashes. Okay, ganun. Purahin ko na to, guys. Diagnostic test. Mali is body weakness. Mali is just the other term for your body weakness. Pinasosyal lang siya. Okay? Diagnostic test, rubella titer. Sabi daw, ang rubella titer daw, the normal value for your rubella titer is 1:10. So in that sense, kapag ang isang pregnant woman ay nagpa-rubella titer, okay, at ang result niya is 1:8, highly susceptible ba siya to rubella? Yes or no? Highly susceptible po ba siya? Yes or no? 1:8 yung result. Meron po bang style ng paglabas yung rashes na German measles, like the measles and chickenpox? None in particular. Okay, none in particular. Okay? Yes, highly susceptible po ang babaeng buntis na ang result ng rubella titer niya is 1:8. Kasi that's below 1:10. So below 1:10, highly susceptible to having rubella. Okay? So, vaccine. Ano active immunization natin dito? MMR pa rin. MMR vaccine pa rin. Okay? Ang MMR vaccine, is it a live attenuated virus or a killed virus? Okay, buhay po siya. Therefore, avoid giving MMR vaccine to immunocompromised patients. And this, okay, MMR vaccine, okay, is derived from your chick embryo. Therefore, kung gawa siya sa chick embryo, tapos may allergy ang isang tao sa eggs, okay, contraindication yan. Okay, huwag kang magbibigay ng MMR vaccine sa taong may allergic sa eggs. But if that certain patient has to have MMR vaccine, okay, if necessary, you still have to give your MMR vaccine but in divided doses. Parang kanina lang, kapag meron kang allergy sa vaccine, tas kailangan mo siyang ibigay, okay, give it in divided doses. Tas kung hospital naman ang setting natin, prepare your epi, okay, at the bedside. Okay, yes, to lessen the dosage. And some would prepare the antihistamines as a pre-med, okay, pero hindi naman siya ganung kasupported with the evidence. Okay, sige. Do you have any more questions? May Tagalog po ba ang German measles? Feeling ko meron na hindi lang ako aware. Alam niyo ba yung Tagalog ng German measles, guys? Sige, balik tayo doon sa chickenpox. Exclusive lang po ba sa bata ang chickenpox? Yes or no? No. Therefore, kung wala ka pang chickenpox at tumanda ka na, pwede ka pa rin magkaroon ng chickenpox. Okay? Pwede ka pa rin magkaroon ng chickenpox. Chickenpox. In fact, guys, when you acquire chickenpox in your later ages in life, okay, it could have further complications. Kaya yung iba, which is not really recommended practice, yung ibang parents, ina-expose yung anak nila sa taong may chickenpox para magkaroon na sila ng chickenpox bata pa lang. Okay, pero hindi siya recommended. Okay. Sabi daw nila, tigdas hangin daw ang German measles. Okay. So, tigdas hangin daw German measles. Okay, sige. Noted. Other questions? Ang chickenpox, kapag nagkaroon na po ako ng chickenpox nung bata pa po ako, pwede pa po ba ulit ako magkaroon? Yes, pwede pa po ulit ako magkaroon ng chickenpox. Pero hindi na po chickenpox ang tawag doon. Shingles na po siya. Okay? Shingles na siya. And in that sense, mas grabe rin yung complication ng shingles as compared to your chickenpox. In fact, ang affectation ng shingles is CNS affectation yan. You can also have paralysis kapag meron kang shingles. Okay? Ano po ang mas nakakahawa? Chickenpox or shingles? It would be the chickenpox. Okay? Mas highly communicable ang chickenpox. Any food na bawal? Saan po? Dito sa chickenpox? Wala nga sa GM or chickenpox. Wala masyadong bawal na food na parang absolute bawal. Pero ina-avoid lang. Okay? Ina-avoid lang yung mga ganyang malalansang food, oily food, spicy food. Bakit po? Kasi ang iniingatan natin dyan is yung rashes, okay, sa mouth area. Okay? Masakit yan, makati yan. Ngayon, kapag na-trigger mo yung or kapag tawag doon, sensitive kasi yung skin na yan. Okay? Ngayon, kapag kumain ka ng mga spicy, oily, okay, fatty, okay, it could react. Baka mag-react yan. Tapos dumami pa yung rashes even. Okay. So, ina-avoid lang. Nire-recommend lang to avoid. Questions? We reach the end of our parang kulang. Oo, ito na yun. Sige, we reach the end of our lecture for this day, IMCI and communicable diseases. Meron po tayong post-test. We prepared a post-test for you para lang malaman natin kung may nakuha pa tayong bagong information. Okay? Kaya bang sagutan ng 25 minutes? Ma'am, nakapost na po ba yung post-test nila?
Yes, ma'am, posted na po.
Okay po. Thank you po. Guys, balik tayo after 25 minutes. If may convulsion po with vomiting, okay, convulsion during the phase na merong chief complaint yung patient, pink yun kasi consider natin siya as general danger sign. Okay? Ready na guys? Pwede na tayo mag-explain, mag-ration ng answers for the post-test. Mabilis na lang to guys. Okay na po? Okay, sige. Balikan ko lang yung mga pahabol questions. And meron nagtanong kanina with regards to German measles. Kung may pattern daw ba ng occurrence, ng appearance ng rash ng German measles. And I would have to stand corrected. It can be the same with the measles pattern. So from face down pa rin po siya. Okay, so yung pattern po ng appearance ng rashes ng German measles would be from face down. Okay, sabi nila, as they say according to the references, German measles is relatively milder form of your measles. In fact, it is called the 3-day measles. Okay, bakit to? Kasi after 3 days, magre-recover na yung patient from the rashes. Okay, so I hope na clear natin yung question na yun, na-clarify natin. Meron pa po, wala po bang passive immunization for the German measles? Meron po, still immunoglobulin. You can still give your immunoglobulin as a passive immunization for your German measles. May nagtanong din po, sa IMCI concept, what if po the child is vomiting with lethargy? Anong color po yun? Is it color yellow? Still, it's color pink. Okay, babalik tayo sa principle ng IMCI. Basta any of the general danger signs, kahit isa lang po doon yung nag-appear, which is lethargy, okay, consider mo na siya as pink. Okay, yan, sige. Share screen ko na. Ay, wait lang. Saan ba? Wait lang. Yan. Check na lang. Ay, wait lang po ah. Yan. Okay, sige. Let's start. Number 1. Okay. Number 1, the following are classified under general danger signs. Which one is the exemption? Okay. I-highlight natin yung keyword natin ang tinatanong is general danger signs. And then, i-highlight mo rin po ito, exemption. Asan dyan, among the choices, ang hindi natin napag-usapan. So, that's your letter C, choking. Wala tayong napag-usapang choking dyan. So, kung hindi po pala choking, yung hinahanap natin as a general danger sign. Okay? Ano pa po yung isa pa? That is your vomits everything. Okay, should be vomits everything yan. Okay, next, number 2. If a child has any general danger sign and or stiff neck, he's under the red classification of what illness? A stiff neck, parang isang beses lang natin siya nakita. Sa ang table po yun, letter C, malaria. So number 2, that's letter C. Number 3, what is the appropriate treatment for this child? For this child pertaining to question number 2, which is malaria, that's letter C, give first dose of quinine, that's IM. Okay, first dose of quinine, IM, that's letter C. Number 3, that's letter C. Number 4, if the child has no colds, no measles, and other causes of fever, but has malaria risk, this could be identified as. Okay, so paano natin ito i-analyze? Okay, no other causes of fever. So, yes, may fever siya. And then, may malaria risk daw sa area nila. Okay, anong table yung titingnan mo? Letter C, fever, no malaria under your green classification. Okay, medyo mababa po yung score ko dito sa post-test. Okay lang yan. In fact, mas okay kapag mas mababa yung scores nyo. Kasi as you go along, tas inulit nyo sagot-sagutan tong post-test na to, mapapansin nyo yung improvement sa scores nyo. So, okay lang na mababa kayo ngayon. Okay? Nasa refresher pa lang din naman tayo. Okay? There's always more room for improvement for you guys. Okay, number 5. Fast breathing for children, 2 months up to 12 months old. Pinag-usapan din natin to, that's letter boy, 50 breaths per minute. Okay, 50 breaths per minute. Fast breathing for children ages 12 months up to 5 years old. Ito, medyo bata na talaga yung pasyente natin. So that's letter C, 40 breaths per minute. Okay, number 6, that's letter C, 40 breaths per minute. Number 7, what's the color classification of a child with chest in drawing or fast breathing? Okay, that's letter boy, yellow classification. Okay, 7 is letter boy, yellow classification. Number 8, what is the general antibiotics of choice for illnesses under color red? That's letter C, ampicillin. Updated ba yung question? Letter C is ampicillin. Tama ba? Sa copy nyo. Wala sa choices yung ampicillin. So sige, dahil dyan, ibubonus natin to. Okay? Ito, baka hindi ko nabigay yung updated na. Ito po yung update. Sige, i-bonus natin siya guys kasi wala sa choices yung ampicillin. Okay, so number 8, that's supposedly ampicillin po. Okay, or kapag hindi nyo po nakita yung ampicillin, that's gentamicin. Okay, so ampicillin or gentamicin. Number 8 is bonus. Okay, number 9, what is the general antibiotics of choice of illnesses classified under color yellow? That's letter apple, amoxicillin. Amoxicillin. Nakalimutan niyo pa yan. Number 12, if child has no signs of pneumonia or very severe disease, he is under the green classification, which is letter C, cough or colds lang yan. Okay, cough or colds lang yan. Ito yung sinasabi ko na kapag pinaghalo-halo na po siya sa multiple choices, nakakalito na. Kunwari, medyo convincing yung letter boy na no pneumonia. Pero binalikan natin yung lecture, wala naman tayong nabanggit na no pneumonia. Okay, it's letter C, cough or colds. Okay, 10 letter C. 11, 2 of the following signs are considered severe dehydration. I-highlight mo yung keyword natin, which is severe dehydration. Okay, and apparently, select all that apply question po ito guys. Okay, wala tayong ibang strategy na gagawin kundi ang patience. Tsagain natin to guys, isa-isahin natin. Okay, number 1, lethargic or unconscious. Severe dehydration ba yan? Yes. Okay, so i-highlight natin yung mga gusto nating isagot. Number 2, cannot open eyes. Napag-usapan natin to guys, walang ganito. Okay, walang ganito. Babuyin mo na yan sa questionnaire mo. Number 3, sunken eyes. Yes, isama natin yan. Number 4, drinks eagerly. Ay, may nabasa akong drinks eagerly, pero hindi siya under severe dehydration. Okay, so in this case, i-cancel mo na yan. Babuyin mo na siya. Number 5, elastic skin trigger. The very fact na may elastic skin trigger si baby, baka wala siyang dehydration. Okay? So, burahin mo na rin to guys. Kung ano lang po yung highlight natin, yun lang yung sasagot. Okay? That's number 1 and 3. Asan po sa choices? Okay, yung 1 and 3, that's letter dot. 1 and 3. Ayun. So, nawali ka dito sa number 11. I-analyze mo, okay? Analyze the questions very, very carefully, okay? Baka nag-overthink ka dun sa part na yan. Okay, number 12. 2 of the following signs are considered some dehydration. Okay, 2 of the following signs, some dehydration naman na po ang tinatanong. Okay, number 1, lethargic or unconscious, hindi po yan some, severe po yan. May error po sa J-forms. Sa question na to, wala po. Pero yung number 8 kanina, bonus yan. Number 8 is bonus. Okay, cannot open eyes, wala tayong ganyan. Sunken eyes, yes, isama natin yan. Number 4, drinks eagerly, yes. In fact, the child is very thirsty. So, i-highlight natin yan, kasama yan. Number 5, elastic skin trigger. The very fact ulit na may elastic skin trigger siya, ibig sabihin, baka wala siyang issue sa dehydration. Okay, so ano lang yung highlight natin, yun lang yung hanapin sa multiple choices. That's 3 and 4, that's letter C, 3 and 4. Yan. Number 3 or number 12 rather, that's letter C, 3 and 4. Number 13, what plan would you use as a nurse if a child is classified under severe dehydration? Ito na nga ang sinasabi natin kanina, mga ma'am, sir. Okay, that's letter C, plan C. Number 13 is plan C, letter C, for severe dehydration. Number 14, which color classification is dysentery considered? Oh, photographic memory, yung dysentery na sa pinakababang slide, part ng slide. Tapos wala namang color green doon, so that's color yellow, letter boy. Okay, 14 is letter boy, color yellow. Again, 14 is boy, color yellow. Number 15, what is the symptom that must be seen in a child with dysentery? Okay, i-define mo lang po, i-describe mo lang po. Ano po ba ang dysentery? That's letter dog, blood in the stool. Okay, 15 is letter dog, blood in the stool. Number 16. What is the treatment given to a child with dysentery? You have to give ciprofloxacin for 3 days and then follow up in 3 days. Kapag po naubos itong gamot na ibinigay ko sa inyo, mother, balikan mo ko. Okay, and dito ako sa health center. In 3 days then. Okay, so 16, that's letter C. 16 is letter C. Number 17, what can be observed in a child with severe complicated measles? Ito na nga tayo guys. Severe complicated measles. I-highlight natin yan. Alam natin na ito po ay under pink classification. Isa-isahin natin yung criteria. Memorize na natin to guys. Any general danger sign, number 1. Number 2, ang eksaktong nakasulat na kasabi doon ay clouding of the cornea. Okay, the third one is the deep or extensive mouth ulcers. Okay, yun yung gusto mong isagot. Kasi sinabi sa lecture kanina, kung ano yung hinanap mo or nabasa mo sa booklet na IMCI, yun dapat mismo ang lalabas sa choices. Tapos, inaway mo yung choices kasi walang ganong-ganong lumabas. Okay, ang gagawin po natin dyan guys, ang strategy po, if alam mo yung sagot, yung dapat mong isagot, pero hindi mo siya nakita sa choices. Okay? Bawal pong awayin ang proctor sa actual board exam. You just want to choose the closest answer. Again, you choose the closest answer that was given among the choices. Okay? Asan dyan yan, guys? That's letter boy. Any general danger signs? Pus draining from the eye and mouth ulcers. 17 is letter boy. Mag-settle na tayo dyan, guys, kesa wala tayong isagot. Okay, 17 is letter boy. Number 18, if the child has pus draining from the eyes or clouding of cornea, what should you as a nurse do under IMCI? That's letter E. Apply tetracycline eye ointment. Okay, 18 is letter apple. 18 is letter apple. Number 19, if the child has extensive or deep mouth ulcers, what should you do as a nurse under IMCI? That's letter apple. Treat with gentian violet. Treat it with gentian violet. Number 20, mastoiditis is under what color classification? Guys, alaw na rin natin to guys. That's letter pink. 20 letter apple, pink. 20 letter apple, color pink. 21, i-define mo lang, i-describe mo lang, ano po ba ang mastoiditis? Basically, that's letter C, tender swelling behind the ear. 21 is letter C. 21, that's letter C. 22, maraming ganong tanong sa boards, okay? Either ibibigay nila sa'yo yung term, tapos hahanapin mo sa choices yung description ng term na yun, or sila ang magde-describe, tapos ikaw ang maghahanap sa choices kung ano yung term na hinahanap natin. Okay? Number 22, what is the green classification of ear? Problem. That's letter apple. No ear infection. 22 is letter apple. No ear infection. Number 23. You have observed pus draining from the ear of the child and the mother reported discharge has been less than 14 days. Ito yung highlight, yung keyword na kailangan mong i-highlight. Okay, yung chronicity ng pus natin sa tenga. Okay, this can be classified as letter C, acute ear infection. Naka-wrong po yung acute ear infection. Guys, bonus na naman to guys. Ganon. Letter C po ang tamang sagot. Okay, letter C ang tamang sagot. Okay lang yan. At least nalalaman natin dito yung final answer. Okay, add nyo na lang sa scores nyo. Okay, so 23, that's letter C. 24, antibiotics used for ear infection under IMCI. That's letter D. Quinolone. Okay, quinolone, ear drops. Ear drops yan. Okay, quinolone, ear drops. 25, which feeling ko mali ulit. Okay, what does IMCI stands for? Integrated Management of Childhood Illness. Okay, kung ito yung sinagot ninyo, tas mali kayo, okay, i+1 yun na lang. Ito yung tamang sagot. Okay, wala na pong ibang sagot. Okay, so 25, that's Integrated Management of Childhood Illness. Sa kamamadali po, disease po yung nalagay. Saan banda? Naging IMCB. Okay, illness tayo dyan. Okay? Yun, be very, very careful in answering. Okay? We would want to answer as quick as possible, but at the same time, dapat tama. Okay? So 26, tuberculosis is under black precautions and will always wear black when providing patient care. That's letter dog, airborne, and N95 mask. 26 is letter dog. 26 is letter dog. Number 27, bodily fluids such as tears, sweat, or urine of patient taking this drug will cause it to turn orange. That's letter C, rifampicin. Okay, letter C, rifampicin. Number 28, damage to hearing is one of the adverse effects of this TB drug. That's letter apple, streptomycin. Okay, streptomycin. Ototoxic drug po ito. Ang ethambutol, may adverse effect din po siya, guys. Okay? Letter E nag-start ang ethambutol. So yung adverse effect niya, letter E rin po siya nagsisimula. Okay? So eye complication, more specifically, eye complication, please think about the optic neuritis. Okay, pag walang optic neuritis, baka may blindness, okay rin namang isagot yan. Okay? Yung isoniazid, guys, okay, may complication din yan. Okay? Liver toxicity. Okay? Hepatotoxic yan, guys. Okay? Next, number 29. Which diagnostic test is definitive for tuberculosis? Alam na rin natin to, guys. Sputum culture. Okay? Sputum culture. 29 is letter C. 29, letter C. Yung 30, guys, feeling ko mali din sa answer key ninyo, but polio basically is a disease caused by letter boy, virus. Okay, 30, letter boy, polio is a virus. Bakit tamaan na lang po? Plus point. Yay, plus points. Okay, 31, what is the other name for rubella? Ito, hot question talaga to, guys. That's letter boy, German measles. I would assume, hopefully, sana tama kayo dito, guys. But number 31, okay, para walang confusion. Again, ang German measles, clarify ko lang yung sagot natin kanina, I stand corrected. Okay, ang pattern of appearance ng German measles rash is same lang din sa measles, which is from face down. Okay, and then milder form ito ng measles. Actually, ang tawag sa kanya is 3-day measles because after 3 days, you would expect na mag-fade na ulit yung rashes niya. Okay, so number 32. Helpful yung dalawang L, right? Number 32, what should the nurse expect to observe in a prodromal phase of rubiola? Okay, of rubiola, we know that this is measles. Okay, that's letter boy, Koplik spots. 32, that's letter boy, Koplik spots. 33, pathognomonic sign of Forsheimer's spots can be seen in letter dog, German measles. Naglag, letter dog, German measles. Okay, 33, that's letter dog, German measles. Number 34, this is a red pinpoint patches on the oral cavity. Nakita niyo yung picture kanina sa slide, di ba tuldok-tuldok na color red? That's your Forsheimer spots. Okay, 34, that's letter C, Forsheimer spots. Okay, 35, which intervention is appropriate for a child who has crops of lesion on the trunk that appear as a macular rash and vesicles. Ito yung sinasabi ko, guys. Pwedeng ibigay ng BUN yung description, tapos kayo po ang mag-identify kung ano yung tinutukoy ng BUN. Okay? In this case, okay, the BUN is talking about your varicella. Varicella tayo dito. Therefore, ano daw po ba ang treatment mo for your varicella? That's letter apple. Place the child in strict isolations, airborne and contact precautions. 35, that's letter apple. 36, at what point is a child with varicella no longer contagious? After the last lesion has broken open and crusted over. 36, letter C. 36, letter C. 37, individuals who contracted varicella zoster in childhood may experience which of the following if the virus is reactivated later in life. May nagtanong kanina, once in a lifetime disease lang po ba ang chickenpox? Hindi po. Pwede mo pa rin po siyang makuha, okay, as you turn into your adult stage, okay, pero shingles na siya. 37 is letter boy, shingles. 37 is letter boy, shingles. 38, what teaching should the nurse provide to a client receiving tetanus toxoid? Okay, alam natin na ini-inject ang tetanus toxoid. Therefore, letter boy, soreness at the injection site is a common reaction. 38, letter boy. 38 is letter boy. 39, pertussis is being communicable, during which stage of disease? That's 39, letter apple, catarrhal stage. Okay, 39 is letter apple, catarrhal stage. Number 40, the mother of an infant with pertussis should be instructed of the following except. Okay, i-highlight mo yung keyword na tinatanong sa atin, which is pertussis. I-highlight mo rin po yung word na except kasi mabilis ma-overlook yan sa board exam. Na-excite tapos nakalimutan na yung word na except. Mali ka tuloy. Okay? Pag nabasa mo yung word na except, lagay mo agad sa tabi yung negative sign para alam mo kung anong hinahanap mo. Okay? So, kunwari, sasabihin mo sa sarili mo, lahat ng nasa choices, tama. Pero ang hinahanap ko kasi is something negative. So, yung mali yung hanapin ko. That's letter boy. Feed the child during an attack. Which is mali nga naman talaga. Bakit? Kasi prone to aspiration and the patient could even vomit. Okay? Susuka niya lang yung ibibigay mo. Umuubo nga siya, mami. Okay? 40 letter boy. 40, that's letter boy. Number 41, Klebsiella bacillus is the etiologic agent of which communicable disease? That's letter C, diphtheria. 41, that's letter C, diphtheria. Again, 41, letter C. Kung wala pong Klebsiella, pwede naman rin po yung Corynebacterium bacterium, okay, diphtheria. 42, a child is diagnosed with dengue fever. The etiologic agent for dengue hemorrhagic fever, that's letter apple, chikungunya virus. 42, that's letter apple. 42 is apple. 43, preventive measures for malaria. Least likely include. Okay, ito pong phrase na to, guys. Least likely include. Parang magkapatid sila ng word na except. Okay? Kung baga sa choices, ito yung hindi mo isasagot kasi mali siya. Pero since least likely include yung hinahanap, yun yung isasagot natin. Gets nyo ba? Okay? Lagay natin sa tabi yung negative side. Okay. That's letter boy. Wearing of clothing that covers the arms and legs at daytime. Remember, ang disease natin is malaria. Okay, malaria yan. Okay, ano yung nagmamali? Option letter boy, yung word na daytime. Kasi, instead na daytime, dapat po ito ay nighttime. Kasi, yung mga lamok po ay sa gabi nila trip kumagat ng mga tao. Okay, hindi sa umaga. So, that should be at nighttime rather. Okay, so 43, that's letter boy. 43, that's letter boy. Number 44, Rumpel lead test for DHF is positive when letter dog, 20 or more petecave per 2.5 cm square are observed. So 44, letter dog. 45, a person who harbors the microorganisms but does not manifest the signs and symptoms of the disease is called letter dog, carrier. Okay, dinescribe sa iyo yung term, hahanapin mo sa choices yung hinahanap nating term. That's letter dog, carrier. Okay, 46, DSSM is primary diagnostic tool in tuberculosis case finding. Which of the following conditions does a DSSM is contraindicated? That's letter C, hemoptysis. Okay, hemoptysis. Siyempre guys, kapag ang ibinigay mong dahak ng pasyente ay may dugo, okay, pwede mag-debate yung results nun. Okay, so 46 letter C. 46 letter C. Ang Rumpel lead test natin, para siyang tourniquet test din yan. Okay, / tourniquet test. Okay, sa dengue concept. Okay, next. 47. Prodromal period is best described as, that's letter dog, premonition of an impending attack of a disease. Okay, 47, that's letter dog. 48, ay naulit. Pertussis is being communicable during which stage of illness? That's letter apple, catarrhal stage. 49, individuals who contracted varicella zoster. Okay, that's letter boy, shingles. And 50, polio caused by a virus. Again, kapag meron po kayong corrections, pakisabihin na lang po yung staff para madadagdag nila sa scores. Okay, any more questions? Questions, guys? Okay, sige. Let me stop sharing now. And let me tell you this, guys. 36 lang po. Uy, mataas na yon. Okay? Ay, sige. Last na. Wait lang po ah. Mabilis lang. 1 and 4, CC. 1 and 4, CC po. Okay? Sabi ko kanina, guys, we don't really have to punish ourselves for the things na kaya namang gawan ng paraan. Okay? Yung mga ganito na nagpo-post test tapos nakikita na ay 24/50 lang ako or 17/50 lang ako. Tapos nadi-discourage na. Tapos ayaw na mag-review, ayaw na mag-aral, tatama rin na. 28/50. Okay, okay lang yan guys. Kasi the very fact na nasa refresher phase pa lang tayo, nagsisimula pa lang tayo. Okay, this is the perfect time for us to gather as much information that we needed or that we need for the board exam. Kasi napakarami pa pong exam na ibibigay sa inyo, okay, ng top rank. Okay? Kung ganyan po yung mindset natin towards the low scores, okay? Hanggang dulo yan, hanggang magtitake ka ng board exam, negative yung mindset mo. So, whatever your score would be, okay, kung over 50 or over 100, tapos hindi mo na-reach yung passing score, okay lang yan guys. Mag-focus ka sa ratio, intindihin mo kung bakit yun yung tamang sagot. Okay? Because at the end of it all, hindi natin alam kung ano yung lalabas sa board exam. Paano kung yung mga natama mong sagot, yun yung very same set na lumabas sa board exam mo, edi nag-top ka pa. Okay, so my point is, do not focus your attention so much on the physical score itself. Okay, kasi ang score lang yan. Okay, nagtitake tayo ng test for us to measure kung ano pa yung kailangan mong intindihin, kung saan ka pa mas kailangan mag-brush up ng concepts. Okay, so again guys, motivation lang din ang key and confidence lang din ang key para pare-parehas po tayong umangat, para pare-parehas tayong pumasa at mag-top sa board exam. Okay, what else? I would like to say thank you and congratulations for finishing this lecture. Guys, happy Friday po sa ating lahat. Please, nag-extend na po ako and sorry, okay? So after this, magpahinga na po tayong lahat, okay? Pahinga na po after this, okay? Please celebrate this day, enjoy the rest of the day po. Thank you so much po. Thank you everyone. Thank you po. Thank you guys. Thank you ma'am. Thank you po.
Thank you, Ma'am JD. Thank you po.
Ingat po tayo. Thank you po.